distinguished guests, lawmakers, local government units, members of the academe, researchers, private sector representatives, entrepreneurs and stakeholders, friends from the media, and everyone in the virtual world. Welcome to the 6th National R&D Conference, or NRDC. To start the event, may I request everyone to please join us in the singing of the Philippine National Anthem. Good morning, everyone. I am Daan of the DOST Philippine Council for Industry, Energy, and Emerging Technology, Research and Development, or DOST PSHERD, and I am honored to be your host. Today, in every island in our archipelagic nation, we have experienced the unexpected shocks of the pandemic. It has been threatening not only our government, but our lives, careers, businesses, physical and social relationships with our loved ones. It has defined the new normal and the way we transact locally and globally. And amidst this pandemic, science and technology has once again been highlighted as a major solution to saving lives and stabilizing economies. It holds the key to the transformation of the Philippines during the pandemic and beyond. In this year's 6th National R&D Conference, or NRDC, the theme is Pananaliksik at Pagpapaunlad, Daan, Tungo sa Pagbangon. We will highlight the R&D projects, programs, technologies that contributed to the 4Ks: kalusugan, kabuhayan, kaayusan, at kinabukasan, the government's whole-of-nation approach to recovery from the pandemic. We at the DOST are pleased that all the government funding agencies have joined us in this event in showcasing the R&D outputs in the areas of health, agriculture, industry, energy, and even in social science. We are glad to be joined by many participants all around the country. We are live in Facebook, also in YouTube, and of course, here in Zoom. So we would appreciate to hear from you. Can you just type in the Zoom chat box or in our comment section in Facebook Live and also in YouTube where you are watching from right now? We would appreciate that. And to start off, we would like to acknowledge the following participants who made time and effort to attend the 6th National R&D Conference. We would like to greet the Office of the President, the Presidential Management Staff. Magandang umaga po sa inyong lahat. Also from POPCOM, Puerto Princesa, Palawan, University of Southern Mindanao. We are also joined by CDA Region 7, Iligan City, NRCP Member Division 7, Cebu Technological University. We are also joined by PEZA, Batangas State University, SDO Pagadian, Zamboanga Peninsula, MSU IIT. Also from Leyte, hello po, magandang umaga po sa inyong lahat. From University of San Agustin, also joining us from DOH Drug Treatment and Rehabilitation Center, MMSU Region 1, Zamboanga City, Punong-puno po tayo mula Luzon, Visayas at Mindanao. DOST Central Office, of course, our DOST family there. Northern Luzon Adventist College, DOST FPRDI. We also have from Baguio, University of San Carlos, Cebu, Zambales, Philippine Carabao Center. Madami pa po, NEDA. Nandito din po ang mga taga-Agusan del Sur, Negros Oriental State University, TIP, Tarlac, and DOST 7, BIFAR, Bicol Region General Hospital, and also we would love to acknowledge and thank the support of the USAID Stride led by their Chief of Party, Dr. Richard Abendan, and the list goes on. Maraming salamat po. Thank you for joining us this morning. And without any further ado, ladies and gentlemen, to formally open this event and to give the welcome remarks and the overview of this year's NRDC, let us all welcome the DOST Undersecretary for Research and Development, Dr. Rowena Cristina L. Guevara.
Hindi po, ma'am eh.
Oo naman. Yes.
Hindi po. Hindi ko po alam.
Paano natin mapapanatili ang seguridad sa pagkain, gamot, at iba pang pangangailangan? Paano natin maiingatan ang ating pamilya laban sa mga sakuna na maaaring dumating? Ang sagot sa lahat ng mga katanungan na nabanggit, innovation, na dulot ng Research and Development o R&D, ang makakatulong sa atin sa pagbangon mula sa pandemya at mga sakuna na posible nating harapin. Ipapakita namin sa inyo ang mundo na kayang hubugin gamit ang R&D na ginagawa ng ating mga Pinoy scientists, engineers, at researchers. Tunghayan lahat ng ito dito sa 2021 National Research and Development Conference. Nung nagsimula ang bagong milenyo sa layuning maisaayos ang Philippine Innovation Landscape, nagpulong ang mga ahensya ng gobyerno na kinabibilangan ng Department of Science and Technology, Department of Trade and Industry, Commission on Information and Communications Technology, Department of Education, Department of Agriculture, National Economic and Development Authority, at Commission on Higher Education, kasama ang academic at industry sectors, pati na rin mga civil society organizations upang magawa ang Philippine National Innovation Strategy o ang tinatawag na Philippinovation. Ang Philippinovation ang mag-uugnay sa lahat ng proyekto ng pamahalaan na may kinalaman sa innovation. Ang DOST naman ang nanguna sa paggawa ng Harmonized National R&D Agenda o HNRDA noong 2013. Gumamit ang HNRDA ng problem-focused approach para itaguyod ang multidisciplinary at multi-institutional R&D collaboration. Noong 2017, sa gabay ng iba't ibang sektor, minabuting i-focus ang HNRDA sa 5 sektor: basic research, agriculture, aquatic and natural resources, industry, energy and emerging technology, disaster risk reduction and climate change, at health. Ang HNRDA ang nagsilbing pintuan ng patuloy na suporta ng DOST sa iba't ibang R&D at teknolohiya, kasama na ang para sa agricultural productivity at value adding. Bilang halimbawa, meron tayong mga technologies para sa aquatic at terrestrial sources. Sa aquatic sources na na-develop ng DOST Philippine Nuclear Research Institute o PNRI, ang tinatawag na Irradiated Carrageenan Plant Growth Promoter. Base sa mga pag-aaral sa paggamit ng PGP, tumataas ang rice yield ng 15 to 30%. Pagdating naman sa health sector, naging napaka-importante ng R&D sa laban ng bansa sa COVID-19. Upang matulungan ang local government units, kumuha ang DOST ng mga teknolohiyang tumutulong sa COVID-19 detection at data management. Ang FASTER o Feasibility Analysis of Syndromic Surveillance using Spatio-Temporal Epidemiological Modeler ay unang ginamit para sa dengue, typhoid fever at measles. Ito ay nire-purpose upang maging akma sa surveillance ng pagkalat ng COVID-19 sa ating bansa. Pagdating naman sa detection ng karamdaman tulad ng COVID-19 at dengue, meron na tayong Gen Amplify COVID-19 RT-PCR Detection Kit at Biotech M Dengue Kit na nagbibigay ng real-time detection ng mga naturang karamdaman. Bukod dito, ang DOST Philippine Council for Health Research and Development o PCHRD ay patuloy na itinataguyod ang Tuklas Lunas Program. Layunin ng programang ito na linangin ang kakayahan ng ating mga researchers na makadevelop ng mga world-class medicines mula sa yaman ng Philippine biodiversity. Ang pangunahing tinitingnan ng programa ay mga herbal drugs at ang mga maaaring magawa mula sa ating marine and terrestrial sources. Malaki din ang ambag ng R&D pagdating sa industry at emerging technologies. Sa pamamagitan ng DOST Metals Industry Research and Development Center o MIRDC, ay tatag ang AMCEN, isang world-class hub for additive manufacturing kung saan pwedeng gawin ang mabilis na fabrication ng iba't ibang klase ng 3D objects. Samantala, ang DOST Philippine Textile Research Institute o PTRI ay nakagawa ng Rewear Face Mask. Ito ay gawa sa water-repellent fabric na may inner layer na absorbent fabric. Ang Rewear ay gumagamit ng water-repellent textile finishing technology sa ilalim ng DOST PTRI Smart Textiles R&D Program. Sa ating ding pagpupunyagi, nasimulan ng DOST ang pag-develop ng sarili nating space technologies sa tulong ng Advanced Science and Technology Institute o ASTI at Philippine Space Agency o PhilSA. Ang PhilMicrosat program ang kauna-unahan nating initiative sa paglinang ng ating kakayahan pagdating sa small satellite technology. Isa pa sa mariing pinagtutuunan ng DOST ay ang pagpaparami ng ating scientific community workforce. Patuloy na nagbibigay ng scholarship ang DOST sa ating mga undergraduate students, maging sa mga graduate students na gustong lubos na mahubog ang kanilang kaalaman sa larangan ng siyensya at teknolohiya. Isa pang programa ng DOST na naglalayong mapalawig ang STI sa bansa ay ang Balik Scientist Program na humihikayat sa ating mga kababayan sa ibang bansa na bumalik sa Pilipinas para magbahagi ng kanilang kaalaman. Ang mga eksperto natin dito sa bansa ay hinihikayat din namin maging kabilang ng DOST. Nais kong ipaalam sa inyo na kapakailan lamang ay inaprubahan ang Science and Technology o S&T Fellows Program. Layunin ng programang ito na lalong palakasin ang human resource capacity ng DOST. Ang mga mapipiling S&T Fellows ay makikibahagi sa conceptualization, policy at funding development, maging sa monitoring evaluation ng iba't ibang programa at proyekto sa R&D ng ahensya. Naniniwala kami na dapat tayong mamuhunan sa ating mga eksperto at innovators upang makamit ang matibay at matatag na tagumpay sa larangan ng siyensya at teknolohiya. Bukod sa trabaho, ay layunin din ng DOST na magkaroon tayo ng pasilidad na susuporta sa proyekto ng ating mga Pinoy scientists. Nakakasa na rin ngayon sa Kamara ang batas para sa Virology and Vaccine Institute of the Philippines o VIP. Ang disenyo ng pasilidad na ito ay base sa existing World Health Organization guidelines sa pag-establish ng virology laboratories in compliance sa biosafety at biosecurity protocols. Sa kasalukuyan ay may 7 balik scientists na virology na kasapi nito. Kasalukuyang isinusulong ng DOST ang Science for Change Bill na binuo upang paigtingin ang R&D sa ating bansa nang sa gayon ay makasabay ang Pilipinas sa bilis ng pag-unlad ng mga teknolohiya at innovation na kakailanganin natin para pumantay sa pandaigdigang merkado. May 4 na sub-programs ang S4CP. Una ang Niche Centers in the Region o NICER na nagbibigay suporta sa higher educational institutions sa ating mga rehiyon upang makapagsagawa ng R&D. Pangalawa ay ang Collaborative R&D to Leverage Philippine Economy o CRADLE Program. Binibigyang daan ng CRADLE ang pagbuo ng partnership sa pagitan ng mga universidad, research and development institutions at mga pribadong kumpanya. Ang pangatlo ay Business Innovation through S&T or BIST for Industry. Sa pamamagitan ng BIST, nabibigyan ng pagkakataon ng isang lokal na kumpanya na mabili ang mga equipment para makagawa sila ng R&D. Ang pang-apat ay ang RD Lead Program na nagbibigay daan upang ang mga Pilipinong dalubhasa sa siyensya at teknolohiya ay makapagbahagi ng kanilang kaalaman sa iba't ibang ahensya at universidad sa bansa. Sa pamamagitan ng Science for Change program, maisasaayos ang distribution ng pondo para sa R&D sa lahat ng mga rehiyon. Ito rin ang magiging daan upang makapagtayo tayo ng mga world-class na R&D institutions na susuporta sa industriya at iba pang sektor ng ating bansa. Malaki ang naging epekto ng pandaigdigang krisis sa kalusugan at kabuhayan ng milyon-milyong tao nitong nakalipas na taon. Higit kailanman, ngayon kinikilala ng mundo ang kahalagahan ng agham at teknolohiya sa paggawa ng mga pandaigdigang desisyon ayon sa siyentipikong rekomendasyon at solusyon. Kailangan natin ng higit pang R&D outputs na magbibigay ng mga solusyong pangkalusugan at reformang makatutulong sa ating ekonomiya upang makabawi ang bansa sa pagkalugmok dulot ng pandemya.
R&D, making change happen.
Maraming salamat po, Yusek Guevara. Tunay nga na kaya nating hubugin ang mas magandang kinabukasan sa pamamagitan ng pananaliksik at pagpapaunlad. Thank you so much for officially opening today's event, Yusek Guevara. Now to give the keynote message, ladies and gentlemen, join me in welcoming the father and the leader of DOST, Secretary Fortunato P. de la Peña.
To our colleagues from the government, especially the Commission on Higher Education, the Department of Agriculture, the Department of Environment and Natural Resources, the Department of Information and Communications Technology, the Department of National Defense, the Department of Energy, the Department of Health, the Department of Public Works and Highways, and the Department of Trade and Industry. Our research partners from the academe and the private sector, members of the local government units, members of the DOST family and co-workers in government, friends from media, esteemed guests, ladies and gentlemen, isang magandang umaga sa ating lahat. We are very pleased that you could join us in this virtual gathering for the 6th National Research and Development Conference or NRDC. 5 years ago, the DOST prepared the Harmonized National R&D Agenda or HNRDA for 2017 to 2022 in cooperation with other government agencies, research and development institutions, and our partners from the academe, as well as from the industry sectors, to align all our R&D efforts. We believe that because of our commitment as a nation to unify our R&D efforts, the country is more than equipped and is in a better position to make scientific and technological innovations today than we were 10 or more years ago. This is evidenced by our country's performance in the Global Innovation Index or the GII report in recent years. In 2020, the Philippines reached its highest rank in the GII report, placing 50th among 131 countries in the world, a significant leap from placing 100th in 2014. Although our ranking took one step back in this year's GII report, placing 51st among 132 countries, we are still recognized as an innovation overachiever, delivering far more than what is expected and producing more innovation outputs relative to the inputs. In simple terms, the Filipino is recognized as an efficient innovator, and I believe This ingenuity was amply demonstrated in our battle to curb the rising threat of the COVID-19 pandemic. Filipino researchers, scientists, and engineers are at the forefront of our fight against the challenges brought about by the pandemic. From the onset, when we had to prioritize detection of the virus and protection of the people. Then later on, as we re-equip various sectors of the society to embrace the new normal. The sixth NRDC theme. The pandemic took a heavy toll on our country, affecting not only the health sector but also our industries, particularly the small and medium enterprises, the transportation sector, and even education, among others. And in the height of our fight against the pandemic, we deepened the role of R&D in the country's efforts to rise from the economic downturn that it took during the past year. The NRDC this year took on the theme Pananaliksik at Pagpapaunlad, Daan, Tungo sa Pagbangon, or Road to Recovery through R&D. Today and on November 17, we will highlight the R&D projects, programs, and technologies that contribute to the 4Ks: kalusugan, kabuhayan, kaayusan at kinabukasan, which represent the government's whole-of-nation approach towards recovery amidst the COVID-19 pandemic. Kalusugan. The continuing pandemic has greatly affected our healthcare sector. We saw the vulnerabilities of our healthcare workers and the rest of our countrymen. We felt the need for faster and wider range of testing for more effective prevention and control of the virus. The pandemic established the need for sustained food security. We even realized that genome sequencing is an important part of our daily life. And with all that we have experienced for more than a year now, we are very pleased to showcase the various R&D interventions for public health, which includes genome sequencing of the SARS-CoV-2, the development of personal protective equipment, and biomedical devices such as ventilators, body temperature monitoring device, and miniaturized PCR device. We will also hear about the development of nutritional food products such as virgin coconut oil, fortified rice mongo, and ready-to-drink pili pomace tea, and other approaches to addressing food security and food safety. It is also worthwhile to mention that we have a number of collaborations with the Department of Health to address the needs in our health sector. One example is the development of living clinical practice guidelines for COVID-19 management, infection prevention, and control. On kabuhayan, the pandemic also affected the livelihood of many, and this was felt not only in the country but in the many global economies as well. Almost all sectors were shaken with the disruption of supply chains, transitions in work setups, and challenges in service delivery, hence the need to rebuild the country's kabuhayan. Our efforts on this end include agriculture and agri-processing with projects on fertilizers and nutrient management, watershed rehabilitation, and poverty alleviation. Promoting sustainable livelihoods such as picards, gulayan sa pamayanan, tilapia para sa pamayanan, and agricultural technology business incubators. There will also be a presentation about the effect of the COVID-19 pandemic on ecotourism. On kaayusan, the third K stands for kaayusan. With all the chaos brought by the pandemic, there is a need to put most things back to order, restore the systems and structures that have been built in order to return to a semblance of the life we had before. Towards this end, research and development is being conducted to ensure an enabling environment for recovery. An example is the development and deployment of social tools against the pandemic, such as the COVID Cases Monitor or CCMON. There is also the RTAP, which is an intelligent supply and pressure management system that transforms water distribution systems into their most efficient version. Likewise, there are initiatives under the IATF subgroup on agribusiness focused on rebuilding a resilient agricultural food supply chain, development of socioeconomics research, remote data collection protocols, and the development of inclusive and resilient science and technology-based vegetable supply chains for the new normal. On kinabukasan, you will get to hear how we, in the various agencies of the government, contribute to the effort towards self-reliance and future development. You will have a glimpse of what is being done in the areas of biodiversity and natural resources, disaster risk reduction, and climate change, innovations on energy research, even human settlement development and urban planning. The national government agencies have different ways of addressing or contributing to the country's recovery amidst the pandemic and the sustainable progress of our nation. While these recent years have been challenging, we are confident that as we continue to foster an enabling environment for R&D, we will eventually overcome not only COVID-19 but also many of humanity's problems such as hunger, poverty, and inequality. On this note, we hope that you will join our efforts in advocating for increased support and investment in science, technology, and innovation. The GII report cited the Philippines as one of the countries that has the potential to change the global innovation landscape for good. In fact, we rank fourth among 34 lower middle income group economies in terms of innovation performance. As mentioned earlier, the Filipino researcher is considered an efficient innovator. That is, we deliver more innovation output compared to what is expected given our innovation input. We have a pool of talented researchers, and the Global Innovation Index recognizes our graduates in science and engineering as one of our strengths in innovation. However, these strengths could not be maximized, and our potential will not be realized with a modest investment in R&D. Averaging less than 0.2% of our GDP, still far below the UNESCO recommendation of 1% for a developing country. We are hoping that soon we can commit our nation to invest more in research and development. Currently, there are several bills filed in Congress which are aimed at increasing the capacity of the Philippines in science, technology, and innovation. One is the establishment of the Virology and Vaccine Institute of the Philippines, or the VIP, and I am pleased that President Duterte has regarded this a priority, together with the establishment of the Philippine Center for Disease Prevention and Control, or CDPC. The BIP will focus on the study of viruses and development of vaccines, while the CDPC will focus on surveillance, prevention, and control of infectious diseases. These are part of our efforts to enhance the nation's capacity to protect public health and to prevent, manage, and mitigate emerging and re-emerging diseases. We are also advocating for the passing of the Science for Change Bill, which would contribute to sustaining several of the innovation efforts that we started a few years ago. The Science for Change Bill is intended to achieve three things. First, to utilize science and technology for a more resilient Philippines following the COVID-19 pandemic. Second, to address persistent and emerging problems in the Philippines, including those concerning health, food, shelter, and livelihood. And third, to achieve the needed transformation and self-reliance of the Philippines. the Science for Change Bill has passed the House of Representatives but would still need approval from the Senate. So what is our call for action? Let us keep doing R&D together. As I end, I would like to thank all of our partners in the government, DA, DENR, DICT, DND, DOE, DOH, DPWH, DTI, CHED, DepEd, and the public and private spheres for your commitment in fostering a research and development ecosystem geared towards the sustained growth and development of our country. On a personal note, I'm very happy that this is already the sixth National Research and Development Conference. I still remember the time when we were crafting the Technology Transfer Act, and this is one of the provisions there, that there should be a once a year National R&D Conference so that people will know what have been the outcome of our R&D. To the researchers and our partners in the academe, we commend you for thriving amidst these challenging times. To our friends in media, thank you for partnering with us to ensure that advancements in science and technology reach the Filipino people. I would like to encourage all of you to continue supporting science, technology, and innovation in your own capacities. Together, let us work towards a better and safer future through research and development that makes change happen. Thank you and welcome to the 6th National R&D Conference. Mabuhay tayong lahat!
Maraming salamat po, Secretary De La Peña. Thank you for giving us a glimpse of what we will be looking forward in this 6th National R&D Conference. And your message not only inspired our audience, but also speaks volume in terms of unifying our nation's efforts in our road to recovery through R&D. And as you have said, Secretary Boy, let us make R&D together, because indeed we can work together towards a better and safer future through research and development that makes change happen. In this juncture, we will now be witnessing the R&D outputs that made change in the public health sector. But before that, may I introduce the Assistant Secretary of the Department of Health to deliver the message of Secretary Francisco Duque III. Ladies and gentlemen, please give a warm welcome to Assistant Secretary Kenneth Ronquillo.
Secretary Fortunato T. De La Peña of the Department of Science and Technology, our esteemed colleagues in the various fields of science, research, and development, our partners in other government agencies and the private sector, and to all who are sharing their time with us. A pleasant day to all. Truly, I am honored to be here with you in the 6th National Research and Development Conference to share insights on the intervention efforts against COVID-19, especially as they relate to the vital interface of research and policy. Upon the onset of the COVID-19 pandemic, the Department of Health immediately activated the systems approach to the response and management of the pandemic to promote the seamless implementation of COVID-19 interventions across all levels of government. The DOH focused its planning, policy development, legislative advocacies, and research to address COVID-19 concerns swiftly. Firstly, with respect to the financial realities of the health sectors, the department's operational and strategic planning included ensuring the availability and augmentation of the budget to amply support universal health care implementation alongside delivering on COVID-19 priorities. The 2021 DOH budget aimed to bridge the gap in the health system's fiscal space to amply adapt to the public health crisis and its transition to the new normal. For this year, a total of 166.52 billion pesos have been allotted for the implementation of the UHC Act and health system resiliency, to which by 2022 is expected to increase by 80% to an estimated 343 billion pesos. Corollary to this increasing budget is the intensified coordination and collaboration with DOH units in the review of their plans and budget proposals to ensure alignment and appropriate prioritization of investments in this time of the pandemic. Of course, the responsible and transparent administration of this budget requires the placement and guidance of strong policies, as well as the improvement of policy processes. Towards these, we established the COVID-19 Policy Tracker, which provides an easily accessible monitoring dashboard for all pandemic response-related policies issued and posted in the DOH Administrative Issuance System billboard. The policy tracker was deemed vital, especially because the urgency of the response needed to be driven by the appropriate urgency in policy development. Breakthrough policies, such as the implementing rules and regulations of Republic Act 11469 or the Bayanihan to Heal as One Act, significantly aided and expedited the development of necessary policies. Other aspects were also guided by appropriate policies, such as the DOH-NTF Joint Administrative Order 2021-0001, which established the IRR of Republic Act 11525 and paved the way for the national vaccination campaign to fight COVID-19. In addition to these policies, the DOH also ensured its stance to support COVID-19 concerns as undertaken by the department's legislative liaison arm. These contributed significantly to the success of critical legislative measures to combat COVID-19, such as Bayanihan 1, which declared a state of emergency and authorized emergency measures to mitigate the effects of the pandemic. Bayanihan 2, which augmented funds to COVID-19 response and recovery, and the COVID-19 Vaccination Program Act, which allowed us to embark on the next stage of our fight against the pandemic. Still, the pandemic is not yet over, which is why the DOH continues to sustain legislative advocacies to support the coming stages of our recovery, developing legislation such as Bayanihan 3, which will also augment funds for the COVID-19 response, vaccination, and recovery. The creation of the Philippine Centers for Disease Prevention and Control for the handling of public health events of national concern and boosting of the country's public health surveillance. Creation of the Virology Institute of the Philippines under DOST for focused virological research and diagnostics, therapeutic tools, and relevant scientific innovations. And finally, the National Health Security Act, a law which shall strengthen the implementation of international health regulations in the country. These developing legislations will not only guide our way out of the pandemic, but also put the necessary reforms in place to strengthen and prepare our health systems for any coming health crisis of any scale. Throughout all this, the DOH reinforced political engagements through close collaborations between the DOH and legislative branch through accommodating requests in aid of legislation and requests for constituency support, and the conduct of information sessions focused on updating legislators as well as national and local organizations of laws and policies related to COVID-19. As for our national vaccination campaign, part of our efforts to ensure maximum benefits for all Filipinos is our provision of technical assistance to local chief executives for the COVID-19 vaccination and deployment program, which covered activities such as the conduct of orientation activities on the COVID-19 vaccination and deployment program to the local chief executives of Pangasinan, close coordination with the district representatives of regions 1, 2, CAR, and National Capital Region in the implementation of PDITR strategy. Coupled with these were the partnerships we sought with the Philippine Congress, local government units, the private sector in the conduct of webinars and town halls on COVID-19 vaccination program, which were part of the intensified information campaign to boost vaccine confidence. However, this governance allows us to deliver excellent public health. It is research that truly pushes public health forward. In recognition of this and in response to the needs of the pandemic, the DOH has relentlessly expanded its coverage and platforms for research to catalyze the generation, consolidation, and monitoring of timely, accurate, and scientifically sound information on COVID-19. Innovations in this area have resulted in the creation of 2 data portals to capture the fast-evolving evidence of SARS-CoV-2. DOH COVID-19 Local Evidence Database, which harmonizes local evidence generation on COVID-19 by consolidating research at various stages, calls for proposals, and other relevant technical papers. This aids in the dissemination of information and reduces the potential duplication of efforts. On the other hand, the DOH COVID-19 meta-summaries are intended to provide summarized evidence on reviews related to COVID-19 with a preference for rapid reviews developed by local institutions or groups with expertise in evidence-based medicine and by internationally recognized international groups such as Cochrane Collaboration. Ongoing studies on COVID-19 are currently being funded by the DOH Advancing Health through Evidence-Assisted Decisions Program. As professionals both in science and medicine, we must continue pushing the envelope using the technologies, methodologies, and growing knowledge available to us to spur the generation of more local evidence for policy development and to promote informed, scientifically sound decision-making on public health measures. As the lead technical agency in public health, the DOH formed the steering committee for the conduct of clinical trials for investigational treatments for COVID-19 to provide overall national-level supervision and technical guidance in the conduct of clinical studies for potential treatments for COVID-19. Beyond the technical guidance, the steering committee shall also ensure that decision-making is indeed supported by evidence while at the same time exercising oversight in multi-country clinical trials such as the Avigan and Solidarity trials. Aside from the appropriate scientific rigor, these measures seek to ensure proper quality assurance as well as checking compliance to regulatory and data safety of requirements of clinical trials conducted locally. In relation to this, the DOH Single Joint Research Ethics Review Board has been designated by the Philippine Vaccine Experts Panel as the Central Ethics Committee to facilitate ethics reviews of vaccine clinical trials and COVID-19 studies to be implemented in the country. This body strictly ensures the compliance of clinical trials and all other forms of research undertakings in COVID-19 with all relevant ethical principles and standards. The synergy of research, policy, and legislation is what will push the state of Philippine public health forward. The DOH continue moving on all these fronts because science, especially science for medicine, should never be practiced without ethics. It is only through equal measures can science and ethics produce genuine benefit for humanity. As we all share our visions and paths to realize better tomorrows for the country, let us always keep in mind our shared goal and responsibility to create better lives for everyone. Maraming salamat at mabuhay tayong lahat.
Thank you, Assistant Secretary Ronquillo and Secretary Duque, and of course to the Department of Health for the continuous support in health, research, efforts. Let us now witness our R&D initiatives for public health interventions through these videos.
The COVID-19 pandemic has made a significant impact on the health of the world's human population since its discovery in December 2019. Genome sequencing of SARS-CoV-2, or Severe Acute Respiratory Syndrome Coronavirus 2, has recently become one of the most important components of pandemic response. Knowledge about the viral genome has provided us clues to understand the mechanisms of viral infection, and it has paved the way for the development of vaccines and diagnostics. It has also allowed us to understand the source of the virus and its transmission dynamics within communities and around the world. The emergence and persistence of multiple SARS-CoV-2 variants of concern across the globe gave rise to additional challenges in existing public health interventions aiming to control the pandemic. While considered to be a normal phenomenon, the continuous virus mutation supported by sustained virus transmission in many countries can further increase the variants of concern. This potentially affects the clinical severity of cases, virus transmissibility, diagnostics, treatment, and vaccine development. These scenarios further highlighted the need for SARS-CoV-2 genomic sequencing strategies in line with the efforts to strengthen other existing public health control measures. RITM has embarked on 2 research projects to sequence the genome of SARS-CoV-2. Firstly, genetic characterization and metagenomic analysis of respiratory samples from COVID-19 cases in the Philippines. And secondly, implementing genomic surveillance to support SARS-CoV-2 control and mitigation strategies in the Philippines. Both studies will use next-generation or third-generation sequencing technologies to sequence the whole genome of SARS-CoV-2. Both projects also aim to capacitate RITM, DOH subnational laboratories, and UPNIH with the necessary equipment and skills for sequencing SARS-CoV-2, enabling rapid and efficient support to local and regional pandemic response. We will be employing 2 sequencing platforms, Illumina and Oxford Nanopore sequencing technologies. The Illumina sequencing platform uses a sequencing by synthesis method to spell out or read the genome sequences and is built for bulk sequencing. The Oxford Nanopore technology uses a pore to read the genome sequences and is designed for portable and rapid, low-throughput sequencing suitable for quick and rapid results. The results from the sequencing runs will be analyzed using a bioinformatics software. Data and analysis will be laymanized into reports that will be submitted to local, regional, and national health authorities. Here we see a timeline of the sequences from RITM samples, along with sequences generated from other sequencing labs nationwide. The few lineages from the first half of 2020 were replaced by several lineages. This implies that there were multiple introductions of these lineages and that these lineages were co-circulating in our cities and provinces. Among the RITM samples, we were able to detect 7 lineages from January 2020 to January 2021. We know this is already local transmission because only 4 of these cases were from patients with travel history outside the country. We also looked into co-infections with the SARS-CoV-2 infection. We found other pathogens in the samples, such as Prevotella and Streptococcus. The impact of these potential co-infections still needs to be investigated. Multiple introductions and co-circulation of different SARS-CoV-2 lineages imply that there is a need to strengthen surveillance and control measures at our country's ports of entry. This can prevent the entry and spread of new, potentially more virulent and/or infectious strains into and within the country and to other countries. Only a small proportion of the pandemic has been sequenced, Therefore, we urge caution in the interpretation of data at this stage. Surveillance of known and emerging variants is important in understanding the transmission of SARS-CoV-2 and the implications of emerging variants on disease transmissibility and severity. These two research studies bridge the gap between basic research and public health response. Genomic sequencing can provide findings for evidence-based public health policies for the control of SARS-CoV-2 in the Philippines.
Good day, everyone. I'm Dr. Marisa Alejandria, the project leader for the Philippine COVID-19 Living CPG project. The COVID-19 pandemic has given us a toxic legacy of poor quality research, fueled by media hype, lax regulatory oversight, vicious partisanship in desperate search for interventions for COVID-19. How do we survive this infodemic of COVID-19 literature, misinformation, and disinformation? The Philippine COVID-19 Living CPG project was conceptualized to provide up-to-date, evidence-based recommendations on the treatment, diagnosis, infection prevention, and control of COVID-19 among adults at risk for COVID. There are three main players in the guideline development process: the steering committee, the evidence reviewers, and the multidisciplinary consensus panel of experts. The guideline development is iterative, starting with asking the right question, searching the literature, evaluating the evidence, making the recommendations, and deciding on the strength of the recommendations. In a living CPG model, the development process is optimized through regular surveillance of the literature to allow updating of the recommendations as soon as new evidence becomes available. Recommendations are prioritized and switched to the living status depending on whether it's a priority for decision-making. There is a reasonable chance that the existing recommendation changes with the emergence of new evidence, or there is a likelihood of new research evidence. We use the grade methodology in evaluating the certainty or quality of the evidence for each of the priority questions. In the grade approach, the evidence base for each intervention is rated as high, moderate, low, or very low, depending on the risk of bias assessment, methodologic quality of the trials, precision and consistency of results, directness of the evidence, and presence of publication bias. Presence of any of these factors will downgrade the quality of the evidence from a default of high quality for RCTs to moderate, low, or very low. For observational studies, the default rating is low, and in the presence of a dose-response gradient, adjustment for potential confounders, and large magnitude of effect, the rating can be upgraded to moderate or high. The consensus panel will also rate the outcomes of the interventions as critical, important but not critical, or of low importance to decision-making. Examples of critical outcomes include reduction in deaths, improved survival, prevention of hospitalization, and adverse events. Less important outcomes usually are mechanistic, such as time to viral clearance. The evidence profiles are summarized in evidence tables reflecting the risk of bias assessment, certainty of evidence, and rating of outcomes, which are then presented to the consensus panel. The next step is determining the direction and strength of the recommendations. Issues to consider include the quality of the evidence, the magnitude of benefits and harms, cost, equity, applicability, feasibility issues, values and preferences of the provider and the patient. A strong recommendation implies that the benefits of adhering to the recommendation clearly outweigh the undesirable effects of the intervention. This process is decided upon by a multidisciplinary consensus panel. The Living CPG had 6 consensus panels for each of the following group of interventions. All meetings were held virtually, and the task force generated 93 evidence summaries and 136 recommendations. All of this can be accessed in the PSMID and DOH HTAC website. Since the release of the CPG last March, more than 100,000 visits have been recorded, with the spikes in visits occurring in March and April, coinciding with the release of the recommendations. Most visits were from the NCR, Central Visayas, and Davao region. Table 2 shows the top evidence summaries downloaded from the website. Here are the highlights of the recommendations. For screening and diagnosis, RT-PCR using nasopharyngeal swab remains the diagnostic test of choice. Oropharyngeal swabs and saliva are recommended alternative specimens for RT-PCR. Rapid antigen test using nasopharyngeal swab is a recommended alternative to RT-PCR for symptomatic patients in the first week of illness, but we do not recommend saliva as a specimen for rapid antigen. For mild to moderate COVID-19, supportive care is strongly recommended. We do not recommend the use of empiric antibiotics such as azithromycin, empiric anti-flu drugs such as oseltamivir, steroids, convalescent plasma, hydroxychloroquine, and lopinavir/ritonavir. For severe and critical COVID, steroids is the recommended standard of care. Tocilizumab is added to steroid for patients with elevated biomarkers and with rapid respiratory deterioration. For non-pharmacological interventions, we do not recommend the use of ionizing air filters, misting tents, and foot baths to prevent COVID-19. Lastly, we do not recommend melatonin, vitamin D, zinc, hydroxychloroquine, and ivermectin for prophylaxis against COVID-19. We are currently updating these evidence summaries and reviewing the evidence for new interventions, so watch out for the updated recommendations. Unified algorithms are also being developed to facilitate dissemination and application. Lastly, while the evidence for interventions is global, we need to localize and contextualize the recommendations into our setting. Let's go living. Thank you.
To win a battle against a highly infectious disease, we must protect our healthcare workers. So we in the CBOL COVID Task Force explored innovations that would protect our healthcare workers while they provide care to their COVID-19 patients. 3 of our projects focused on telemonitoring devices, which can aid healthcare workers in monitoring patients from a safe distance. So these 3 projects were number 1, the telepresence device, number 2, the telemetry system, and number 3, the e-step.
When admitted in hospitals, COVID-19 patients are isolated to avoid contamination. This limited human contact is deemed to add to the anxiety of patients. Our objective is to develop a device that limits exposure, conserves PPEs, and provides clear communication with a friendly face. This is the telepresence device, a telemonitoring technology that serves as proxy for healthcare workers in high-exposure areas of hospitals. It also provides personalized care to the ill while protecting nurses and doctors from contamination. And it answers calls only from authorized accounts using available teleconferencing and remote control applications. Telepresence devices not only help nurses and doctors. Anxious and lonely patients isolated from their families and friends can also remotely communicate with their loved ones during their fight to survive the disease.
Part of CBOL's telemonitoring initiative is the development of a telemetry system that helps healthcare workers in remotely monitoring COVID-19 patients through RxBox. RxBox is a biomedical device capable of measuring a patient's temperature, blood pressure, heart rate, oxygen saturation, uterine contractions, and ECG readings. It is developed to diagnose using sensors attached to a computer box, sending data wirelessly to a remote medical professional for interpretation. Our team aimed to utilize the RxBox device by developing a telemetry system which will facilitate the transfer and further improve the function of the RxBox that are tailored to the requirements in different medical wards. Through our project, RxBox will be optimized with telemetry features that will enable nurses to remotely monitor patients from the nurses' station through a dashboard, which also has a telereferral functionality, where electronic data can be transferred to a different facility.
Realizing that there is a risk for healthcare workers to be infected with COVID-19 when taking a patient's vital signs, we developed eStet. This is a stethoscope that will enable medical frontliners to listen to a patient's breathing sounds at a safe distance. eStet has a main electronic component that is enclosed in an easy-to-use and plug-and-play device with minimal difference from using a conventional stethoscope. Once completed, the eStet will benefit healthcare workers that routinely checks the breathing of COVID-19 suspect and confirmed patients, as well as referral hospitals where COVID-19 patients are being admitted.
What we aim is to help our medical frontline workers manage COVID-19 patients in a manner that does not put their lives at risk of contracting the disease.
In the face of the rapidly unfolding COVID-19 crisis, local initiatives and creative innovations are key in addressing the pressing problems in our local healthcare system.
At all costs, we must protect our frontline healthcare workers, for they are the soldiers bravely standing between us and this deadly disease. Investing in telemonitoring technologies will not only help our healthcare workers, but will also empower the healthcare industry in managing diseases in the future.
As the pandemic continues to strain both the country's health system and economy, an abundant locally produced antiviral food supplement known as virgin coconut oil is now being explored as an adjunctive therapy for COVID-19 patients. Considered as one of the world's most popular superfoods, can VCO be our weapon in fighting the COVID-19 virus? To find out, we at the Food and Nutrition Research Institute evaluated the beneficial effects of virgin coconut oil to persons under investigation. We conducted a clinical trial where we introduced VCO into the diets of COVID-19 patients to see whether they will be able to recover faster as compared to other patients with not consuming VCO. During the clinical trials, there were 57 suspect and probable COVID-19 patients who participated and underwent the 28-day intervention period. The investigators randomly assigned the volunteers into either the intervention or VCO group or the control group, in which the VCO group had 29 cases and the control group had 28 cases. Immediate effects of the VCO intervention were observed among some of the patients in the VCO group, who experienced decreasing signs and symptoms of COVID-19 as early as day 2, while only one patient from the control group showed similar improvement. Moreover, the VCO group experienced no more symptoms at day 18, while the control group exhibited no symptoms only at day 23. The study revealed that meals mixed with VCO could alleviate COVID-19 symptoms, thus preventing the progression or severity of the disease. More importantly, The VCO compounds not only reduce the coronavirus count by up to 90%, but also improve cell survival of patients with COVID-19. These findings showed that the VCO were able to enhance the immune system of patients. Once the sequel research and development are completed, VCO can be used as an adjunctive therapy that could prevent COVID-19 from becoming severe. Aside from aiding COVID-19 efforts, another important impact of this project is potentially boosting the coconut industry and eventually the country's economy. With renewed public interest in VCO and other coconut oil's alternative health benefits, the industry is seeing a 20% growth in demand by 2022. Currently, the project was expanded to include Valenzuela City and the Hospital ng Muntinlupa as additional sites. The project now includes asymptomatic RT-PCR confirmed COVID-19 patients to participate in the study. Eventually, the team seeks to tap the Department of Health for the distribution of VCO to serve as adjunctive therapy for COVID-19. The study was made successful due to the support and collaboration of the Department of Science and Technology's Food and Nutrition Research Institute, Philippine Council for Health Research and Development, or PCHRD, Philippine Coconut Authority, Department of Agriculture, Department of Science and Technology, Calabarzon, City of Santa Rosa, Laguna, and the Ateneo de Manila University. Virgin coconut oil's potential as treatment for the novel coronavirus highlights the versatility and sheer usefulness of coconut. As the world begins to recognize the true potential of the so-called tree of life, we are expecting consumption and production to rise in the next few years. Ultimately, through this project, we will not only be providing a solution to the challenges brought by the pandemic, but will also aid the recovery of the Philippines economy. I am Imelda Angeles Agdepa. Join me and my team as we make lives better for all Filipinos.
Cut off from healthcare services by mountains and rivers, most Filipinos in rural villages rely on the healing hands of someone in their neighborhood. These are the traditional and alternative healthcare or TAC practitioners of the Philippines, frontliners for primary care. They are the albularyo's, mananambals, manghilots, and the like. They use indigenous tools based on social, cultural, and religious practices. With an estimated 40 to 60% of the population in the WHO Western Pacific region countries using traditional medicine, there is an increasing interest and willingness of countries to promote proper use of different TAC modalities. However, most TAC practitioners lack official recognition. This means the government has no database of their qualifications, location, and number, without which TAC practitioners can't get appropriate support for research, training, and development. All of these are necessary to uplift TAC in the Philippines. The Macro Health Research Organization Incorporated, commissioned by the Philippine Institute of Traditional and Alternative Healthcare, conducted a study that determined the number and profile of TAC practitioners in 4 provinces: Quirino, Samar, Oriental Mindoro, and Agusan del Sur. It determined the feasibility of integrating TAC into the health service delivery system by considering its acceptability in the community and providing recommendations for its promotion, policies, and future research. A total of 2,691 TAC practitioners were listed and profiled in the 4 provinces. In Quirino, 345 TAC practitioners are mostly manghihilot. In Oriental Mindoro, 619 are manghihilot, mangtatawas, and albularyo. In Western Samar, 1,015 are paraghilot, piang, and piol. In Agusan del Sur, 712 identified as manghihilot, hilot sa piang, hilot sa babae or nanganak. Most of the practitioners identify manghihilot and many classify themselves into more than one category, despite similarities in the healing process. Most have 20 to 39 years of experience and attend up to 100 patients per month. Most acquired traditional practice from older family members or pinamana. They use natural materials like tawas, langis, and dasal, but have their own respective ways of doing it. Most practitioners demand a service fee of only 100 pesos or less, while others are willing to get paid with any amount. They recognize their limitations in diagnosing and treating their patients, but still strive to do their best. These are the team's findings. Professionals, especially doctors, is among the biggest challenges to integration of TAC practitioners. However, there is support from those who have had childhood experiences with TAC. TAC practitioners recognize the knowledge and practice can be improved through training and standardization. Registration helps remove taboos associated with TAC and allow the enhancement of their knowledge. A TAC registry allows for easier mobilization and organization of practitioners, as well as quality control of services through setting of minimum qualifications and training. How can we address the challenges in the integration of TAC? First is through policy. Critical assessment of the issues of safety, efficacy, and quality, access, and rational use allows for the development of suitable policies to ensure safe, affordable, and responsible TAC practice without compromising their diversity and unique aspects. Second is by investing in the practitioner's capacity building. Third is by educating the public on TAC modalities. And fourth, by promoting stronger collaboration among health professionals and TAC practitioners. From the profiling survey, a cloud-based database of practitioners is being developed. This will help in their training, accreditation, and certification, and eventually in the integration into the universal health care. Capacity building and registration help move forward health technology assessment and clinical practice guidelines for accreditation purposes. What does this mean? When Filipinos, even those for far-flung areas, seek TAC services, expenses will be reimbursed and included in the state insurer's PhilHealth coverage through an established appropriate benefit package. Geographically isolated barangays and indigenous people communities can have better healthcare options that are reliable, safe, and accessible.
The COVID-19 pandemic has changed the way we do things in our daily lives. So we are now living in what is called the new normal. Our project is about making new devices for the new normal. So we have Batid and Hinga for the new normal. I'm Erwin Enriquez from Ateneo de Manila University. And I am in the Printed Electronics and Nanotechnology Laboratory, where we are devising smarter ways so that we can have devices that will make our new normal more livable. Regular body temperature monitoring is required at entryways. Typically, this is done using an IR scanner. A disadvantage of this is that it is slow and people tend to line up where they are being checked, which violates some social distancing. It can be inaccurate at times and data are not saved. This can still be further improved. So, we propose an alternative which is Batid. This is a wearable two-in-one device that identifies and provides body temperature. It is integrated with software for monitoring and useful for members of closed organizations such as schools or workplaces. The advantages are faster at entryways, social distancing compliant, accurate reading, and personalized monitoring, which is useful for saving data that can be linked to contact tracing later. We are also developing other devices. For Hinga, we are making non-invasive health monitoring devices such as the face mask and the cough sensor. We are also modifying air filters for window-type air conditioners to give it antiviral properties. These are all explained in the following slides. Our project uses printed electronics manufacturing to make the devices affordable. In inkjet printing, you only need material where it is needed and therefore it minimizes waste. We are a highly interdisciplinary team of scientists and engineers, and we are partnered with a software company who will develop the software solution for the Batid band. For example, our RFID band uses our gold ink formulation to print the antenna. We prefer gold to silver because silver tarnishes easily.
Okay, so what I'm doing right now is inkjet printing of RFID antennas. I'm going to show you one of the challenges that we had with printing gold on plastic substrate. So you see here poor adhesion of the ink. So we've devised a way to make the gold ink stick onto the plastic substrate like this.
As mentioned, we have already improved our printing to make long-lasting antenna using our ink and process. Here is Miss Diana testing one of our prototypes. So here's what it will be like. That's a real prototype, and the computer might reveal the identity and the temperature. So this is a faster way of doing this using our Batid band. One of the leading journals of medicine reported that cough is one of the most presenting symptoms of COVID-19, even for those who have just recovered from the disease. So coughing prevalence is important to be monitored. The Ubometer is a cough sensor using AI algorithm. The AI was based on cough sounds collected from our survey as well as data available from the scientific literature. The Ubometer will be worn by our pilot testers, wherein it is also connected by Bluetooth to a DAT2 or a data acquisition and transmission unit, which is in turn connected to a cloud server to send the coughing data. So we are currently testing the Ubometer, and it shows a red light when it detects cough sound.
Here are the printed electrodes that we fabricated using the inkjet printing technology. We are investigating the proof of concept wherein these modified electrodes will be used to detect biomarkers from the collected breath and saliva residues from wearing this mask. Electrochemical data will be collected for future chemical profiling, and soon this technology will be used to detect initial signs of infection from flu or even from COVID.
We are testing two platforms for our face mask sensors. Here we are also looking at printable transistors.
A field effect transistor can be used to detect biomolecules. A field effect transistor is a semiconductor device that can be printed. Here I am measuring the FET sensor response using a semiconductor analyzer.
We conducted an online market research to see if the three product concepts resonate with the people. A concept board was shown to them, and we asked them to evaluate the three product concepts in terms of likability, perceived importance, likelihood to buy, and likelihood to recommend. For the first product concept, a disposable face mask that can detect symptoms of COVID-19, most of the respondents perceive the product positively along the 4 criteria. Similarly, the second concept describing the cough sensor is perceived positively by most of the respondents. A comparable trend is observed on the RFID temperature band, where most of them perceive the product positively. In conclusion, the results of the market survey suggest that most of the respondents perceive the 3 product concepts positively.
Finally, we designed an antiviral coating for air filters in window-type air conditioners, which are the most common ones. We can buy air purifiers, but we can also repurpose those air filters in window-type air conditioners. The problem is, these have big holes, but we can innovate. The idea is to give it an electrostatic charge so that aerosols will be attracted to them, and we provide the filter's antiviral property to instantly deactivate those microbes that stick to them. So, therefore, we make our own melt span fibers, or we can purchase them, or we can use an electrospinner to make charged fibers such as shown here.
Using this electrospinner apparatus, we can make recycled fibers, like this one, for your filters, from waste PET bottles.
Here we have developed a UV-sensitive nano coating that allows for the effective deactivation of pathogens and also improved air filtration performance. To fabricate these modified fibers, we have implemented a facile coating method involving sprayed deposition that allows for good surface coverage of the nanoparticles.
We hope that once these devices are available in the market, you will use them, such as the batid band, the obometer, and the face mask with smart sensors, and also to protect you our filter, which has antiviral properties. And we thank again the PCERD and the DOST for funding these projects, which we hope will make your new normal more livable.
In the beginning of the COVID-19 pandemic, the World Health Organization had a simple message to the world: test, test, test. This means that knowing whether a person is infected or not is critically important in fighting off and containing the spread of COVID-19.
Even with the country's initial success in sourcing and producing diagnostic kits, expanding the reach of COVID-19 testing remains a challenge. Aside from increasing test accessibility, we also want to encourage more people to undergo testing when needed.
Some of the challenges for mass testing include tedious procedures that lead to longer waiting time of patients, uncomfortable nasal swabs, which can be very daunting to some, difficulty in test deployment because of the required technical expertise and huge expensive machines, and lastly, costly tests. To further strengthen the country's capacities, we turn to science for technologies that can make testing faster, cheaper, and simpler.
This is why we, the Biomedical Research Group from the Ateneo Research Institute for Science and Engineering, or ARISE, launched Amplified. Amplified combines 3 independent projects with a shared pursuits and end goal of amplifying COVID-19 testing capacity in the Philippines. The first project is the MyPCR, a microfluidic PCR device. The 2 other projects that enable saliva-based detection of virus are ADS, a lateral flow DNA detection system, and Swifter, development of isothermal COVID-19 testing technology. These 3 DOST PCHRD funded projects each create innovative testing products. But to bring COVID-19 testing closer to all Filipinos at the point of their need, both ADS and Swifter are planned to integrate with the MyPCR system. As a team leader, I will tell you more about MyPCR. So what is the MyPCR? A PCR machine is the gold standard instrument used to find out whether patients are infected by a pathogen. However, it is difficult to deploy and distribute because the equipment needed is large, complex, and expensive. To address the problem, we designed the MyPCR, a device roughly the size of my palm which has the functionalities of a PCR. So how are we able to compact a large PCR machine into this compact device? Using creative electronics engineering, our team designed a unique and simple heating system and combined it with a cheap microfluidic testing cartridge that we designed. When optimized, cartridges use only very small amounts of patient sample and test reagents, and simplify test preparation, further cutting down the cost of a COVID-19 test. Because of the design of the MyPCR, we project the final device to be at least 5 times cheaper than current qPCR devices. The smaller, more compact, and cheaper MyPCR will also make distribution much easier, allowing us to reach even community clinics with limited laboratory capacities and limited budgets. By enabling testing closer to the point of care, patient samples can be processed locally, removing the need for slow, expensive transportation of patient samples to a main testing lab. Results can be processed faster, and patients and healthcare workers notified sooner. With the MyPCR composing the engineering component of the amplified testing system, how about viral detection? Ads and Swifter have the answer to that.
Typically, COVID-19 testing requires a nasal swab. The swabs are first prepared before they proceed to the actual PCR testing. This has data and results looking like this. This entire process is time-consuming. It also requires technical expertise to perform the test and interpret the results. Ads and Swifter make tests simpler by replacing swabs with only 3 steps. Step 1. Collection of patient saliva. Step 2. Heating the saliva collected. And Step 3. Detection of the virus in saliva using cheaper and less complex methods. Why saliva? Saliva can be easily and quickly processed by a medical technician or almost anybody. More importantly, since saliva can be self-collected, we now have an option to avoid the uncomfortable nasal swabs. The main difference between the two projects lies in the technology used. Ads retain the PCR technology but simplifies the readout. Instead of looking at graphs, Ads makes use of a cheap lateral flow device or a dipstick. It is very much like a pregnancy test, but for COVID-19. By simply looking at the lines, we will know whether they are COVID positive or not. Swifter, as the name suggests, aims to have a faster turnaround time of results and hence shorter waiting time. Swifter uses a simpler effective version of PCR called LAMP, which runs for only half an hour. Currently, with qPCR testing, delivering the results to patients take at least 6 hours. With Swifter, the waiting time can go down from 6 to just within 1 hour. With the LAMP technology, the development of test kits that enable rapid, simpler, and more cost-efficient testing is made possible. Through MyPCR, Ads, and Swifter, we seek to enable more COVID-19 testing in more primary care clinics and hospitals by making saliva-based testing more financially accessible for more Filipino patients.
While designed to work with typical PCR instruments, Ads and Swifter tests are designed to function with our MyPCR device as well. The benefits of Amplified are maximized when both the MyPCR and the Ads or Swifter testing kits are used together. For Ads, instead of buying a new thermocycler, the MyPCR can be used with the Ads kit to enable scaled and distributed testing. Similarly, the MyPCR can be used to run the Swifter LAMP test for both the amplification and test readout. The microfluidic cartridge can also be configured to allow for multiple samples to be tested in a single run.
Our government has always emphasized the 3 T's: trace, test, and treat in its fight to stem the spread of the virus. However, some of the major constraints that we face during this pandemic are the high cost of testing for COVID, and even worse, the lack of testing facilities or devices in various locations in the country, especially in the more remote rural areas. Many LGUs cannot afford the financial burden of building a biosafety level 2 facility in order to do this testing. And so, if we are to save more people from dying from COVID-19 due to their lack of access to faster and cost-effective tests at the barangay level, if we want to send our children to school with the assurance that school clinics are capable of conducting widespread testing for all their students, the faculty, and the staff, if we are to save the economy by providing our workers with a safe and healthy working environment, then we need to be able to make these devices as widely available as possible at reasonable costs and at the soonest possible time.
We cannot fight the virus if we do not know who is infected. We need to test, trace, and treat. The timing of the test is vital to the success of fighting off any disease, both for each person and in our communities. The earlier, the better. Our Bayan projects will not stop with COVID-19. The technology we develop can also easily be applied to other common Philippine diseases like tuberculosis, malaria, or even cancer.
We hope that the Amplified project will expand coverage of COVID-19 testing for the Filipino people, and everything we have learned can be used to accelerate development of diagnostic tests for other diseases in the coming years.
Faster, cheaper, simpler. Better testing by Bayan, para sa Bayan.
Primarily with Cebol disinfection technologies, we aim to protect our healthcare workers from getting infected with COVID-19. Because there is a great need for disinfection mechanisms, the Cebol COVID Task Force Disinfection Team developed 3. The first, Sanipod, a self-contained disinfecting cubicle. Second, the powered air purifying respirator, better known as the PAPR. And third, the Clean Intubate, a laryngoscope blade disinfection device. Now, the virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So this puts healthcare workers at high risk of infection. Now, one way to mitigate this is through the use of disinfection to decrease the chance of spreading the virus to people and objects within COVID-heavy environments. The Sanipod is made to address this challenge. This technology is a self-contained cubicle that aims to provide disinfection for healthcare workers as they leave a potentially contaminated area. The Sanipod is a cost-effective, self-contained disinfection cubicle. It will be beneficial in areas such as the triage and entrances or exits of rooms, wards, clinics where COVID-19 patients are being managed. So the disinfection cubicle, such as the Sanipod, ensures the medical personnel that aside from wearing their PPE, they are given an extra layer of protection from any pathogen, in this case, the COVID. Now, it also provides the very, very important psychological assurance to healthcare workers that they are able to go home, back to their loved ones, clean.
While COVID-19 causes death to infected patients, it is also highly contagious for those who care for them. The use of PPEs is one of the appropriate strategies to prevent infection among healthcare workers. One type of PPE is a powered air purifying respirator, or a PAPR, which can be used for high-risk procedures by healthcare workers at risk from aerosol or droplet spread. It uses a pump that moves contaminated air through a high-efficiency particulate filter. The contaminant-free air is then channeled to the faceplate of the wearer and is breathed by the healthcare worker. Cibol's PAPR will be an innovative version of the commercially available ones. Apart from providing the additional type of protection for the needs of the healthcare workers, it was created to automatically respond to the respiratory requirements of its users. It was designed primarily to benefit the healthcare workers and lab technicians in the COVID referral centers. However, we see potential in its use by the military, the policemen, and the firemen in the front lines.
Patients diagnosed with COVID-19 infection who develop severe or critical pneumonia will require airway-related procedures such as tracheal intubation. A laryngoscope is a medical device used for intubation. It is a semi-critical item that requires high-level disinfection using chemical disinfectants. The tedious manual cleaning and disinfection involves a significant amount of handling through the different solutions. However, there's a possibility that it might lead to tears in the surgical gloves, possible spills and splashes, and contact with the detergent and disinfecting solutions. With this, we realize that there is an increasing need to develop medical devices that will help healthcare workers and lessen the burden of exposure and possible risks from the manual laryngoscope blade disinfection process. Our team aimed to design and fabricate a portable and a non-portable laryngoscope blade disinfecting device that will make the standard process of cleansing and disinfection of laryngoscope blades faster and safer for the medical personnel. We call it Clean Intubate. Among the features of Clean Intubate is a receptacle for the laryngoscope blades with an automated system for cleansing, disinfection, washing, and drying. It is also equipped with a sterilization section as well as temperature and timer controls. So even after the pandemic, Clean Intubate will still be applicable and helpful for medical personnel, especially for anesthesiologists performing intubation procedures.
Primarily with the Cibol disinfection technologies, we aim to protect our healthcare workers from getting infected with COVID-19.
But in the long run, we envision that our innovations will thrive in support of the healthcare system even when the pandemic is gone.
It is vital that we invest in disinfection technologies, as this will not only help put us through this pandemic together, but most importantly, it will save lives.
All right, thank you to our speakers for the first batch of presentations. We did witness interesting R&D projects from genome sequencing, telemonitoring and disinfection, effects of VCO on COVID-19 patients, and PCR device, among others. That is just the first part under our first K, or Kalusugan segment. Before we proceed to our question and answer portion, we are honored to have with us to give a live message. We have now our dear Secretary, the father and the leader of DOST, Secretary Fortunato T. de la Peña. Magandang umaga po, Secretary Boy. Already, we fondly call him Sec Boy para po sa mga kaibigan po namin outside the DOST. We fondly call our Secretary Sec Boy. Magandang umaga po, Sec Boy.
Lalasa mo yung volume.
Po sa inyo.
Marami akong natututuhan kaya hindi ko maiwanan ang ating programa dahil yung yung mga report kasi galing sa ibang mga ahensya, kamukha sa DOH, ay ngayon ko lang narinig at ako'y natutuwa. At talagang ito ang ating objective sa National R&D Conference, na magkaalaman kung ano yung mga ginagawa ng iba-ibang ahensya, alaman tayo kung ano yung ating mga research and development na isinasagawa. At natutuwa ako dahil for example, dun sa presentation ng DOH ay may mga ipinakitang mga devices na ginawa sila, at hindi ko alam kung meron na ring sistema sa ibang ahensya katulad ng DOH kung paano maita-transfer yung technology, maaaring nagagamit na nila, pero pwede rin yung magamit ng iba, o pwede rin ma-commercialize yung ibang mga intellectual property ng kanilang mga researchers. So isa siguro yan sa future nating pag-uusapan, dahil within the DOST and among our partners ay medyo sanay na sila dun sa proseso natin ng technology transfer and commercialization. Dun sa ibang ahensya, hindi ko pa alam. At natutuwa din ako kasi nadinig ko yung mga presentation, halimbawa sa Ateneo, na talagang ina-address nila yung yung kung ano talaga yung pangangailangan sa ngayon. At nakita ko naman na yung ating mga ipine-present ng mga health researches ay talagang ina-address yung ating mga pangangailangan ngayon. At gaya ng sinabi ni Yusek Geb kaninang umaga doon sa kanyang opening, ay masasabi natin na relatively ang Pilipinas ay efficient in terms of making or developing new technologies and innovations in comparison to what is expected of us as a developing country with very limited resources for generating innovations. Gusto ko din bangitin na kagabi, at least nung mag-report ako sa Talk to the People, ay nakakita ng ating leadership ng Pangulo kung ano yung ating mga ginagawa. Bagamat limited lang ako dahil 30 slides lang ang pwede ko ipakita. Siyempre, hindi ko naman maipakitang lahat. Kaya itong pagkakataon nito, itong halimbawa, itong National R&D Conference, ay mas marami ang nakikita natin. At sa mga darating pang session, mamayang hapon at sa November 17, ay yung iba pang mga ahensya. Nakakatuwa po na within this last 5 years, more than 5 years na, ay lumakas ang R&D ng iba't ibang ahensya. At in fact, doon sa ating mga proyekto sa DOST ay maraming instances na nagko-contribute ang ahensya, minsan 2 or more pa, para lang matuloy yung project na pakikinabangan ng bawat isa. Nakita ko yan in the case, of course, sa DOH, matagal na tayong magkasama dahil nga dun sa National Health Research System Law, pero dun sa iba na wala naman ganyang klaseng batas, natutuwa ako dahil sa lumaki na yung collaboration, halimbawa with the Department of Public Works and Highways, with the Department of Energy, Department of Environment and Natural Resources, at siguro bibigyan ko ng special mention ang Commission ng Higher Education, kasi yung ating mga itinayong mga needs research centers in the regions ay napakalaki din ang role ng ating CHED, dahil sila ang nag-oversee ng ating mga universities, particular na yung state universities and colleges, na karamihan sa ating mga needs research centers ay diyan nakalagay sa mga state universities and colleges. Yung iba diyan na nagkaroon ng needs research center, sasabihin ko na talaga na never heard ko yung ibang mga higher educational institutions ngayon. Tapos bigla sila ngayong naging needs research center. Katulad, hindi naman siguro masamang banggitin na talagang never heard ko, halimbawa yung Marinduque State College na ngayon ay nagkaroon ng needs research center sa native pigs, o kaya yung iba pa na actually may mga universities tayo ngayon, more than one NEEDS research center ang naitayo, tulad ng Isabela, ng MSU, ng MMSU, at marami pang ibang halimbawa. Usually, diyan sa mga NEEDS research center, tayo yung nagbibigay ng paunang resources para magawa yung kanilang mga initial projects, okay, na talagang mag-develop o mag-strengthen ng kanilang capability in that area of research. And then ang CHED usually ay tumutulong dun sa mga physical requirements katulad ng space or building, and of course also support to the researchers or faculty members through incentives dun sa within the state universities and colleges. At nabanggit ko na noon na itong mga research centers na ito ay may pagkakataong maging national centers of excellence. Siguro hindi na sa panahon namin, pero yan ay magandang target, lalo na kung ang area of application ng kanilang niche research ay pwede namang magamit sa buong bansa. At meron siyempre tayo mga iniisip na criteria bago talagang makaakyat doon sa level ng National Centers of Excellence. At ako ay naniniwala kahit na napakarami nating sinalungang mga problema during the pandemic, ay ang dami pa ding nagawa ng ating mga researchers. Kaya itong National R&D Conference, gaya nga nung nasabi ko sa speech ko kanina, nakakatuwa kasi ito idea lang nung binubuo yung Technology Transfer Act. At ngayon ay nangyari na. Marami po ang nagsisimula sa pangarap, pero ito ay nagiging totoo. At yan ay naniniwala rin ako na in the area of science and technology development, particularly with the pool of researchers that we have, at ang dami nga doon sa mga researchers natin ay mga pinaaral din natin sa ating DOST scholarship. Dugtong-dugtong na ako kahapon nung in-inaugurate namin yung metrology and chemistry laboratory, ang mga nagpapatakbo.
Okay, mukhang nagkaroon lang tayo ng ilang technical difficulties. Maraming salamat po, Sec Boy. Hintayin po natin kung makakabalik po ang ating secretary. Maaari po nating pakinggan ang iba pa po niyang mga binabahaging istorya. Nakakatuwa po talagang malaman ang iba't ibang mga nagawa ng ating ahensya. Katuwang po ang iba't iba pa pong mga researchers natin. Sabi nga po kanina ni Sec Boy, di ba, mula sa pangarap, ito ay nagiging ganap. At tunay kung tayo ay magtutulungan, mas marami pa tayong magagawa at mas marami pa ang makikinabang. Maraming salamat po, Sec Boy. Mamaya po, kung siya ay makakabalik, ipagpatuloy po natin ang mensahe po mula sa ating secretary. So, this time, let us have our question and answer dahil definitely, we have so many interesting questions from our participants. Okay, so this time, may I call on our dear speakers, okay, our researchers. Saludo po kami sa inyo, okay? Pwede po ba namin kayong anyayahan for this question and answer, Mr. Polotan, Dr. Guerrero, Dr. Alejandria, Dr. Hamoy, Dr. Aureliaza Jr., Dr. Miranda, Dr. Agdepa, Dr. De Los Reyes, Dr. Enriquez, Ms. Riolo, Dr. Grossman, and Dr. Ko at si Dr. Wang. May we request you to please turn on your video cameras, but please remain on mute unless the question is referred to you. So this time, may we call on our moderator, since we are spotlighting, R&D outputs on health sector. It is rightful to just have our moderator, who is the Executive Director from the Philippine Council for Health, Research and Development, or PCHRD. Ladies and gentlemen, let us all welcome Dr. Jaime C. Montoya. Magandang umaga po, Doc Montoya.
Yes, good morning. Thank you very much, Diane. It was truly an enriching and interesting conference, and I am sure we are really dying to have questions raised to all of our very interesting speakers. In the interest of time, may I just request everyone to be brief in the response because we'd like to give everyone the opportunity to share or impart their knowledge to our audience. So I will now start with our first speaker, Mr. Francisco Gerardo Polotan of the RITM, Department of Health. Mr. Polotan, I would like to find out from your perspective, what do you think or how do you think will this technology aid in the recovery of the country amidst this pandemic?
The situation right now is very encouraging with fewer daily cases, lower reproductive rate, faster vaccination rates, antiviral treatments that will be available. All this having positive effects on economic recovery too. So what we want is to continue on this trajectory and prevent reverting back to higher alert levels and lockdowns. So our project hopes to contribute to the national genomic biosurveillance effort by pilot testing and operationalizing routine sequencing in the 5 DOH subnational laboratories across the Philippines using lower cost portable Oxford Nanopore technology sequencing devices with rapid turnaround times. We hope this will help reduce the current challenges of long-distance shipping of clinical specimens, preservation of specimen quality, and prepare key DOH laboratories to respond to future emerging and re-emerging infectious disease outbreaks. Furthermore, genome sequencing can also track the location, growth, and decline of potential SARS-CoV-2 transmission chains. If we can track specific chains of transmission that are on a growth trend, we may be better informed to control their spread and help maintain our current trajectory towards recovery. Thank you.
Yes, thank you very much, Mr. Polotan. It's so nice to know that a young researcher like you has already accomplished so much in terms of our efforts to diagnose fast our COVID-19 cases and determine whether they belong to any of the variants. Let me now ask this question to Dr. Imelda Agdepa of the Food and Nutrition Research Institute. Ma'am, how do you think will this technology, specifically the virgin coconut oil, aid in the recovery of our country amidst this pandemic?
Thank you for that question, Dr. Montoya. Actually, taking a VCO will actually lessen the medical cost of COVID-19 patients going to severe cases. We know very well that if a case is actually severe and goes to the hospital, it costs us millions of pesos. However, if we try to mitigate this at the preventive aspect by giving VCO, we know in our study that it has actually reduced the signs and symptoms of COVID-19 probable and suspect cases to becoming severe. And therefore, it will actually be more economical. Secondly, it can actually improve our economic status, especially among coconut farmers, because we have abundant supply of coconut in our country. Thank you, Dr. Montoya.
Yes, thank you very much, Dr. Agdepa. Now let's shift gears and let's go to traditional and alternative healthcare. I'd like to ask and give this question to Dr. Calvin de los Reyes. Dr. de los Reyes, how do you plan to make traditional alternative healthcare more acceptable to doctors and practitioners of Western medicine?
Magandang umaga po, Dr. Montoya, and to everyone. Of course, what we're currently doing right now is a profiling survey. And the end product is actually a TAT registry. A TAT registry would allow for easier mobilization and organization of practitioners, as well as quality control of their services through setting of minimum qualifications and training. And with the registration, hopefully it will help remove the taboos associated with TAT and allow the enhancement of their knowledge. As I mentioned, a cloud-based data registry of practitioners is currently being developed, and hopefully with this registry, we are able to train, accredit, and certify them, and hopefully eventually integrate them in the current healthcare system.
Okay. Thank you very much again for that interesting response. And I really look forward to traditional alternative healthcare being more available to more Filipinos in the country. So, if I can now go to our biomedical devices group, and I'd first start with Dr. Edward Wang of the Cibol Group from UP Manila. I know that you had a lot of technologies, a lot of members in your group are all accomplished, young but accomplished. May I know how do you plan to commercialize these technologies? And maybe I can also request the other members of your group to also share their perspective so that we'll be able to share our thoughts regarding this question. Thank you.
Hello, Dr. Montoya, and good morning to everyone. Thank you for allowing us to present here. And in answer to your question, how we want to commercialize it, first, I think we need to let everyone know yung potentials, for example, of all the different projects. They're all at different stages. So we're looking at all of these not being used only during the pandemic, but also when we go into the new normal. Because all of these technologies have their efficiencies and their usefulness, not only now, but even in the future, in hospital settings, in clinic settings, and sometimes in some of the technologies, not even just for medical and hospital settings. So now I will shift to Sanipad, because while I was talking on behalf of all the UPC projects, now I will talk specifically about the Sanipod, which is the project that I lead. Now, yung Sanipod itself, it's a self-disinfecting cubicle. It's useful now because it's going to be for the healthcare worker after they come out of COVID-heavy wards. And that's used before they doff. But later on, even as the pandemic subsides and it becomes the new normal, it's going to be very useful for any area which is dealing with infectious disease, and not just for patient care, but also in the laboratory. So even in laboratories, the people, the technicians who work in the laboratories, coming out of the laboratories, they can use this also. And then it goes beyond just yung hospital and clinic settings. It can also be used in other kinds of industries, animal industry, when you have calamities, and when you have other areas where you have a lot of people and you want to prevent the spread of infection. So I think that's the way we're going to show that it's going to be useful, not just now, but in the future and beyond just the healthcare work and hospital setting. Thank you, Dr. Montoya.
Yes, thank you very much, Dr. Ewang. We call him Ewang, so Dr. Wang. Maybe I can also hear from the other members of the Cibol group, such as Dr. Oriliasa, I think, is on board.
Hi, sir. Good afternoon. Good morning,
Yes.
everyone. Yes, sir. Just in addition to what Dr. Wang already said, for me naman, for the telepresence device, our strategy is while we're using it now to help our patients that are currently in need of these devices so that they can connect with the world, we're also continuously developing and improving the features that we get from the feedback from our users. I think this also helps us adapt to the changes that might happen over time, where they will be also useful aside from or beyond the current pandemic. So that's our current strategy. And so far, we've already included a lot of additional features from the original developed product. That's it.
Yeah,
Thank
thank you very much. It's really very interesting that so much has already come out from your group. I'll now proceed to the other groups of researchers. Again, we're going to hear from the Ateneo de Manila group. And I think I'm going to ask Dr. Enriquez, a very prolific group of researchers, I think. So many innovations that you've come out with. May I just know, where did you get this inspiration? How were you able to think of all of these ideas and put them into actual technologies for application?
Gawa rin po talaga ng pandemic yan, Dr. Montoya. Kasi nung May 2020, nung kaumpisa lang po ng lockdown, hindi pwedeng pumasok. Nag-meeting po yung mga opisyal ng Ateneo de Manila at naimbitahan po ako dahil nga po researcher ako. Doon ko po naramdaman yung mga kinatatakutan ng mga administrator, paano papasok ang mga bata kung may pandemya, kailangan ba sila test araw-araw. So isa po sa mga napag-usapan, kung ang COVID testing ng RT-PCR ay tama lamang kung kailan ka sinubukan test na po. Ang sabi nga po ng isang kasama namin doktor, kung ang doktor ay tinest sa umaga, posibleng pag-uwi niya sa gabi, na-infect na siya kasi ang
test result is good as something. Although kailangan naman pong protektado siya para mapanatili niyang negative siya, parang kailangan pa rin ng panatiling testing. Kaya doon po namin naisip na baka ang kailangan po natin na yung mas mura at mas madaling pag-sample ng body fluids, kaya naisip namin yung face mask sensor. So yun po kasi ina-allow naman na gamitin yun sa araw-araw. So dahil bumubuga ang laway at hininga natin doon naman lumalabas ang simptomas ng sakit at COVID. So why not use the face mask sensor? So dahil nga po sa pag-uusap na yan. Doon naman po sa batid band, dahil po pumapasok kami, dahil nag-research nga po kami araw-araw, nagkakaroon po ng mahabang pila sa gate dahil lahat po kami chinecheck yung body temperature. So naisip namin kung gano'n ang mangyayari, kung may pasukan na talaga, magkakaroon ng mahabang traffic sa Katipunan. Kaya po naisip namin, we need a faster way for identification and temperature sensing. So we thought of the batid band. And ang kagandahan po nun, pwede rin po talaga isama doon yung contact tracing na gusto rin po ng aming paaralan. At yung huli po, yung sa yung air filter, hindi lang po kailangan detection, kailangan din protection. Dahil mahal po ang magpagawa ng yung HEPA HVAC system, naisip po namin bakit hindi na lang po mag-invento ng air filter na meron din deactivation property. Dahil nga po marunong naman kami sa nanotechnology, naisip namin na isama na rin po yun para kumpleto po yung protection ng aming mga tauhan sa paaralan at syempre po magagamit naman po ng lahat ng tao sa Pilipinas.
Yes, thank you very much, Dr. Enriquez. And again, more power to your group and all of your young and talented researchers. If I may now ask the developer of our clinical practice guidelines, no, medyo iba naman to, we're going to clinical practice guidelines. I'd like to ask Dr. Marisa Alejandria, you know, you have been in the news very often because of this living clinical practice guidelines. May I know what actually motivated you to come up with this living clinical practice guidelines, and what do you think will be its impact on our efforts to control the COVID-19 pandemic?
Thank you, Dr. Montoya, for that question. This project was inspired by the infodemic, of misinformation, disinformation. At the start of the pandemic, PISMID actually came up with interim guidance. But then, as you know, there is a rapid evolution of evidence, and we needed to critically appraise and synthesize the information for our healthcare providers. So Dr. Inday Dance, myself, and our reviewers in the Clinical Epidemiology Institute in NIH, we got together and submitted this project to really come up with a formal review of the evidence for our healthcare workers and also for the general public, for the people to be aware which interventions are effective, which interventions are harmful. Okay? So both for diagnosis, for treatment, for critical care, and also for non-pharmacologic interventions like the use of face mask, face shield, and then the use of adjunctive therapy. So all of this we reviewed in the clinical practice guidelines, and we would like this to serve as a guidance for our healthcare workers and for the general public. And we continue to update this living CPG as the evidence still continues to evolve. Thank you.
Thank you very much, Dr. Alejandria. We'll continually monitor developments, and I'm sure that the clinical practice guidelines will be a basis for policies that will be implemented by the National Task Force and the Department of Health. Thank you very much. Again, we move to devices, and because we're really overflowing with a lot of technologies today, so I'm really, running after my breath, just to talk about all of these technologies. May I now ask Dr. Samuel Arsenio Grossman of UP Manila, what was your inspiration behind this technology, your PAPR, and how do you think will this help in our current campaign against COVID-19?
Hi, good morning, sir. Thank you for that question. When we saw that our colleagues were getting sick left and right at the start of the pandemic, and we wanted better protection for the healthcare workers, we knew what we wanted, but it was not unfortunately available in our country. We decided to make a PAPR for this purpose. Our PAPR already has been finished, and we are presently at the market or presently working on the commercialization of this. Uh, I think our PAPR will not only be useful in the pandemic, but it will be useful for other areas of industry as well, like the welders, like firemen and policemen in the future. It can also be used for other purposes like travel to make sure that the travelers are safe as well, sir. Thank you.
Okay, thank you very much, Dr. Grossman. And maybe last but not the least, I'd like to go to our, again, equally prolific group of young researchers from the Ateneo de Manila. And I'd like to ask the head of this particular group, Dr. Ricardo Jose Guerrero. May I ask, this question, how do you think were these technologies developed, and how do you think can this, what are your plans to make this more available, commercially, so that it can be used by more Filipinos?
Yes, thank you for the question, and thank you for having us. So we believe that the reason we want to do local development of technology here in the Philippines is that we can address the challenges that we have faced over the course of the pandemic. So the MyPCR projects, the ADS project, and the Swifter project have all been because we've seen the lack of testing, especially outside of NCR. As cases have continued to fall in NCR back a few months ago, cases still continue to rise elsewhere. So we want to develop these technologies that allow for more point-of-care testing and for the establishment of more testing labs. And like I mentioned in the video, we also see that this is just the beginning of what we can do. After COVID, the technologies we've developed can be used for other diseases, communicable and non-communicable. And we do plan on commercializing these technologies. And we made sure that when we designed these technologies, these were made using existing manufacturing capabilities that can be quickly scaled up. Thank you.
Yes, thank you very much. And maybe we can ask also the other members of your group to also speak and share with us how can they make these technologies available. Dr. Ms. Riolo, I think. Ms. Riolo.
Magandang umaga po, and thank you for the opportunity to showcase our projects. Thank you for the question, Dr. Montoya. Did you just want to add on? Did you just want me to add on?
Yes, please.
Okay, just to add on to what Ricky, Dr. Guerrero has already pointed out, we do intend to, we are currently, ADS and Swifter are currently in the R&D stages, and particularly the projects are in the clinical evaluation stage after an encouraging preclinical work. As you may have seen in the videos, we have partnered with Ateneo's Blue Swab and Amplify to make the clinical study happen. And what's not shown in the video are the behind the scenes, where we actively create collaborations and partnerships with clinical hospitals and reference laboratories. And we have also, as early as now, started collaborating with business partners. And like Dr. Guerrero has said, we do so because we do intend to go beyond COVID-19. And for now, as we seek regulatory approval, we intend to build on and strengthen these existing network that we have in order to bring MyPCR ADS and Swifter to the users of existing PCR technology. Thank you.
Thank you, Ms. Riolo. And again, more power to your group. And we hope that we will develop more technologies that will be very useful, especially during this pandemic. Last but not the least, I'd like to ask, it's a commonly used technology, intubation is being done in most hospitals, among physicians, especially for the critically ill. And I think this technology will be very useful. I'd like to ask Dr. Catherine Ko, what are your plans, the next steps for this particular technology? How do you plan to move this forward?
Okay. Actually, good morning, Dr. Montoya and everybody. After we've completed the device, we plan to deploy it to the 3 primary COVID referral centers, namely Philippine General Hospital, Lung Center of the Philippines, and Rodriguez Hospital to test it. And then we're having microbial testing. So a group of anesthesiologists are testing the device so that we can get feedback on how we can further improve the device, as well as when it's deployed already in the hospitals. We've also partnered with University of the Philippines Technology Business Development Office to look for financiers. So part of their mantra is they look at what the end user does in a day and how the technology can improve their current status with how they perform laryngoscope disinfection. And hopefully, we're planning actually with all the other CIBOL projects to have a roadshow for our devices so that we can partner also with DOH hospitals and hopefully show our technology. Thank you.
Yeah. Thank you very much, Dr. Ko. I think everyone will agree that with all of you researchers, with your talent, with your expertise, our science future will be very clear. But before we end this particular Q&A, I'd like to ask our Secretary Fortunato T. de la Peña if he has any questions for this very talented crop of scientists and researchers po. Secretary?
Oo, salamat Doc Jimmy at naputol na ako kanina. Mahaba na yung nasabi ko. Hindi ko alam kung saan ako naputol na bahagi. Pero gusto ko lang ulitin na natutuwa ako dahil sa pagpapatupad natin itong sinasaad sa Republic Act 10055, ang ating Technology Transfer Act na magkaroon tayo ng National R&D Conference ay nalalaman na mas maraming tao kung ano yung ginagawa ng iba't ibang ahensya, hindi lamang ng DOST. Nakita natin dito, halimbawa, napaka-laki ng kontribusyon ng mga taga-DOH, halimbawa. At yun ang mga taga-ibang institution like the universities, sila naman ay ating mga partners na pinopondohan para gawin yung mga research na yan. Kaya ang kanilang mga ginagawa ay tutok na tutok sa kung ano ang pangangailangan ngayon at nagagamit naman talaga. Ang isang concern ko lang ay paano magiging mas malaganap ang paggamit nitong mga teknolohiya na ito kahit tapos na yung pandemic. Alam kong useful pa rin ang mga yan, whether it is a gadget, whether it is a device, whether it is a model or an app. I think this will still be very useful. At ako din ay nagpapaalala na paano ba natin ito ma-communicate sa ordinaryong tao. Alam niyo, napakaganda ng mga researchers natin, magaling tayong mag-Inglesan dito, pero ito ba'y naiintindihan ng ating mga kababayan? Pwede ba natin patulong sa media o magtulungan tayo para ito ay maipaalam sa ating mga kababayan na ito ay ginagawa natin. Kasi halimbawa, yung mga build, ang daling i-communicate sa tao. Pero itong R&D, kung hindi ka scientist o researcher, medyo mahirap i-communicate. Kaya pagsikapan natin na kung paano natin maipapaalam sa taong bayan, kasi ang atin namang mga ginagastos dito, karamihan ay pera ng taong bayan, ay paano natin communicate sa kanila ang ating mga ginagawa. Kagabi, nag-report ako sa Talk to the People ng programa ng Pangulo at very specific ang instruction sa amin na mag-report kami in Filipino. Kaya kung minsan, of course, yung mga scientific terms, ang hirap ding i-translate. Pero nung matapos naman ay ipinakita ng Pangulo ang kanyang appreciation. Sabi niya, nakikita ng taong bayan kung saan napupunta ang ating pera. At binigay niya halimbawa yung mga ginawa natin dito sa science and technology sector. At ako'y nagpapasalamat sa inyong lahat dahil sa kabila ng mga balakid, pagsubok, nitong nagraang mga panahon, talagang nakita ko, sabi nga ni Yusek Geb, yung ating efficient way of generating technologies and innovations kahit na very limited ang ating resources. Ituloy natin ito. Ako ay ano tawag dito, ay forever optimist na uunlad at aasenso ang Pilipinas. Maraming salamat.
Thank you very much, Secretary De La Peña. Talaga napakahalaga ng komunikasyon at siguro nga dapat tayo mas maunawaan ng ating mga kababayan, lalo na yung ating mga ginagawa sa Department of Science and Technology. Yes, Yusek Geb. I think si Yusek Geb may gusto ring sabihin.
Thank you very much, Dr. Jimmy, and congratulations to our first set of presenters. Very inspiring ang inyong mga presentations. Sagot ko kay Sec Boy, sa November 18, 9 a.m., iniimbitahan namin ang mga scientists, researchers at engineers na kasama natin dito, ang Department of Science and Technology, Science and Technology Information Institute ay magsasagawa ng webinar on converting scientists into media magnets. Ulitin ko po, converting scientists into media magnets. Ito po ay ang Department of Science and Technology, Science and Technology Information Institute or STII, November 18, 9 a.m. Magkita-kita po tayo doon para ma-fulfill natin yung sinasabi ni Secretary Boy. Maraming salamat, Dr. Jimmy.
Maraming salamat.
Thank you, Yusek Geb, and take note of that date. So lalo-lalo na sa ating mga scientists and researchers, tayo po ay sanay na sanay sa agham at teknolohiya, pero paano ba mag-communicate, makipag-usap sa ating mga kababayan? Yan ang isang talento na dapat nating payabungin pa. So thank you again. Salamat. At salamat uli sa ating mga very talented researchers at panelists. Part 1 pa lang po ito, may part 2 pa. So hindi ko na po patatagalin. I will turn over the platform, the virtual platform to our MC Dayan. Dayan, salamat.
Maraming salamat po, Doc Jimmy. Maraming salamat po sa lahat ng ating researchers, ating speakers. Kasama din si Secretary Boy at ganun din po si Yusek Guevara. At bago po kayo umalas, let us take this opportunity po. Okay lang po ba? Bago po kayo mag-off ng inyong cameras, let's have a photo opportunity dahil kompleto na lang din po tayo. Okay? May I ask assistance from our IT team? Okay? Are we good? Thank you so much. Grabe. Sabi nga po ni Doc Jimmy, first part pa lang ito. Very engaging, enriching, inspiring, encouraging. Lahat na. First part pa lang yan ng ating NRDC. Okay. Are we good? Are we clear? Okay.
Dr. Agdepa. Si Dr. Agdepa.
Okay, si Dr. Agdepa pa. Okay po. In the count of 3 po, we will all say NRDC. Okay? In 1, 2, 3, NRDC.
NRDC.
Okay, one last shot. Isa pa po para meron po tayong pasobra. Okay, in 1, 2, 3, NRDC.
NRDC.
Okay, maraming salamat po sa inyong lahat. And we are looking forward for more discussions, more insights and learnings on our upcoming batch of speakers. But to our first batch of speakers, please note that there are still some questions unanswered. In the interest of time, di po natin ito na-accommodate. But we would appreciate if you can answer these in our Zoom Q&A chat box. Again, maraming salamat po sa ating lahat. Okay, before we proceed to our second batch of speakers, allow me to just quickly do a shout out to our attendees. Tiyak na tiyak ko na madami po tayong natututunan at very engaging talaga itong NRDC natin. And true enough, sabi nga ni Sec Boy, we have to communicate all our efforts in science. So, good morning po sa ating mga kasamahan, our participants from Bagong Nayon National High School, Samar State University, Phil Rice, Nueva Ecija. We also have our DOST family, DOST councils, NRCP, Picard, Pishard, and PCHRD. Also joining us, Polytechnic University of the Philippines. Nandito din po ang regional offices po ng ating DOST. Aurora State College of Technology. We also have from the House of Representatives, Congressional Policy and Budget Research Department. Ganun din po, Caraga State University, UPLB, Western Mindanao State University. Marami pa pong iba. Maraming salamat. TESDA. We also have We also have from Emilio del Valle, Laguna. Okay, Dr. Jose Fabela Memorial Hospital at marami pa pong iba. Maraming salamat. Thank you for joining us. So I would not prolong this. Let us now continue to witness the R&D interventions in health through this second batch of speakers. Let us all watch these videos.
Abundant in the Philippines, the pili nut is known to have lots of impressive health benefits. Commonly marketed as confectionery products, did you know that this favorite pasalubong from Bicol can also be made into a nutritious and delicious tea? While pili kernels are utilized in the production of a wide array of products, the pulp of the fruit, which is often discarded as pili paste, remains to be an underutilized agricultural residue that possesses great potential as the next healthy tea. The pili paste is rich in phytochemicals, which consumption is known to play a vital role in health through the regulation of metabolism, weight, chronic disease, and cell proliferation. Recognizing these health benefits, the UST Research Center for Natural and Applied Sciences is now working on the development of ready-to-drink pili pomace tea. Geared towards residue reduction, this project hopes to pave the way for maximum and efficient utilization of the pili fruit. Preliminary tests demonstrated that the antioxidant activity of pili pomace tea is at par with commercially available ready-to-drink tea beverages, while some brands are inferior compared to pili pomace tea. These results indicate that pili pomace tea is a potential source of dietary antioxidants that may promote good health and well-being. In order to make sure that the tea is not only nutritious but is safe to consume, the research team conducted several tests including oral toxicity tests, heavy metals analysis, and microbiological assessment, whose results provided initial evidence of the safety of the pili pomace tea. Development and commercialization of value-added food products from this agri-food residue shall open new economic opportunities to the farmers and SMEs, ultimately contributing to sustainability of the local pili industry and providing positive impact to food security. At present, we are conducting shelf life studies to optimize quality and assure the safety of the product. This will ensure that the tea will not only be tasty and healthy, but it will also be safely consumed and stored for longer periods of time. Truly, the pili nut is a versatile little thing and each part serves numerous purposes. The development of this ready-to-drink pili pomace tea opens the possibilities of creating even more products from the pili tree. Watch out for the transformation of this undervalued residue product into a high-priced functional food. Join us as we reach this goal and make lives better for the Filipinos. I'm Dr. Elizabeth Arenas, and a pleasant day to all.
Despite years of collective effort, malnutrition continues to be a perennial problem in the Philippines. Data reveals that for the past 30 years, the statistics on various forms of malnutrition have remained steadily high. According to the 2018 Expanded National Nutrition Survey conducted by DOST FNRI, an alarming 30% of Filipino children are stunted, 19% are underweight, 5.6% are too thin for their height, and 4% are overweight. Malnutrition hinders children from achieving their full potential, both mentally and physically. Juvenile malnutrition makes children vulnerable to health problems, lowers their intellectual quotient or IQ, limits physical and hinders social skills development. Without early and proper intervention, these deficiencies become irreversible, leading to a lifetime of physical and mental challenges. In line with its mandate to combat the country's malnutrition problem, the DOST FNRI developed technologies to help in providing proper nutrition to Filipino children. As a direct intervention to early childhood malnutrition, the DOST FNRI developed rice mongo-based food products. These nutritious food products serve to complement the diets of Filipino children, providing them with foods that are rich in protein and energy. I am Rocky Doctor. Since 2013, we at Nutridence Food Manufacturing Corporation have partnered with DOST FNRI to bring these much-needed products to market. Among our most impactful products is Remo Blend, a rice mongo ready-to-eat instant blend dry cereal. This is a complementary food for children 6 to 23 months old. Remo Blend is easily accessible to Filipino families, is very easy to prepare, and has a shelf life of up to 1 year. For children above 24 months old, a ready-to-eat rice mongo snack curls is also available. These cheese-flavored curls are made from rice flour and mango flour and have a shelf life of 1 year. Products contain 1/3 of the energy and protein requirement for growing children. They also provide minerals, zinc and iron, essential to support the needs of the growing bodies of Filipino children in a food product that appeals to young taste buds. Since its commercialization in 2013, government agencies and private organizations have used rice mongo-based food products in their complementary feeding programs. Encouragingly, a significant improvement in the nutritional status of children was observed after 120 days of feeding time. In particular, measurable increase in weight, height, and cognitive function suggest that these foods have a positive impact in combating malnutrition and its deleterious effects in Filipino children. We also manufacture other rice mongo-based products to meet nutritional needs of Filipinos of all ages. Our mission at Nutridence Food Manufacturing Corporation is to deliver research-based food products to reduce malnutrition among children in the Philippines. And with the flourishing partnership and continuing commitment of the public and private sectors in developing and marketing nutrition interventions for kids, we look forward to the day when malnutrition among Filipino children will be totally eliminated.
Oh, hi there. My name is Drexel Camacho from De La Salle University. And let me tell you something about our research in rice, which was initially funded by the Angelo King Institute and the Commission of Higher Education. I have a teenage son, and as most Asian boys are, he loves to eat rice. And I mean a lot of rice. But wait, there's more. I actually have 3 sons, and they all love to eat rice. So just imagine the amount of rice we consume at home. As a parent, and most of you can relate, we often worry about the nutrients that our kids get from eating so much rice. Now multiply the scenario in my home to the millions of Filipino households with kids and teenagers. By eating so much rice, our diets are not balanced, and we neglect the essential micronutrients. As a result, malnutrition among children is a national problem. According to DOST FNRI, 1 out of 4 kids is malnourished, and 1 out of 3 kids have stunted growth. If our children are malnourished and coupled with poverty, what will happen to the future of our country? Most malnourished kids will grow with physical deformities, high risk of infection, mental disorders, increased mortality, poor health, and the workforce will have low productivity. How can we be of help? I am here to present a potential solution to this massive malnutrition problem. As we all know, milled and polished rice is devoid of nutrients, since nutrients are lost during the milling and polishing processes. We saw that milled rice is a perfect carrier of micronutrients, since kids love to eat milled rice. In fact, fortifying rice with micronutrients is highly recommended by the World Health Organization, Food Agricultural Organization, FNRI, among others. The current protocol in fortifying post-harvest rice involve parboiling, dusting, coating, and extrusion, of which the commercially adopted one is the extrusion process. The extrusion technique, however, produces rice that have different grain properties from the natural rice. We developed a technology to fortify rice, not only with minerals, but also with vitamins and essential nutrients. We use any available commercial milled rice. We modify the surface to make it porous. We attach the nutrients by soaking. Then we dry it to afford a premixed fortified rice. By modifying the surface of the rice, it becomes porous, which allows efficient entry of the nutrient into the core of the rice. As a result, the fortificants remain in the rice even after washing and cooking. It also makes the texture of the rice even smoother. For more details about the technology, please check our papers published in journals and our patent application. I would like to acknowledge Dr. Aldrin Bunto and Roel Chioson, who did most of the research works. These are examples of premixed rice fortified with iron, calcium, zinc, folic acid, vitamin B1, vitamin B6, and vitamin B12. We are currently developing a product that we hope to have a unique selling proposition as a fortified rice that is healthy and nutritious, incorporating not only minerals but also vitamins. A premix sachet or a packed rice with fortified premix can be developed. We can also do customized formulation to address specific growth needs of different sectors. Nutritious pop rice snacks can be developed to be sold to canteens in schools, especially in public schools, thereby reaching the kids who are affected with stunted growth. We're seeking seed grants of 5 million pesos from DOST or angel investors for product certification and in setting up the manufacturing plant. We invite you to partner with us as we feed the nation right for a healthy Philippines. With 40 grains, our worry about our kids eating so much rice is lessened as we feed them with nutritious rice towards healthy growth. Tara, kain tayo!
Aside from air and water, what could be more essential than food in sustaining life and in maintaining good health? It is within this context that the R&D initiatives under the Galing Picard program are focused on generating and testing technologies that promote production of essential food products that are nutrient-filled and compliant to food safety requirements. Speaking of essential food products, pork is a major source of animal protein in the country. It contributes about 60% of the total animal meat consumption of Filipinos. Unfortunately, local pork supply is currently being challenged by the African swine fever or ASF virus. Because of ASF, local pork supply is reduced by about 30%. As of February 2021, the swine industry suffered losses of an estimated 80 billion pesos. Closure of small and large-scale swine farms significantly reduced the sales of feeds and other inputs. This created negative impacts on the livelihood and employment opportunities of many workers who are dependent on swine and its allied industries. If left unabated, ASF is likely to put the flourishing Philippine swine industry to an end. Responding to the urgent need to manage ASF and to serve as an aid to the industry's repopulation efforts, DOST Picard supported the wide-scale testing of the locally developed ASFV nano-gold biosensor that shows more than 90% detection efficiency of ASFV DNA. The kit detects the presence of the virus in feeds, water, and in contaminated surfaces. At an estimated cost of 300 pesos per reaction, it is cheaper than the standard laboratory polymerase chain reaction test. It is also easy to use and produces results within 45 minutes compared to the 3 days or more turnaround period in standard laboratory diagnostic protocol. The ASFV nano-gold biosensor kit is a useful tool in selective culling of pigs in suspected farms and in routine testing of feeds, water, equipment, and other materials that need to be brought into swine farms. It also facilitates practical testing of farm structures, surfaces, and the microenvironment prior to restocking of previously infected farms. Another essential food product, green mussel or tahong, is among the major sources of protein and minerals. It also provides income and livelihood to fisher folks and to those engaged in the distribution and marketing of this commodity. Green mussels are filter feeders. They filter bacteria, plankton, and other small organisms in waters. Thus, mussels may have high levels of bacterial content that makes partially cooked or raw mussels unsafe to consume. To eliminate or reduce the bacterial load in tahong, a depuration technology was developed. Depuration is the process of keeping live harvested mussels in treated seawater using a recirculating or a flow-through system. This technique allows the mussels to self-purify and expel ingested bacteria. The depuration technology not only ensures freshness and quality of green mussels, it is also compliant to the health and safety requirements. Vegetables are known and recognized as healthy food. They provide vitamins and minerals that are essential to maintaining health and wellness, and in enhancing our resistance to diseases. However, these qualities are being diminished by fears that they are laden with pesticide residues, toxins, and other harmful chemicals. Thus, a technology on organic vegetable production was developed. This technology is guided by an organic farming framework that covers 1. Varietal evaluation and organic seed production, 2. Organic and microbial fertilizer production, 3. Development of biopesticides and biocontrol systems, and 4. Value chain and policy advocacy towards promotion of organic vegetable production. Aside from DOST Picard's initiatives on vegetables, Other R&D activities on organic agriculture being supported by the Council are organic coffee and sugar production, development of new and enhanced biofertilizers, biostimulants, and biopesticides for increased crop productivity, integrated pest management, and nanobiosensors for disease surveillance and diagnosis. Advances in maintaining good health and sustaining life have been achieved through R&D while addressing food security and food safety risks. DOST Picard constantly shared its expertise and other resources to contribute to the sustainable production of food vis-a-vis promote health and wellness. Tandaan, ang kalusugan ay higit kaysa ano pa mang yaman, kaya nararapat na ito ay pangalagaan.
Fresh and nutritious foods are key to a healthy diet. Green and leafy vegetables, straight from the farm, is as healthy as you can get. To make sure that farm products we eat are free from harmful contaminants, our team at the University of the Philippines, Los Baños, in collaboration with the Laguna State Polytechnic University, together with the National Research Council of the Philippines, created the Fresh Farms Program. This is a great way to flag and resolve issues that threaten the health of those who consume farm produce and those who work in farms, and can set a baseline for food production standards. The Fresh Farms program uses both simple and advanced diagnostic technologies to detect chemical and biological contaminants in farm produce. We sourced vegetables from organic and conventional farms in Laguna and Quezon and tested them for contamination. And what we have found is a cause for concern. All tested samples from both conventional or organic farms were found to have coliform and salmonella. This indicates fecal contamination. 14% of the vegetables, mostly leafy vegetables such as lettuce, had parasites from pigs, cows, birds, chickens, rodents, dogs, and cats. Some samples are contaminated with heavy metals such as lead and arsenic, especially for vegetables from farms near a geothermal plant. The use of improperly treated manure as fertilizer, as well as the poor sanitation and hygiene practices of farm laborers, were among the reasons of these results. These results, while concerning, empowers us to come up with solutions, like preventing animal intrusion into fields and encouraging the use of treated manure as fertilizer, promoting access to clean water, sanitation, hygiene, and education in the agriculture and food sector, and providing education and technical assistance to the leafy green sector, emphasizing the effects of adjacent land use to farm produce and the importance of clean water and agriculture. Researchers need to prioritize developing new science on reducing the risk of pathogen contamination in raw green leafy vegetables. The FDA must work with experts in both public and private sectors and the academe to better understand the ecology of pathogens. Policymakers should consider including science-based standards in the Food Safety Act of 2013 to ensure that water and soil amendments like fertilizer or compost do not contribute to produce contamination. A mechanism for the rapid traceback of contaminated foods to their source must be put in place. Finally, we must all commit to a One Health approach to keep leafy greens safe for consumers. This means engaging the agriculture and health sectors to take urgent action in prevention and research efforts. Food safety is a shared responsibility. It involves not only food producers, distributors, and retailers, but also legislators, regulators, and consumers. With all of us working together, and with the help of modern science, we can make sure that our food is nutritious, clean, and safe from farm to table.
Thank you to all our researchers. Thank you also for stirring up our appetite, not only for science, but even for food that are made better by science. We've talked about the RTD, pili, the rice mungo blend, what else? The Remo blend, fortified rice, and the food safety measures, and among others. So we hope that this made you hungry, but don't worry because we will be having our break later on. So this time we will be having our second portion of our Q&A so that we can discuss more about these initiatives on the health, on our health interventions. So may I call on our dear researchers behind these food innovations, Dr. Arenas, Mr. Doctor, Dr. Camacho, Dr. Baguio, Dr. Paler. Please do open your videos and please remain on mute unless the question is referred to you. And again, I am calling on our very great moderator, Dr. Jimmy. Can you join me again here?
Yes, Dayan, maraming salamat uli. Ngayon, we are in the part 2 of our Q&A and parang akala nyo tapos na yung part 1 pero may part 2 pa tayo. This is equally interesting. Now we're going to nutrition. Pagkain naman tayo ngayon. Very interesting topic. And may I just request our speakers, we're all excited to hear you. Just to give more time for question and answer is for your response to be brief. No? So may I now start with Mr. Doctor of the Nutridens Food Manufacturing Corporation. Napakadaming technology sa inyong naisagawa na, no? Itong mga fortified rice mungo cereal, fortified rice mungo blend, etc. No? Ang tanong ko po ay ano ang nag-motivate sa inyo, nag-inspire sa inyo to develop all of these technologies, and how do you think will this contribute to our problem of malnutrition and make Filipino lives better in the country?
Magandang tanghali, Dr. Montoya.
Okay.
Yes. Yeah. Good afternoon po, Doc Jimmy, and to everyone. My encounter with malnourished children in the countryside, which was captured as shown by DOST FNRI Nutrition Survey 2018 has much impact on me. It has created a personal and corporate mission of helping up their condition. So I adopted various technologies of the DOST FNRI. Now, sa paggamit po ng as to the increase in height and weight of children using these technologies, particularly po yung ating rice mungo technology. In the malnutrition reduction program, which was implemented in different areas in the country. This further convinced me that further usage of these food technologies would increase the nutrition in the country. Now, that feeding children with the right technology, such as rice mungo variants, today could save children from malnutrition. Hence, a healthy and productive citizens in the future. na nakipag-ugnayan sa DOST, yung pagkain dapat at sapat. Yun po, Dr. Jim.
Maraming salamat, Mr. Doctor, for your question. Talagang natikman ko yung mga produkto nyo. Masarap talaga. Hindi lang masarap, nutritious pa. So thank you very much. So now I would like to turn the floor to another distinguished researcher. We have Dr. Sinan Baguio of DOST Picard. Napakaraming technologies ang ipinakita ninyo, no? Talagang fully packed yung presentation nyo. Nandyan yung nanogold biosensor for African swine flu, nandyan yung muscle depuration. No, mahilig ako sa muscle kasi, kaya very interested ako dyan. And organic farming technologies. Ang tanong ko ay, sa dinami-dami ng technologies to, again, what inspired you to develop all of these technologies and how do you think will this contribute to making lives of Filipinos better?
Thank you, Dr. Jimmy. Actually, the inspiration of those development of those technologies were drawn from our experience with the COVID-19 pandemic and the ASF outbreak that we experienced since 2 years ago. The health emergencies, both in humans and in pigs, have caused critical difficulties in the supply and distribution, including the access of food to our public. That's why we thought, actually, these are not new technologies. These are technologies that are just sitting around the corner. So that's why we thought of aggressively promoting this to ensure stable supply of good quality and safe food to the communities in response to whether there will be calamities or health emergencies. Yun po yung inspiration on Dr. Jimmy.
Okay, maraming salamat, Dr. Sinan. Talagang, sabi ko nga, fully packed eh. Ang daming technologies kayo na-present at lahat ay napaka-useful at napaka-relevant, especially ngayon ng pandemic na problema tayo sa food supply. So maraming salamat, Dr. Sinan.
Maraming salamat din po.
Yes. So now let's go to another equally interesting technology. Fortified rice naman tayo ngayon na staple food ng mga Pilipino. No? And I'd like to ask Dr. Drexel Camacho of the De La Salle University, Manila. Paano ang inyong plano na ma-commercialize ito, na maging mas available po to sa karamihan ng mga Pilipino, itong technology develop nyo na itong surface modification using ultrasound, no, ultrasonic waves through development of fortified rice?
Yes, thank you for that question, Dr. Montoya. Yes, the immediate plan is to transition from research activity to commercialization. And we are looking for funding or partner industries to help set up a small production line so that we can study, we can establish, and we can standardize the production parameters. And of course, products will be developed, and using the production line that we are going to set up, data such as nutritional content, the stability, and shelf life will be validated. And of course, we're looking forward for certification from the FDA, particularly on the facility to operate a food laboratory or food facility, and of course, certification of the product. So we're looking for developing products such as premixed rice that are included in sachet, so that the logistics aspect of selling it and using it, especially for food feeding programs by barangay centers and NGOs, can be easy to handle. So we're looking for funding, and currently we are having a project being reviewed by the DOST for this proposal.
Thank you very much, Dr. Drexel. I'm sure makakakuha kayo ng suporta dahil talaga tayo ay rice-eating country. At marami nga sa atin, kahit walang ulam, basta may kanin, okay na. Kaya napakahalaga na inyong technology, talaga makatutulong para mabigyan natin ng added health benefits ang mga taong mahilig kumain ng rice. No? Anli pa nga ang tawag nila. So salamat Dr. Drexel Camacho. So now we go to Dr. Vachel Gay Palier of UP Los Baños to answer some of our questions. Alam mo, very interesting yung inyong konsepto, itong fresh farms. At talagang marami tayo ngayong mga kababayan na gustong magkaroon ng similar initiative. So can you just tell us, ano po yung plano nyo para talagang ito ma-adapt ng mas maraming Pilipino, mga kababayan natin?
Unang-una po, nakita namin sa Fresh Farms project na to na with NRCP, the importance of good agricultural practices, no, yung ating mga farming practices that contribute to parasite and microbial transmission that can contaminate agricultural produce. So mahalaga po siguro ang capacity building sa agricultural sector. At pangalawa ay siguro kailangan na rin natin ng mga reference diagnostic laboratories para sa tracking ng ating mga in case magkaroon ng outbreak. So dito sa UP Los Baños, we're beginning to put up laboratories that will facilitate or that will contribute to trace back ng ating mga food contamination or to prevent possible outbreaks So sana ito ay magkaroon tayo ng systematic traceability of pathogens in the agricultural food supply chain, and that we will improve our facilities for diagnostic reference laboratories. And that's part of our dream here in the Institute of Biological Sciences, to build a reference diagnostic laboratory for food contaminants traceability po.
Yeah. Maraming salamat Dr. Palier, kasi ang inyong project hindi lang nutritious food but safe food para sa lahat ng ating mga kababayan. So more power at talagang malayo mararating talaga na inyong project. Napakahalaga po ng inyong ginagawa. So last but not the least, I'd like to ask our researcher from the University of Santo Tomas, Dr. Elizabeth Arenas. Alam nyo, ako personally mahilig ako sa pili. Meron na pala tayong ready to drink na pili. Napaka-interested ako dyan. So Dr. Arenas, how do you think will your technology aid in this present problem of recovery in the country amidst this pandemic? Alam ko napakabigat ng tanong ko, pero ano po tingin niyo, makakatulong ba itong ating ready-to-drink pili and all of the other technologies that you are developing? Dr. Arenas.
Yes, good morning. Pleasant morning to everyone. Thank you for that question, Dr. Montoya. So apart from waste utilization, this project is geared towards the development of a functional food product out of this agro-industrial waste, which is the pili pomace. So hence, this technology will primarily help in the promotion of good health, especially in this pandemic situation. This will promote good health by supplying dietary antioxidants.
Okay, maraming salamat. Alam mo, talagang many people are looking forward to this product kasi it's masarap, I'm sure, and also nutritious. So, I think we've a round up of all of the very interesting discussants and speakers. I'd like to congratulate you for your very interesting presentation, and more power to your future technologies to bring this further to the next level and make this commercially available or available to most Filipinos. Kasi in the interest of time, medyo nag-overtime na tayo, but I'm sure people are still interested to hear more from our scientists, but we'll have more opportunities in the coming days. And I'd like to turn the floor to Daan. Daan?
Thank you so much, Doc Jimmy. Talagang napaka-interesting nitong discussion natin at ako ay nabusog ng mga madaming impormasyon mula po sa ating mga researchers. At sana patuloy tayong magutom ng mas marami pang mga paraan para mas mapayabong. Just like what you said, Doc Jimmy, we should take this to the higher level, ma-commercialize, mas madami pang makinabang ng mga proyektong ito. So again, there are still some questions left unanswered in our Zoom Q&A chat box. So please, may we request our dear speakers to please answer them, accommodate them, and of course, I would not miss this for the world. Let us have this quick photo opportunity again. Okay. May we request our speakers again? Together with Doc Montoya, okay. Together with Yusek Geb, if she's still there, and also Sek. Okay, para po sa ating quick photo opportunity. Okay. All right. And also, of course, our DOST officials, please also join us in this photo opportunity. Okay. Are we good? I think we are. So, may I ask the help of our IT team to capture this moment? And again, on my cue, on the count of 3, we will say NRDC. 1, 2, 3, NRDC.
NRDC.
And one last shot. 1, 2, 3, NRDC.
NRDC.
Okay. Mukhang gutom na po tayo. And of course, that's it for our morning session on kalusugan. And we hope that these R&D health interventions will aid us in the road to recovery, safety, and in being healthy. Maraming salamat po sa inyong lahat. This has been a very interesting morning session and we are looking forward for more interesting topics and discussions, ideas, collaborations, participations for our afternoon session. But before that, bago po tayo kumain at mag-break, quick greetings lang po sa ating mga participants who still joined us this morning. Maraming salamat po for the support of USAID Stride, led by their Chief of Party, Dr. Richard Abendan. Maraming salamat po sa inyo. Also, I still have here some more. The CLSU, maraming salamat po for joining us. Pamantasan ng Kabuyaw. Nakita ko din po kanina dito, we also have from Tawi-Tawi. Maraming salamat po. Thank you for joining us. SDO, Pagadian City, and we also have from the DOH Drug Treatment and Rehabilitation Center. Ko alam kung nabanggit ko na kanina, but thank you for joining us. PEZA also joining us, and NEDA also joining us. Maraming salamat po. And also Sorsogon State University, UP Visayas, and CBSUA Pili Kamsur. Sino pa ba ang hindi ko pa nababanggit? Agusan del Sur, Tarlac Agricultural University. Maraming salamat po sa inyong lahat. Thank you so much for joining us. So, we hope that we will see you again later in our afternoon session. And we would like to request that you have your laptops on standby mode because we would be playing different programs of DOST while you are having your lunch. And also a reminder to all our participants, meron po kaming isisend sa inyo na link for the evaluation form. We would love to hear from you so that we can improve our services para mas marami pang mga ganitong klaseng event ang pwede po nating magawa at maibigay po sa ating mga mamamayan. And maraming salamat po, and we have more exciting lineup of research and development initiatives later this afternoon. So we hope to see you all later. Enjoy your lunch and goodbye for now. See you at 1 p.m. Thank you.
Ang agham at teknolohiya ay daan tungo sa pag-unlad ng bayan.
Susi sa pag-unlad ng ekonomiya, patungo sa magandang kinabukasan ng bawat isa.
Paglikha, paghahanap,
at aplikasyon ng kaalaman para sa kaunlaran ng pangkalahatang pamumuhay.
Ay sinag ng pag-asa.
Ay importante sa pag-unlad ng ekonomiya ng isang bansa.
Ang game changer para sa new normal.
Ay susi sa kaunlaran.
Ay mapagpabago, napapanahon at tumutugon sa mga pangangailangan ng lipunan at patuloy nitong pag-unlad.
Ay sandigan ng buhay at ang maghahatid ng magandang kinabukasan.
Ay tulay at lakas tungo sa kaunlaran ng ating ekonomiya.
Susi sa kaunlaran. Ang siyang mangunguna sa pag-unlad ng Rehiyon 1.
Ay susi sa pag-unlad ng Mindanao.
Ay sandigan sa pag-unlad ng ating bansa.
Ay para mabago at umusbong ang buhay ng mga seaweed farmers.
Para sa mga pamilya na nakatira sa mga pamayanan na jida at walang kuryente.
Ay para rin sa pag-create ng mga livelihood para sa mga small farmers natin and IT communities.
Para sa ating mga kapatid na lumad dito sa Davao Region.
Ang agham at teknolohiya ay para sa bayan.
Ang agham at teknolohiya ay para sa pagbabago at pag-unlad ng bawat Pilipino.
As we navigate through the dramatic shifts caused by the COVID-19 pandemic, we are called upon to become catalysts of change. We nurture innovation at its foundations, creating convergence and developing readily adaptable solutions where they are needed most. Together, shaping the new normal and beyond, we can make it happen. Through science and technology, DOST empowers private companies to adapt to an ever-changing economic landscape. As part of the Science for Change program, the collaborative R&D to leverage Philippine economy, or CRADLE, transforms the way we do business through Filipino-honed solutions. Academia and industry, bringing innovative ideas to life. Fostering collaboration in research and development, the CRADLE program offers a grant of up to 5 million pesos to collaborative R&D between local Filipino-owned companies and higher education or R&D institutions to address a present need while promoting the smooth transition of new technologies. We are looking for project proposals that are innovative, relevant, problem-focused, cost-competitive, cost-efficient, scientifically sound, and technically feasible. Partner with us and take on the challenge. For more details, follow us on Facebook or shoot us an email. Turn ideas into reality with R&D.
I feel fortunate enough to be given that opportunity to be able to apply what I know, lend my expertise, and provide technical assistance to the national COVID-19 response.
There is one thing in life that will never change, that a Filipino will always have the heart for fellow Filipinos. This pandemic has brought together Filipino scientists from around the globe, imparting their experience in creating a better Philippines. Learn more from our Balik Puso, Balik Pilipinas, Balik scientists as we celebrate this year's achievements and how far we have gone. Join us in the Balik Scientists, Tugon sa Hamon ng Panahon.
With the COVID-19 pandemic, we are facing an unprecedented global crisis with immense local impacts. Government, industry, academia, and civil society are working together more than ever, so we may not only adapt to present conditions, but are able to transform it. Inclusive innovation is our new normal. It's happening now, and we are part of this change. All over the world, people are responding to global challenges with innovative solutions backed by research and development. Setting the foundation for a globally competitive knowledge economy, the Department of Science and Technology launched the Science for Change program, enabling individuals and institutions to develop products and services that improve the lives of Filipinos in the countryside, creating opportunities to improve science and technology infrastructure in the regions. S4CP introduces the Niche Centers in the Regions for R&D program, or NICER, a grant for universities to become focal points for R&D from a local to a national scale, where research outputs meet industry needs. The grant is open to higher education institutions with a capacity for multi-year R&D program implementation. We're looking for collaborative proposals that are unique throughout the regions, that benefits local industries, promotes inclusive growth, and is anchored on the harmonized national R&D agenda. Across the nation, there are NICER centers with many more in the pipeline. Send in your applications and contribute to the development of your region. For more details, follow us on Facebook or shoot us an email. We'll help you find your niche.
Pilipinas, isa sa 17 mga bansa na mega biodiverse sa buong mundo. Mayroon itong 228 key biodiversity areas na tahanan ng 855 tinaguriang globally important species ng mga halaman at hayop. Tampok din sa bansa ang natatanging sari-buhay sa baybayin dagat at isla dahil sa lokasyon nito sa loob ng Coral Triangle. Ang Coral Triangle ay ang sentro ng pinakamataas na sari-buhay sa karagatan. Tinagurian ang bansa bilang Center of Marine Biodiversity in the World at ang Verde Island Passage bilang Center of Marine Shorefish Biodiversity. Ang Pilipinas din ay bahagi ng sentro ng iba't ibang palay, nyog, monggo, taro at yam, pati na rin ang sentro ng pinagmulan at iba't ibang mga saging sa Timog Silangang Asya. Yan ang sari-buhay. Ang sari-buhay ay biodiversity sa wikang Ingles. Ang ibig sabihin nito ay ang pagkakaiba-iba at pagkakaugnay ng lahat ng may buhay, tulad ng hayop, halaman at microorganisms. Patuloy ang pagtuklas ng mga bagong species ng mga hayop at halaman sa bansa. Kaya naman, nararapat lamang na mayroong mga proyektong nagsusulong ng pagpapabuti at pangangalaga ng ating sari-buhay. Ang Biodiversity S&T Program ay binuo upang suportahan ang DOST sa layunin nitong konserbahin at magbahagi ng mga impormasyon at sustainable use o likaskayang paggamit ng sari-buhay at mga kaalaman, produkto at teknolohiyang mula dito. Kasama rin ang pagbalangkas ng mga pulisiya sa access at benefit sharing ng ating genetic resources. Sakop ng programang ito ang pagdodokumento ng mga bagong species ng hayop at halaman, ang pagtatala ng kanilang distribution, behavior, at iba pang ecological observations. Kasama rin ang pagtuklas at paggamit ng katutubong halaman at hayop sa bansa. Isinusulong din ng programa ang pangangalaga at pamamahala, pagsusuri at pagbabantay, at ang likaskayang paggamit ng ating yamang dagat. Ang mga proyekto sa Biodiversity S&T Program ay matutunghayan sa isang serye ng DOST Picard na pinamagatan din na Sari-Buhay, kung saan itatampok ang mga resulta ng mga pananaliksik gamit ang agham at teknolohiya. Ang kauna-unahang series ng DOST Picard ay mapapanood sa YouTube. Gusto mo bang malaman ang mga kwento? Kung ano-ano na ang mga bunga ng agham at teknolohiya mula sa Biodiversity S&T Program ng DOST Picard? Tunghayan natin ang mga kwentong ito dito sa Sari Buhay.
Sari Buhay, Sari Buhay, Sari Buhay, Sari Buhay. Sa Sari Buhay lahat tayo'y magkakaugnay. Sa tulong ng agham at teknolohiya, hawak natin ang tagumpay. Ang kalikasan ay kayamanan, ang pagkalinga ng ating tahanan. Magkabisik at tayo'y magkaisa. Sari Buhay, 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 Sari
milyong itlog a day. Na-produce po namin yan dahil nag-invest, nag-aral, at nag-research ang mga farmers, ang egg farmers ng San Jose, Batangas.
Nakapag-start noon ako ng mga around 2,000 agad noong time na yon. So from that 2,000, tuloy-tuloy na yun, medyo napalaki ko.
Ito pong low value eggs, nasa sell off lang po siya sa 2 pesos. May 82,000 tayo na piraso, 160,000 pesos on a daily basis. So kung monthly po yun, nasa 4.8 million po in a month.
And ang amin pong aspiration is gamitin ang science and technology to be able to become better in what we are doing. Very successful ang collaboration natin with the DOST and UP Diliman sapagkat po nagamit ng buong industry ang siyensya.
A new dawn awakens, reaching for the skies, rising to the challenge, rushing to a brighter tomorrow. The Filipino inventor is leading the way, and the DOST Technology Application and Promotion Institute is with them for the journey. Today, everyday Filipinos reap the benefits of truly local innovation. This is TAPI's vision, to plant a culture of innovation and discovery among the Filipino people. TAPI believes in the importance of science education. Students now have a deep appreciation of science and technology through TAPI's programs that aim to spark the genius of invention in every young Filipino. DAPI passionately looks out for the well-being of the Filipino inventor by assisting them in the protection of their rights and in gaining tax exemptions for their hard work. The adoption of Filipino inventions made our industries more efficient and more productive and has led to new products being introduced to the market. DAPI makes possible projects that have created opportunities and employment for our people, raising standards to achieve global competitiveness. With the latest technologies, local industries have grown faster and are more productive. Farmers, fishermen, and other micro, small, and medium entrepreneurs can now bring their products to millions of homes both here and abroad. At the same time, the spirit of discovery has allowed new businesses and industries to emerge. DAPI works to build the capabilities of inventors to create new businesses out of their inventions and reap the financial rewards for their innovations. Now, more than ever, the genius of the Filipino is shining through. Techniques, machines, and innovations created by Filipino innovators are proudly exhibited to industry players and the public at large. From development to prototyping to promotion and industry adoption, DAPI has guided the Filipino into the dawn of a more prosperous day. But the new day of progress and prosperity is only beginning. The Filipino is leading the way, and the DOST Technology Application and Promotion Institute will be there for the journey.
Semiconductor packages for electronic products like cameras, computers, cell phones, and more are manufactured here in the Philippines and comprise a majority of the exports of the country. The challenge is that thinner and wider packages are demanded, needing an enhanced packaging design that can withstand varying structural and thermal loads, even before manufacturing begins. At De La Salle University, together with our industry partner, Integrated Microelectronics Incorporated, we further develop a virtual model of the semiconductor packages. In the future, we will be able to design and manufacture better packaging to satisfy the demand of the global market for enhanced semiconductor products.
The Philippines is one of the world's mega-diverse countries, rich in natural resources and biological diversity. The very reason why agriculture, marine and aquatic, and natural resources are foreseen as key sectors in achieving sustainable and inclusive development in the country. With the right policies and programs in place, backed with appropriate technologies and innovations, attaining development is not far from reach. This is where the Philippine Council for Agriculture, Aquatic and Natural Resources Research and Development, or PICARD, takes its ground. PICARD was established in 2011 through the merging of two sectoral councils under the Department of Science and Technology. The Philippine Council for Agriculture, Forestry and Natural Resources Research and Development, and the Philippine Council for Aquatic and Marine Research and Development. Consolidating these two organizations into one apex council broadened its coverage, as well as provided a unified and holistic approach in addressing concerns in the agriculture, aquatic, and natural resources, or AANR sector. The Council aims to provide strategic leadership in promoting science and technology, or S&T, as a platform for AANR products innovation and environmental resiliency.
Committed to sustaining dynamic leadership in S&T innovation in the AANR sector, Picard formulates policies, plans, projects, and strategies for S&T development in the AANR sector. It programs and allocates government and external funds generated for research and development or R&D efforts, as well as monitors R&D projects. It also generates external funds for R&D activities. Picard carries out programs and advocacies according to 4 banner programs that embody its S&T interventions in the AANR sector. These are Strategic R&D, R&D Results Utilization, Policy Research and Advocacy, and Capability Building and R&D Governance. The Council builds partnerships with local and international organizations for joint R&D, training, technical assistance, and information and technology exchange. It also ties up with funding institutions to support its programs and advocacies. Through the years, Picard has been a lead organization in managing the network of government and higher education institutions involved in the AANR sector. Guided by its core values of relevance, excellence, and cooperation, Picard catalyzes development through advancing S&T in the AANR sector. It is steadfast in its commitment to its mandates for the betterment of the lives of every Filipino, now and in the generations to come.
Sino pa ba ang tunay na magmamahal ng Pilipinas? Kundi tayong mga Pilipino lamang.
Nag-uumapaw ang mga oportunidad para sa mga may nais ng pagbabago. Maging hudyat ng pagbabago, makibalikat sa pagiging isang balik scientist, sapagkat tinatawag ka ng inang bayan, tinatawag ka ng kapwa mo Pilipino. Ang aming hamon, kailan ka babalik?
biodiversity ay sari-buhay sa wikang Filipino. Ito ay ang pagkakaiba-iba at pagkakaugnay ng lahat ng may buhay, tulad ng halaman, hayop at microorganisms. Ang Pilipinas ay isang biodiversity hotspot. Mayaman ang ating bansa sa biodiversity o sari-buhay, ngunit mataas ang panganib ng pagkasira nito. Kabilang ang bansa sa top global conservation priority areas dahil halos 700 species ay nasa endangered status na. Isa ang bansa sa lumagda sa Convention on Biological Diversity o CBD. Kinikilala ng CBD ang kahalagahan ng sari-buhay at ang pananagutan ng tao sa pangangalaga, pagpapanatili at sa patas at wastong paggamit ng mga yaman na ito. Alinsunod sa misyon ng CBD, ang DOST PCARD ay bumuo ng Biodiversity Science and Technology Program. Ang programa ay naglalayong pangalagaan ang sari-buhay at linangin at paunlarin ang mga produktong mula rito.
Ang bansa na nagbibigay ng kahalagahan sa research ay matagumpay at mas produktibo na isang bansa.
We are hoping that we will be able to reach more far-flung areas in the country. We will be able to guide them along the way and help them spur the development in their respective regions.
We implement innovative technologies by interfacing with our partners in the Icelandic community, from the academe as well as the government, to create a synergy.
As researchers, we need other people's expertise to lift our research. So we always have to collaborate.
Ngayon ay nabibigyan po ng chance ang mga ordinaryong mamamayan tulad namin na magkaroon ng kaalaman sa pag-conduct ng research para po ma-improve pa po ang aming community.
Malaking role ang ginagampanan ng science and technology sa anumang aspeto ng ating pamumuhay, anuman yung ating estado sa buhay.
With this seminar, I'm sure na-increase yung kanilang motivation, nagkaroon ng dahilan ngayon para sila ay gumawa ng mga panibagong research.
We hope that after this, lalo pa po nating may involve ang mas marami pang tao na tumulong at gumawa ng mga researchers sa kanilang mga ahensya para po sa probinsya natin at sa ating mahal na bansa.
Research-driven insights can lead to optimal policies. Over the years, DOST PCARD has continuously invested in socioeconomic and policy studies that generate insights towards achieving an enabling policy environment for the agriculture, aquatic, and natural resources or AANR sector.
Responding to the need for more aggressive policy advocacy, we are launching Policiencia,
an umbrella program integrating our policy analysis and advocacy initiatives. Polisciencia means polisia or policy, and scientia or science. Through Polisciencia, we aim to advance more science-informed and foresight-driven planning and policy development. Using the wealth of knowledge generated from R&D, we will intensify our efforts in advocating science-based policy reforms. We will also amplify the voice of science community in decision and policy making, not only in the AANR sector, but also in other science, technology, and innovation policy concerns.
Polisciencia has the following program components: Policy Environment Scanning and Information Management, where there would be a systematic scanning of news updates and completed policy studies to capture findings with policy implications, current events, and the latest policy pronouncements as inputs to portfolio development, planning, and policy making. Policy Advisory, to provide science-informed recommendations to policy-making bodies. Policy Research, to investigate policy-related problems affecting the AANR industries, assess different policy options, and recommend optimal policy solutions. Policy Advocacy. This is where we build a coalition of policy advocates to push for and provide mechanisms for pilot testing science-based policy reforms towards achieving macro-level to industry-specific policy goals. Foresight and Strategic Insights, to apply foresight and strategic insights in planning and policy making. Promotion and coalition building, to promote the DOST Picard policy portfolio and urge the current network to be part of a strong coalition. And lastly, capacity building, to create a critical mass of R&D workers in the regions who will spearhead the analysis and advocacy of region-specific policy issues.
Through Polisciencia, DOST, and Picard, together with our partners, scientists, researchers, our fellow civil servants, industry professionals, and clients in the AANR sector, we will champion science and evidence-based formulation of optimal policies for a more responsive and inclusive science and technology development.
The surge of the COVID-19 pandemic had put a threat to the advancement of science and technology in the country. However, the Balik Scientist Program, as administered by the Department of Science and Technology, continues to uphold its goal to create opportunities and to build stronger scientific communities without compromising the health and safety of our Balik scientists. Last September 1, 2021, the DOST BSP enhanced its supplemental guidelines and risk management plan by amending the Special Order Number 0415, Series 2020, to Special Order Number 0225, Series of 2021. Its goal is to continue the program's endeavors and to ensure the Balik scientists' safety by providing alternative means of engagement and incentives for the awardees. The amended guideline provides more conducive work arrangements for short-term and medium-term Balik scientists. The short-term engagement of 15 days to 6 months now offers arrangement of either pure remote or a combination of remote and on-site for Balik scientists. Such arrangement is anchored on the proposed TOR or Terms of Reference of the Balik scientist. The Balik scientist with proposed COVID or non-COVID related activities can now afford to be engaged remotely. For this arrangement, new applicants and Balik scientists with ongoing engagements can apply. On the other hand, the medium-term engagement shall be conducted purely on-site. Only new applicants can apply in this work arrangement. The special order also provides provisions and incentives for the on-site and remote engagement. For the on-site engagement, the following will be given. Number 1, provision of one round-trip airfare originating from a foreign country to the Philippines. Number 2, exemption from payment of Philippine tax travel for the balik scientist. 3, reimbursement of expenses for excess baggage. 4, tax-exempt daily subsistence allowance or DSA of $200 or based on the prevailing UNDP rate, whichever is higher. 5, accident, travel, and health or medical insurances, including dental, COVID-19, and other emergent infections, are covered. 6, provided that COVID-19 testing is not included in the health or medical insurances, the program shall cover the cost of testing as necessary. As per the remote engagement, a monthly incentive to at least salary grade 27 with the formula displayed on the screen will be provided. This supplemental guideline shall remain in force as long as there are travel restrictions and implementation of 14 days quarantine in the Philippines, and shall become ineffective upon written order by the DOST Secretary.
Have you been wondering how you and your institution can get started in doing research? Or have you been thinking of ways to level up your current research capabilities? Well, no need to keep wondering and thinking, because the Research and Development Leadership or RD Lead program is already here. The RD Lead is a program aimed at strengthening human research capital. It is one of the components of the Science for Change program of the Department of Science and Technology and is being implemented by the National Research Council of the Philippines. The RD Lead program engages experts, called RD leaders, to capacitate personnel of state universities and colleges, higher education institutions, national government agencies, and research and development institutes. Specifically, the RD Lead program aims to strengthen the research capabilities of Filipino researchers, scientists, and engineers, complement the establishment of niche centers in the regions and other existing R&D centers, and steer the research direction of SUCs, HEIs, RDIs, and NGAs to become globally competitive. The program engages RD leaders who will assist institutions and lead in establishing and upgrading of R&D centers, train and capacitate local researchers, faculty, students, laboratory heads, and staff, provide policy recommendations, and develop and update manuals, protocols, programs, and modules. If you have been looking to get started in doing research but don't know how, then the RD Lead program is here for you. If you need an RD leader for your institution, send us your request to the following. For other inquiries, you may contact What are you waiting for? Send in your request now.
Tracing its roots back in 1901 from the then Bureau of Government Laboratories, which became the Bureau of Science, the Department of Science and Technology, Industrial Technology Development Institute, or DOST-ITDI, turned 119 years old on July 1, 2020. From basic researches to mapping of the country's flora and fauna and other local resources for scientific studies, DOST-ITDI has been a vital instrument in establishing the research and development agenda in the country. It was 1958 when the Bureau of Science became the National Institute of Science and Technology, NIST, that industrial R&D started gaining ground while harnessing local resources and skills towards self-sufficiency and optimized productivity. Industrial R&D went full gear in 1987 when the NIST was renamed Industrial Technology Development Institute, focusing on 4 major functions: research and development, technical services, technology transfer, and custodian of the national units of measure to provide international traceability. DOST ITDI Research and Development covers 5 major areas: food, environment and biotechnology, chemicals and energy, material science, and packaging technology. All aimed at supporting and answering the needs of local industries. Complementing its R&D are its technical services, standards and testing, national metrology, and technology transfer, aimed at harnessing local industries' productivity and competitiveness, and translation of developed knowledge or innovation into the production sector, paving the way for new businesses or startups. As well, DOST ITDI innovations serve as springboards for businesses to thrive and prosper. In support of the administration's thrust in addressing the COVID-19 pandemic, DOST interventions are anchored on the theme, Agham at Teknolohiya, Sandigan ng Kalusugan, Kabuhayan, Kaayusan, at Kinabukasan. At the height of the COVID-19 pandemic, and when most of the country was in enhanced community quarantine, DOST ITDI bravely rose to the call of duty, distributed ready-to-eat foods such as the Pack of Hope and Mungbean Cocoa Milk Drink to our frontliners in Metro Manila and other regions in the country, produced face shields via 3D printing and donated these to hospital frontliners, developing prototypes and 3D printing critically important parts of hospital equipment, and improved design of N95 masks to better protect the frontliners. The Institute is also providing interventions for our displaced countrymen who lost their jobs and livelihood by making training available online whenever necessary. And even before this pandemic, DOST ITDI innovations were critical in rehabilitating communities that experience calamities and even war and make them whole again. DOST ITDI has been preparing for an innovative ecosystem for new knowledge and technology to thrive and help make us ready for Industry 4.0. DOST ITDI aims to achieve kaayusan and ascertain the future or kinabukasan through its initiatives and help businesses in every Filipino adapt to COVID-19 under the new normal. State-of-the-art facilities are being established. Construction of the Simulation Packaging Testing Laboratory, SPTL, and Green Packaging Laboratory, GPL, is ongoing. At the SPTL, stress conditions that affect products during transport are simulated that can help mitigate losses during distribution, while produced products can be processed and packed in a green packaging laboratory. AMSEN, or the Advanced Manufacturing Center, DOST's 3D Printing Technology Center, is a joint project with Metals Industry Research and Development Center, MIRDC. ITDI focuses on developing multiple 3D printing materials from local materials to reduce cost. Halal Food Research and Development Facility. With this facility in place, the Institute hopes to develop new food products that are compliant to halal standards and as well support DOST as it responds to Republic Act No. 10817, or the Philippine Halal Export Development and Promotion Act. Enhancement of the competence and capabilities of the National Metrology Laboratory of the Philippines. Expertise and facilities are being upgraded, and construction of laboratory facilities for metrology and chemistry and biology are now ongoing. It is envisioned that the NML will provide the country with credible measurements and traceability in the fields of physical, chemical, and biological metrology. And with the emergence of the COVID-19 pandemic, DOST response has been decisive. With the support of President Duterte and the Interagency Task Force for the Management of Emerging Infectious Diseases, the DOST will establish the Virology Science and Technology Institute of the Philippines, or VIP, to be constructed at the new Clark Economic Zone in Capas, Tarlac. The VIP shall be pursuing priority virology research and developing diagnostic kits, therapeutics, and vaccines for diseases caused by viruses, where DOST ITDI will have a critical function.
From laying the groundworks for science and technology in the country, the Industrial Technology Development Institute of the Department of Science and Technology, through the years, which turned 119 last July, has been consistently providing innovations to industry to help make them competitive, emerging as a credible industry partner. The Institute has been instrumental as well in mitigating hazards and improving the lives of disaster victims and communities to rise again. With so much optimism with this cooperation and bridging of talents and expertise, we look forward to enhance science, technology, innovation, competitiveness, and the emergence of new research and development capabilities that hopefully will translate into new products and services that meet the current and future needs of our nation and the people.
We are the sole government agency mandated to assist the local metals, engineering, and allied industries.
May our partnership continue to reach more meaningful success stories in the future.
We share with our partners and stakeholders our facilities and expertise in engineering design and prototype development. We engage in research and development, and we are open to do R&D with collaborators.
In our pursuit of excellence in research and development, we further enhance know-how, which leads us toward continual improvement and coping up with changing technological landscapes.
We provide analytical and testing services aligned with local and international standards to ensure the quality of metal products.
We actively promote the R&D outputs and engage in technology transfer. We partner with our MSMEs and offer technical consultancy and training to boost the industry's competitiveness.
We also embark on non-research and development projects where we are able to widen our network and nourish relationship with our partners and stakeholders.
While we engage in R&D and technology transfer, we enrich the industry's science, technology, and innovation culture.
We ensure that our facilities and all the products of our R&D activities are appropriate to address the requirements of the industries.
We do all this in the pursuit of our vision of a more productive and competitive metals, engineering, and allied industries. We are the Department of Science and Technology, Metals Industry Research and Development Center.
We at the PTRI have always been conscious of the role we play in support of the textile industry. Our mission is to make food
Magandang hapon sa inyong lahat. Welcome back to the afternoon session of our first day of the 6th National R&D Conference. Have you had a good lunch? Nakakain ba kayo ng maayos? We hope that you were able to do a very quick stretching as we have been sticking on our screens because of our very interesting and engaging topics earlier this morning. And surely this afternoon awaits more exciting topics. But before we start, let me just give a quick shout out, okay? Or acknowledge some of our participants still joining us up until this afternoon session. Maraming salamat po. Hindi nyo kami kinaligtaan after you had your lunch. Good afternoon to University of Mindanao, Davao City, VEP Northern Samar. Okay, madaming mga estudyante Huban National High School, OLP Pagadian City. We also have from the Philippine Coconut Authority in Albay. PSA also joining us, Mapua University, CIT University, I-Academy in Makati City. Also from the Pitan City, magandang hapon po sa inyong lahat, CPU Iloilo City, UP Manila, syempre nandyan din ang TUP Manila, Our Lady of Lourdes College Foundation. Also from Southern Isabela Medical Center, meron din Tagataytay Senior High School of DepEd Rizal. Pwede ba kayong mag thumbs up react dyan o kaya mag heart react dyan? Okay, let's do a very quick finger exercise para magising tayo because this is a holy hour. We don't want you to be sleeping in front of your screens. Intellectual Property Office of the Philippines, also Gordon College, Aklan State University. We have also joining us from the Commission on Audit, magandang hapon po sa inyong lahat, and the Central Philippine University. Maraming salamat po. Earlier, we are joined with 1,000 attendees and I know yung iba pabalik pa lang sila. So, thank you again for joining us. Can you just type in very quickly, I am back and I am ready. Again, can you type in there, I am back and I am ready. Earlier in our morning session, we have learned about the R&D initiatives on kalusugan. Very interesting topics, diba? Pagkain and other health, public health sector initiatives. And so this afternoon, we will put the spotlight on R&D initiatives on kabuhayan. Now, to continue with today's event and to formally open this afternoon session, let us hear the message of support of the Department of Trade and Industry Secretary and his insights on the government's efforts in helping our industries to recover amidst the pandemic. Ladies and gentlemen, please welcome Secretary Ramon Lopez.
Secretary Boy de la Peña, Secretary Roy Simatu, fellow workers in government, distinguished guests and speakers, ladies and gentlemen, magandang hapon po sa inyong lahat. It is a pleasure to be here virtually at the 6th National Research and Development Conference, organized by our partners in the Department of Science and Technology, and this year, as you feature programs, projects, and technologies that contribute to the 4 Ks, namely kalusugan, kabuhayan, kaayusan, at kinabukasan. Allow me to thank Secretary Fortunato de la Peña for giving us the privilege of discussing the government's ongoing efforts to sustain the livelihood of our countrymen and ensure the recovery of our industries amid the challenges of the pandemic. Through the concerted efforts of the government and the private sector, we have made significant improvements in the recovery of our economy and can now look into how we can further rise above the challenges of the pandemic. For our part, the Department of Trade and Industry has been implementing policies and initiatives since last year that would help our nation get back on its feet. We have continuously proposed reopening of the economic sectors, even at high quarantine levels, so that we can bring back more jobs, livelihood, and income opportunities. Even at high alert levels, we have pushed for the 100% operating capacity for major sectors like electronics and the IT BPM, and have encouraged alternative working arrangements or alternative work arrangements such as work from home setup which may be a continuing part of the new normal. These policies and initiatives aim to not only sustain our economic recovery, but also empower the private sector to adjust and recover so that they can seize opportunities from the changing domestic and global demands. To sustain this momentum, DTI's recovery efforts are hinged on two strategies. First is Recharge PH, the National Recovery Program for a balanced and whole-of-society approach to restart and revitalize the economy amid the COVID-19 pandemic. As the lead of the task group to oversee economic recovery, DTI has also been implementing Rebuild PH strategy, or revitalizing businesses, investments, livelihoods, and domestic demand, to alleviate the economic impact of the pandemic while ensuring that businesses do not merely survive, but remain to be competitive in the global market. Our broad strategies under Rebuild include revitalizing the demand of households and businesses, boosted by government spending, and empowering local industries to capture that demand. Anchored on this whole-of-society approach, this in turn will create a virtuous cycle of sustained and growing economic activity with strong domestic linkages. To ensure that local industries keep operating as well as improve their competitiveness, the DTI, as part of the economic team, continues to pursue the implementation of key economic policies and reforms. We now have the Corporate Recovery and Tax Incentives for Enterprises, or CREATE Act, that basically lowered the corporate income tax rates from 30% to 25% and further down to 20% for SMEs. This makes our tax rates competitive in the Asian region. The CREATE Act has also enhanced the investment incentives, giving longer period of incentives like tax holidays for high technology and R&D oriented activities. For example, we provide incentives to priority industries for the improvement of physical as well as digital infrastructures, technology-based agriculture, manufacturing, and energy projects, and encourage innovation and commercialization of new technologies and locally generated intellectual properties. We likewise advocated for a stronger local preference mechanism in the government procurement through the inclusion of a provision in Bayanihan 2 and for the passage of the Pandemic Protection Act so we can support our domestic industries and suppliers. With the government buying Filipino-made goods, we are able to create more jobs in the country and invest in the collective advancement of our kababayans. DTI continues also its efforts to strengthen the country's linkages at the multilateral, regional, and bilateral levels. Through free trade agreements, we are able to expand the market of our industries as well as their supply or value chain base. Just last month, we announced the substantive conclusion of negotiations of Philippines-Korea FTA. We are also working on securing the concurrence of the Senate for the Regional Comprehensive Economic Partnership, or RCEP, agreement. And that's composed of the 10 ASEAN countries plus 5 FTA partners of ASEAN. You know, being part of an FTA not only improves market access, but it is a big attraction as well for foreign investors to locate in our country and have access to the markets of those participating in the FTA. Our initiative, together with DOST and DOH, to build the capability of the local industry to produce vaccines to address current and future health emergencies and pandemics, is currently being worked out. In fact, if conditions permit, vaccine manufacturing operations, even including pharmaceuticals, may start as early as the second or third quarter of 2022. With the rollout of the government's vaccination program, this will provide more mobility, confidence, and relief to our businesses and consumers alike. Complemented by the shift of more provinces and cities to the alert level system, this further intensifies our move towards a more unified, calibrated, and safe reopening of the economy thus bringing back more consumption and economic activities. With higher vaccinated rate and new pharmaceutical treatments, we can expect a more sustained pace towards economic recovery. While the Philippines is already displaying signs of recovery, there is still much to be done. Until we are able to temper COVID-19 from a pandemic into an epidemic and go full blast on our economic recovery efforts, we continue to take a proactive approach to manage the risk, not just avoid them. That is why even as we sustain our momentum, President Rodrigo Roa Duterte has already directed us to boost our all-out support for the business sector to help in its rehabilitation so that you can become stronger and more resilient in the post-pandemic future. We remain confident that through a whole-of-society approach, we will soon be able to build back a better Philippines where all our people can achieve a more comfortable and greater quality of life. In line with the theme of this year's conference, Pananaliksik at Pagpapaunlad, Daan, Tungo sa Pagbangon, allow me again to recognize our host agency, DOST, thank you Sec Boy, as well as our partner agencies, DNR, Sec Simatu, and CHED, DA, DICT, DOH, DND, DOTR, and DPWH, for the opportunity to coordinate and collaborate and push forward initiatives for research and development and innovation. Maraming salamat po at mabuhay tayong lahat.
Maraming salamat din po, Secretary Ramon Lopez. Thank you for your message of support from the DTI in science, technology, and innovation. And we are looking forward for the recovery of our economy. Now we continue to witness how science and research, R&D, help our local industry recover from this adversity. Go and grab some cup of coffee or tea as you watch these videos.
Marginalized seaweed farmers were beset with problems on low productivity due to unfavorable farm conditions and diseases. Based on past study, seaweed farmers are also disadvantaged in terms of low price and unscrupulous trade practices. On the other end, fruits, vegetable, and rice farmers have suffered dwindling harvest due to excessive synthetic inputs. Their soil has been severely depleted, that the harvest of their crops have been in steady decline. Synthetic chemical fumes and residues also take their toll on the health of both farmers and the consumers. As a solution to these problems, we at Davao del Sur State College have developed KD foliar fertilizer. Drippings from Capophycus alvariaceae seaweed, the species used in making coragenan, are gathered using specifically designed drying equipment. These drippings, long considered as waste material, were then bottled, sealed, and stored, ready for distribution to end users. The liquid works as a natural foliar fertilizer for various crops, as it contains nutrients and growth hormones that can safely enhance growth and yield. Economic benefit for rice production using KD yields an additional benefit of 3,730 pesos per hectare, providing added income to farmers. A study further shows a reduction in production inputs in terms of fertilizer and the frequency of spraying insecticides, translated to labor and input cost savings. An analysis of the 3 seaweed products showed that the processed KD foliar fertilizer gained the highest net income. Seaweed farmers supply KD fertilizer, providing a steady source of livelihood. The college is assisting them in the marketing and distribution of the product to various farmers and farmers associations in Davao del Sur, such as the Magsaysay Organic Farmers Marketing or Mofarmco, producers of the known organic rice called mag rice. Supplying KD fertilizer to other farmers within and outside their community, the Farmers Association in Sitio Biao, Barangay Cogon, Digo City in Davao del Sur gains a net income of 25 pesos for every liter of KD and 150 pesos for every 20-liter container gallon. Let us listen to the testimonies of seaweed farmers and the end users on how KD foliar fertilizer helped them.
Lisod kaya ang pagpahalin sa mong gusto sa una. Brato kayo, manamundang may ugtano mo gusto nga kanang tambalang sa kanang among asosasyon. Nakapahimo na ko tarong-tarong nga balay. Ako'y motor, na ako'y internetan. Karon nagpahimo na po ko bagong sakayan nga amog yung panginabuhian. Nakapa-eskwela na ko sa kong mga anak nga duha ka buok sa college. Salamat kayo sa DSSC. Ilagi may gitabangan.
We are looking for an organic foliar, and it so happened the KD is available and it's not expensive. So when we spray KD in our farms, okay yung production niya, at the same time, less yung cost niya. It's effective, it's mura, and hindi ka magsisisi talaga.
Dako gyud og kalahian ikumpara nimo sa uban nga among ginagamit sa una nga mga foliar. Gawas nga nindot sa iyang pamunga, dugay pud siya malugnas. Napa jud nakita namo nga bugat ang iyahang timbang. Sa bunga niya, green jud siya. Maski sa uban nga mga variety nga gulay namo, sa batong namo, sa kanipod upo, baliya maong yun na nakita namo nga dako ang diferensya, kalainan.
It is an honor for the SSC to provide solutions to farmers on the opposite sides of the value chain, with the seaweed farmers as producers of KD fertilizer and farmers of various crops as end users of the product. With KD, their lives have improved. Sa KD fertilizer, kita ay dadami.
In the ASEAN region, most of the agricultural produce of the Philippines are exported to Malaysia, Thailand, and Singapore. However, the Philippines ranks lower in terms of total agricultural exports compared to other countries within the region. Despite the subsidies given to our farmers, our country still imports basic commodities like rice and sugar, and even agricultural inputs like fertilizers, plant growth regulators, and promoters from our neighboring countries. I'm Leah Fernando. With the high cost of agricultural inputs, how can we help our farmers increase their yields and income? And more importantly, how do we do this in a sustainable manner without the use of toxic chemicals? To address this concern, our team developed HormoGrow and BioGrow. HormoGrow helps in root and stem development, and it also induces flowering. HormoGrow is environment-friendly, and it comes in an efficient delivery system that increases uptake to 30%, resulting in an increased crop yield. We tested HormoGrow in several high-value crops and vegetables, and the results are very promising. Coffee stem cuttings that were treated with HormoGrow had a significantly higher survival rate compared to ones treated with commercially available synthetic growth promoters. We also observed a significantly higher survival rate of tissue-cultured banana with Hormogrow. Hormogrow also induces flowering in cacao and enhances tillering in rice crops. Our team is targeting a 20% market share for Hormogrow in the high-value crops market. BioGrow contains naturally occurring plant growth-promoting bacteria from soil. These bacteria facilitate nutrient uptake, help fight pests, and produce plant growth regulators. Significant increase in yield was obtained using BioGrow in ampalaya, while a 5-fold increase in marketable heads was obtained in lettuce. We observed early seedling growth in tomatoes, induced rooting in ornamentals, flowering in orchids, rooting in wisteria through marcoting, and shoot emergence in cassava cuttings. When we used BioGrow on sugarcane, we saw higher cane and sugar yields while also saving 15 bags ammonium sulfate or 6.6 bags urea in the process. BioGrow also increases income in growing corn, pechay, and mustard. We are so confident in Hormogrow and BioGrow that we've established a company to bring these products to the market. Soon, Hormogrow and BioGrow will help farmers and beneficiaries across the Philippines boost yields and increase profits. Sa BioGrow at Hormogrow, mas kikita ka!
Site-specific nutrient management, or SSNM, is a technology that gives farmer fertilizer management strategy which is specific to their location. The goal of SSNM is to provide the crop nutrient requirements based on the growing environment and to increase the yield and profit of farmers while preserving the soil quality.
How is SSNM done? To meet crop nutrient requirements, SSNM considers the existing nutrients in the field, including crop residues and manures, and the proper timing and application of fertilizers. SSNM is done by conducting nutrient omission trials or NOTs in the farmers' fields to determine the attainable yield and yield response to nitrogen, phosphorus, and potassium of the different maize varieties. However, this method is expensive and cannot be done in every field. That's why we develop a software that will ease the formulation of SSNM fertilizer recommendations. This is called the Nutrient Expert Software.
Nutrient Expert for Maize is a software or tool for quickly formulating fertilizer guidelines for maize. It covers hybrid, open pollinated, and traditional varieties of maize in the Philippines. And the software was developed using large agronomic datasets, including those collected from on-farm field trials that were conducted in many locations across the country for many years. The Nutrient Expert recommendation follows the 4R nutrient stewardship concept, which is applying the right source of nutrients at the right rate, at the right time, and in the right place. With the use of the software and a simple interview with a farmer, an extension worker can easily make a fertilizer recommendation that is tailored to a farmer's field conditions as well as the fertilizer materials that are available in the locality. The software presents an economic analysis comparing the costs and benefits of the recommended practice and the farmer's practice. It also provides information that can help farmers to decide on the level of their fertilizer investment by choosing a yield target that suits their budget or desired income and profit. The Nutrient Expert for Maize is available for free download and can be used with desktop computers and Android phones or tablets. It does not require internet connection, and so an extension worker can make a recommendation anywhere or anytime, or even right at the farmer's field if needed.
Natutunan po namin yung wastong pagkahalaman, yung tamang pagtatanim, tamang paglalagay ng abono, kung gaano kadami, kung kailan. Kaya po yung aming ani ay tumaas po ng malaking porsyento, kaya kami po ay medyo umalwa ng buhay. Noon nga po una, ang taniman po namin nung sila dumating ay 2.8 hektar lang. Pero sa kasalukuyan, siya po ngayon ay mahigit ng 7 hektarya. Nung hindi pa po kami natitrain ng SSNM, kami po ay pumipera lang ng pinakamalaki po ay 36,000. Pero sa ngayon po, pumipera po kami ditong huli ng nasa more or less po ay mga 415,000. Patuloy nga po umunad yung aming taniman at yung nga po aking mga anak ay may pamilya na. Talaga po doon lang kami nabubuhay. Wala na po kaming ibang kabuhayang pinagkukunan, hindi pagmamais. Kaya isa po ng pinagpapasalamat ko sa paglunusad ng SSNM sa lugar namin. Ito po ay binababa ko dito sa mga kasamahan kong iba. Kaya yung pong iba naman na medyo mahilig sumunod, para pong nai-apply din nila sa kanila na sila nga po tumataas din yung ani. Yung nga pong isa kong member, mas madami na pong maisang kaysa sa akin, 25 hektar na. Yung pong isa ay 32 na. Dahil sila po naman ay medyo makapiral kaysa sa akin, ay yun po din ang ginagamit nila. Yun pong natutunan ko.
Are you a plantito or plantita? If yes, I bet you have experienced the wonders of gardening and its numerous benefits. Today, let me share a technology where you can take care of plants, arrange them aesthetically, and grow your own food from them. I am Dr. Fernando C. Sanchez Jr., project leader of the Edible Landscaping team of the University of the Philippines, Los Baños. And I would like to share with all of you a story of our team in advocating a homestead and community-based food production amidst the COVID-19 pandemic. The COVID-19 pandemic brought challenges in our society which are constantly faced by our fellow kababayans until now. One of the major pressing issues that we are facing is food insufficiency and the rising food prices. As a matter of fact, according to the 2019 Expanded National Nutrition Survey of the Department of Science and Technology Food and Nutrition Research Institute, approximately 2 out of 3 Filipino households experience food insecurity or limited access to food at the individual and household level due to lack of money and other resources. DOST FNRI also reported a decrease of vegetable intake of Filipino adults regardless of sex and household income. According to the World Health Organization, adults need to consume 400 grams of vegetables to reduce the risk of non-communicable diseases and help ensure an adequate daily intake of dietary fiber. To address these problems, the Department of Agriculture launched the Plant program last March 2020. This program has 12 key projects, and one of which is the Revitalize Urban Agriculture and Gulayan project that focuses on homestead crop production in urban and peri-urban communities through the help of urban agriculture technologies such as edible landscaping. Edible landscaping is an innovative food production technology that merges the science of crop production, especially organic agriculture, and the art of landscape planning and garden design. With edible landscaping, we can establish aesthetics and functional spaces, promote health and wellness across generations, and more importantly, create sources of safe, sufficient, and nutritious food in households and communities. In response to DA's Plant program, the EL team initiated projects that were focused on the promotion of homestead and community-based food production through the principles and practices of edible landscaping. The EL team has been disseminating free EL starter kits that include seeds, sample design, planting and information materials with the help of the DA Bureau of Agricultural Research. Since the start of the community quarantine last year, we have been conducting online trainings and webinars on EL for garden owners and enthusiasts. We have been invited by different government agencies and organizations with similar goals of promoting food self-sufficiency at the household level. We have reached out to urban and peri-urban communities and local government units for partnership and establishing technology demonstration gardens that will serve as learning sites and sources of food for the stakeholders.
Lahat, ang edible landscaping ay nagbigay ng pag-asa sa amin ng aming City Agriculture Office ay magkaroon ng isang programa kung saan ang aming crop management ay based on edible products. Ito ay magiging kaakibat namin para makapagbigay kami ng mga gulay na magagamit ng aming City Nutrition Office at ng aming mga barangay.
With the projects and initiatives that our team has conducted throughout the years, we still need everyone's hand, from private organizations, government agencies, to every Filipino household, to promote food security and healthy diets to achieve our vision. No Filipino should be hungry, for the future of the next generation of Filipinos. Kaya tara na at mag-edible landscaping!
Edible landscaping, tara na't gawin.
Makakalikasang araw sa inyong lahat. Sa mga plantitas at plantitos out there, this is an opportunity that will gladden your heart. Sa usapang kawayan, may pera na, may tulong pa sa kalikasan. What are bamboos? Bamboos are grasses with hollow stems. They are not trees. There are 1,250 species of bamboo worldwide, and there are 62 recorded species of bamboo in the Philippines, but this might have gone higher. Bamboos can be classified by size. We have the giants, such as the giant bamboo and machiko. We also have medium-sized bamboos, such as buho and kawayan tinik. Bamboos can also be classified by use. We have timber or construction bamboos, edible bamboos, rehabilitative bamboos, and ornamental bamboos. In the world of bamboos today, the demand is rising not for timber bamboos, but for ornamental bamboos, and their prices are soaring. During the pandemic, more and more people are visiting the Philippine Bamboo Setum to ask about ornamental bamboos. Many of these ornamental bamboos have been traditionally used for soil stabilization and degraded area rehabilitation. Researchers are now looking at the possibilities of ornamental bamboos for climate change impact mitigation. Ornamental bamboos can be grown in small parcels of land, even in your backyard. Rising prices would give watershed stakeholders opportunities to earn while rehabilitating idle backyards or degraded watershed areas. The question then is, which among these ornamental bamboos can give the best performance in watershed rehabilitation and in providing additional income to watershed stakeholders? We planted various species of ornamental bamboos in 1 hectare of open canopy degraded watershed to see which species has the best growth performance. We also tested the marketability of the various bamboo species. And you know, after 2 years, the best growth performance in the rehabilitation of open canopy degraded watershed area in Mankayan, Benguet is shown by yellow bamboo or Kawayan Dilaw, while the best reproductive performance in open canopy degraded watershed area is shown by Roscoe's leaf bamboos. Dito kayo kikita. Species that did not grow well in open canopy lands were transferred to idle household backyards. Among these, the purple bamboo showed the best reproductive performance. Let us hear from two members of Saling Incorporated, our partner stakeholder.
Ang pinakamaganda na kawayan ay purple bamboo. Ito ay madaling mapatubo, madaling mabinta. Ito maganda ang kulay.
Yung purple bamboo po ang una naming nabenta sa halagang 400 pesos na i-deliver po namin yon through online po, na post sa Facebook. Pero pag yung pick up price, kukunin nyo dito sa aming nursery, dito sa Kabitin, Mankayan, Benguet, 100 po yung isang pot ng purple bamboo.
May pera sa kawayan.
After projecting bamboo sales in the next 5 years based on orders received, the earners among the ornamental bamboos are fishpole bamboo, hedge bamboo, purple bamboo, and blowpipe bamboo. See, there is a lot of demand for ornamental bamboos, and many of these are for soil stabilization and ornamentals for ecotourism parks. Are you a nature lover? Mahal mo ba ang kalikasan? Ikaw ba ay plantita or plantito? There is money in bamboo. What are we waiting for? Let us help Mother Nature. Let us help our watershed. Let us grow ornamental bamboo.
Hello everyone, I'm Janine Cortiguera Baguhin from the Ecosystems Research and Development Bureau of the Department of Environment and Natural Resources. I have a few questions for you. Do you know how to clone plants or make an exact copy of them? Have you heard of the terms plant tissue culture or micropropagation? And how does this method help in conserving our important plant species? Then this video is probably for you.
According to the World Health Organization, 80% people worldwide are more dependent on culturally familiar, simple, and financially affordable herbal medicinal products as a primary source of health care. 40% of the millennials also prefer natural and organic health and beauty products, thereby contributing to the market growth. Do you know what Gugo is? Gugo is a medicinal plant found in warm tropical Asian countries. The species is usually found at low and medium altitudes of the Philippine forest. It is a large woody branch evergreen climbing vine. Gugo is known for a number of traditional and medicinal applications. The species is also used extensively as a shampoo. It is also used as raw materials for handicrafts and novelty items. However, Gugo is only propagated by seeds, which may take 1 year or more to naturally germinate. The species was never cultivated, and due to the destruction of its tropical evergreen habitat and unscientific overexploitation of its plant parts, the population of Gugo has become under severe threat. To augment the demand for Gugo planting materials, an alternative propagation method needs to be developed. And this is plant tissue culture. Plant tissue culture or micropropagation is widely used and becoming more popular for the large-scale production of endangered, threatened, rare, and economically important plant species. This method is the growing of cells, tissues, or organs from juvenile and mature plants on defined artificial medium in the absence of microorganisms and under controlled conditions. It is generally used for crop improvement, long-term germplasm conservation, production of secondary metabolites, gene transformation, and genetic engineering. The Ecosystems Research and Development Bureau of the Department of Environment and Natural Resources conducted tissue culture study on Tungo, wherein the researchers were able to determine the best type of explant that is responsive to plant tissue culture, as well as the type, concentration, and combination of plant growth hormones which regenerated the explants. Germination period was also reduced from more than a year to only 10 days. Although shoots and roots were not fully developed in this experiment, it demonstrated the potential of Tungo explants to form new tissues and develop shoot buds in vitro, thus the need for further study. Once the protocol has been fully developed, we could have sustainable source of Tungo planting materials, more Tungo products, more and better jobs for the Filipinos.
In this regard, ERDB will continue its efforts to develop this technology and will continue conserving valuable forest species through plant tissue culture. This has been Janine Cortiguera Baguhin. Let's multiply Tungo. Let's use natural and organic Tungo. Let's go, Tungo!
Those are all promising technologies under agriculture and agri-processing sector, aren't they? We have learned about the seaweed KD fertilizer. Mas madami daw kikitain. BioGrow, HormoGrow, dadami ang kita. SSNN for our corns. We have heard about the edible landscaping, plant kita, ornamental bamboo, and Tungo. Certainly, our participants have found these projects very interesting, and we are happy to actually have heard from the beneficiaries, their testimonies on how these projects and how these technologies, products were very useful for them. And we are looking forward that these would benefit more people, including us. Now, if you have any questions, our dear speakers would be very pleased to answer them. But before that, may I call on our dear speakers to please turn on their cameras for this first session of our Q&A this afternoon. Dr. Fuentes, Dr. Fernando, Dr. Descalzota, Dr. Sanchez. We also have Dr. Odsi, and Ms. Baguhin. Okay. And please be reminded to stay on mute unless the question is referred to you. We have now questions coming from our Zoom participants, also from our Facebook Live, as well as from our YouTube. And these questions will be referred to our appropriate speaker. And as we have highlighted R&D outputs on industry, it is rightful to just introduce to you our moderator, who is the leader of the Philippine Council for Industry, Energy, and Emerging Technology Research and Development, or DOST for short. Ladies and gentlemen, a warm round of applause for Dr. Enrico C. Paringit. Magandang hapon po, Doc Eric.
Thank you very much, Diane, and good afternoon to everyone, to all our viewers in our National Research and Development Conference. Of course, I'd like to send special greetings to our panel of researchers this afternoon who will be entertaining. I'm sure there are burning questions right now because of the the vast interest in all of the things that had been presented today. But before we begin, I'd just like to start off with some appetizing questions first to our set of panel speakers, beginning with the developer of our seaweed drippings from Davao del Sur State College. You would actually consider Davao del Sur State College to be quite an obscure institution, but because of their product, they've actually transformed the way how the lives of our seaweed farmers are in that part of the region. So we'd like to thank you for that. Actually, there's a very interesting, this wave now of coming to finding ways to address the, of course, the hardships, the challenges brought about by the pandemic. And I just like to ask Dr. Fuentes, what are your thoughts, maybe with your research product in mind, of how do we get back then to go towards our road to recovery from this ongoing pandemic?
Thank you, Dr. Paringit, for the question. For Davao del Sur State College, we really believe that indeed this technology transfer and utilization initiatives that we've done have aided our partner farmers, the farmers associations and their families, as a source of their kabuhayan and getting back and recovering from this ongoing pandemic. Seaweed as an economic resource actually plays a key role in improving the lives of coastal families, as it is their additional source of income next to fishing. However, even with the available resources, these coastal families dependent to this resource, the seaweed, are still regarded to belong as one of the poorest sectors in the Philippine society. This initiative that we're doing in the college, I would further say that it gave way to providing first to the coastal dwellers to remain steadfast to continue support the seaweed industry as alternative source of income. Second is that we can somehow encourage our farmers or even our consumers' mindset, shifting the mindset of our consumers, the farmers as the users of the product, even from the time before the pandemic started. We really see our farmers who value the products that are cheap, but have the potential to improve growth and development of crops and eventually generate income. Third is that farmers being resilient, as their nature, we see farmers so resilient, allows them to exercise preparedness to handle the new normal in the way they produce their harvest and products and even market these products. And lastly, that in the new normal, although it created huge implications to the agriculture consumers, our industries, our development partners, and even policymakers, this technology transfer and utilization that we did and is that we are continuously doing can support really the resilience and growth of our agricultural producers.
Yeah.
Thank you, Dr.
Yes, thank you, Dr. Ogie. It seems that I see that there are a lot of connections to be made. You have farmers, you have buyers, of course, but you also have has to have some connections with our those that are dealing with different parts of the market. So it's I think going to be instrumental in the success of this technology and the products that you have developed. I'd like to proceed to the question. This time we transition to the ornamental ornamental plants that had been fostered, of course, by Dr. Sanchez's group. it's very interesting because it presents this interesting paradox about, planting something, but then you get to eat what you plant. So you do not only have that that visual delight, but also some kind of also a gastronomical delight, if you will. No? So it's really very interesting. Dr. Sanchez, actually one of favorite questions usually in R&D conferences. How are you able to cope with the challenges brought by the pandemic? I know that maybe some parts of your R&D had been done during the time of the pandemic, and we'd like to learn. I think the researchers that are present here would like to learn how are you able to cope? How are you able to succeed? Actually, how you are able to move things even with a series of lockdowns and quarantines that everybody's experiencing right now. Is there still do we still have a very good, very viable ecosystem to do R&D? Can you share your experiences to all of us, Dr. Sanchez?
Okay, thank you, Director Paringit. Doc Eric, thank you for that question. Nice to see you. Matagal na tayo hindi nakikita. So, regarding your question, during the early onset of the pandemic in 2020, about second and third quarter, the team said we might lose our relevance when the pandemic started. No? But when the plantita phenomena started to gain momentum, we were surprised that our former cooperators and government agencies started to connect with us. They called us to have yung aming advocacy on creating functional, beautiful spaces while producing safe and nutritious food. So, yun lang naman ang tinuturo namin, yung we grow food in an aesthetic manner in the household or community level. So, during that time, sabi ko, meron pa tayong purpose to teach the households and communities to be resilient by growing their own food. So, with the ongoing projects we have right now, so we found our niche in this pandemic, and we have solidified our purpose by creating beautiful and functional spaces while providing nutritious, safe food in the household and community level. So there's hope. Palaging may hope naman. So the purpose of the team is now to teach communities on how to produce their own food, to be resilient in this pandemic and future pandemics for that matter.
Thank you very much. That's truly inspiring, Dr. Sanchez. I hope all our researchers could follow suit. So my next question is addressed to Dr. Lilia about her technologies on BioGrow, HormoGrow. Again, they're at UPLB. Of course, we also wanted to know what's your secret in pursuing this project even in the midst of the pandemic, and how are you able to to motivate your team, and of course how are you also addressing all of these challenges brought about by this again lockdowns, the quarantines, and what have you and what else you have encountered along the way. I'm sure that with all of these challenges and the outputs and the outcomes that you've put out today, this presents much more potential when we start to actually open up our economy. Dr. Lilia?
Okay, thank you, Director Paringit. Actually po, while you're tinatabi yung question, heartfelt talaga yun because it's really frustrating during the pandemic how we were able to work on our projects. But masabi ko po, our team is talagang very patient and persevering. It's actually a teamwork that we were able to still work on our projects and get results implementing research projects during the pandemic is very, very difficult, but with the available resources, kasi nung wala pa pong pandemic, we used to go to other laboratories within the university and use some of the equipment. But now, of course, we have restrictions. So we just work on what's available, and I told my team, you should be resourceful. I know you are innate na sila, yung ingenuity nila kailangang ilabas. So I'm glad that they were able to work on available resources. They were able to improvise on what's available in our institute and work with people na meron po nung kailangan namin mga equipment and facilities. So ang amin pong talaga ang nagda-drive sa amin para mag-work on the projects given the restrictions, yung goal na dapat may result tayo. Kasi I always tell them this is pera ng bayan para sa bayan. So yun yung mako-contribute natin during the lockdown. We work on what's given to us para makapag-contribute po sa ating sa Pilipinas. Ayun po, Dr. Parin.
Thank you, Dr. Lilia. Very catchy, no? Pera ng bayan para sa bayan, no? Itong BioGrow at Hormogrow na to, I'm sure they will find their way to the market, and I think yun nga sa wave talaga yun ng going back to I don't know, to the soil, kahit nga non-soil magagamit na itong mga technologies na ito coming from your research team there at UPLB. I'd like to direct the next question to Miss Minda of who initiated this project on ornamental bamboos, no? Again, this will appeal to our plantitos and plantitas, no? And pretty much I think the motivation there is, you really wanted to also do offer some way to for those who are working at home, stuck there, no, they might find the ways on how to also buy their time, no, while making it productive. But I saw a lot of interesting aspects earlier about the use of bamboos, no. I'm just curious, is this technology also available to those who are wanting to actually propagate bamboo and make it successful even for other potential uses, like I saw earlier in your table there are a lot of uses aside from ornamentals. There's also something for keeping the land intact. There's something that's related to, of course, growing them for purposes of harvesting and making them into functional and using them for some functional uses like bamboo furniture. Do the same principles or the approaches apply to these other fields or these other purposes?
Thank you, Dr. Eric. I'm very, first of all, I'd like to thank you for giving me this opportunity to interact with all of you. And yes po, the technology is already matured for the propagation of different bamboo species, and you can just visit our offices in Laguna. We have our main office, the Ecosystems Research and Development Bureau, and throughout the Philippines, we have our research centers po. We are the research arm of the Department of Environment and Natural Resources, and we have IEC materials para maturuan po yung mga stakeholders natin on how to grow bamboos, paano magtanim ng kawayan. Right now po, we are collaborating with our various stakeholders for more RDEs. Like for example, given that ornamental bamboos are good for rehabilitation of waterways, which among the ornamental bamboos proliferating in the Philippine markets are best for riverside planting and are best for riverbank planting. Ano po ang dapat nating gawin para itong mga bamboo na itatanim natin will not harm the environment? So tuloy-tuloy po yung mga RDEs namin dyan, at meron din po kaming integrated na research kung ano po sa mga ornamental bamboos na ito ang makakabigay ng more income to our stakeholders po. Mula ng pandemic po, ang dami nang pumupunta sa Philippine Bamboo Setum dito sa Baguio at nagtatanong tungkol sa kawayan, paano magtanim ng kawayan, and we are glad to say that we have been of service to our stakeholders.
Yeah, thank you very much, Dr. Lilia. No, really, bamboo is very versatile. So, we want to provide options to people what to plant according to their taste, according to their purpose, according to what their environment also wants to, what they want to address with their environment. Ang next question naman natin kay Dr. Jessie. Siguro moving outwards from the technology itself, I mentioned earlier it's also important to engage collaborators, especially you mentioned the case for really making nutrient management more site specific, because we understand that different areas, different soils, different climate, different environment have different offer different growing conditions. Gaano kaya ka-importante yung makausap natin yung mga tamang collaborators and tamang partners sa pag-foster ng ganitong technology, Dr. Jessie?
Hello, sir. So, good afternoon. So, in regards with our collaborator, it's a necessity na we could have a good engagement with them, so that the information that they will be providing using the technology will be correct and very efficient. So actually what we are doing right now is we are conducting several trainings on the use of the SSNM technology, using SSM technology for corn. So we train them to use how to use the software, and so the technicians and the other farmers cooperatives. So what they do, they make the recommendation, so that they can make the recommendation themselves, and and if things work well, and information that they inputted to the system, and they will be given a very good, a very precise recommendation, and from our experience, it would be much more beneficial for them, so that they would gain a lot using the right amount of fertilizers, as well as they will have a higher profitability if they will be if they will be using the technology. So it's a very important aspect that we keep close contact, particularly to the user of the user of the SSNM technology.
Yeah, thank you, Dr. Jessie. I think we still have some time for a few more questions. Marami dito, mga tawag ko dito, mga top shop questions, mga tinatanong na kung magkano, saan ba makakabili, kukuha ba to sa ating mga online shopping. I'm sure there will be, of course, there will be opportunities to have those na. Pero ngayon, gusto ko lang muna matanong sa ating din mga panel, no? Well, actually parang crazy question. I don't know if any one of you could answer on behalf of the others, or you can take your turns. Have you also tried collaborating with each other? Kasi parang I see sometimes some of your technologies could actually be complementing, no? So like for example, you want to do edible gardening perhaps somewhere in an urban area, tapos siguro lalagyan mo ng hormogrow. Posible ba yun? Have you tested it? Or have you tried, doing some, sa mga millennials kasi natin ngayon, mahilig sila sa word na collab eh. Nagko-collab din ba kayo? Yes, Dr. Sanchez.
Thank you, Dr. Eric. Yes, actually, I encourage the team to collaborate with different scientists doing. Hindi lang ako nakaka-collaborate kay Doc Lilia, baka Dr. Fernando, baka kasi we need kasi yung mga organic, kasi we espouse organic agriculture in the technology. So we try not to use pesticides, chemical pesticides, and chemical fertilizer for that matter. So we adapt yung mga technologies in UPLB to be part of the edible landscaping. Kasi we're teaching how people can do organic agriculture, and organic agriculture can be done. So through edible landscaping, may art lang kami, but it's simply teaching people how to plant their own food, safe and nutritious. Yun ang key. Kaya yung aming tagline nga na no Filipino should be hungry. Dapat ng bawat Pilipino magtanim ng kanilang pagkain para resilient sila sa next pandemic or any crisis for that matter. So yung technologies, ina-adapt namin yan. Siguro lalapitan ko si Dr. Fernando later na makatulong. Actually, we adapted yung sa SNAP hydroponics in urban agriculture technologies and other technologies na present sa UP. So pati yung concoction, botanical concoction developed by NCPC scientists, we're adapting that. So yes, we want to collaborate, especially may common goal and may interlink ang aming mga projects on growing crops for nutrition, for the general nutrition of the Filipino people.
Thank you, Dr. Sanchez. It's nice to hear that. Anyone else would like to add to that? Okay na? Yes, Ma'am Minda?
Sir, in addition po, dito po sa Baguio City, we are collaborating with different agencies po. For example, yung dalawang project namin, ongoing na bamboo R&D po, is being done in the water quality WACMA areas. And doon po sa committee, technical working group ng WACMA, ay kasama po ang iba-ibang agencies po.
Okay.
And we collaborate on what to do, how to do it, and paano kami tulong-tulong para gumanda yung tubig natin sa mga waterways natin like our rivers, our creeks. How do we make our water more clear and more abundant?
Yeah.
Ganun po ang collaboration dito. Thank you po.
Thank you. Yeah, thank you, Dr. Minda. Nice to hear also that you have collaborations with the stakeholders present in the area. Siguro last question natin kay Ma'am Janine, no, marami talaga nakamiss ng Gugo. Nako, there was a time na talagang 'di ba, Gugo shampoo used to be the used to be the novelty. It used to be the shampoo of Filipinos and Filipinas, no. Pero ngayon parang nagkalimutan yata. So, ganun pala 'yung nangyari. Actually, ngayon ko lang din nalaman na ganun pala 'yung nangyari sa ating mga Gugo. And it's very nice to hear that we've been making strides and efforts to actually grow the Gugo back, no. So going back to the Gugu. Actually, isang tanong ko dito is that actually I saw a question from the audience about its availability. Makakabili na ba nitong Gugu seedling na ito or Gugu, hindi na seedling to, no? Ano na to sprout coming from the I don't know how you term it, but it's the one that you use out of the propagation, no, out of the micropropagation. At gaano ba katagal ito? Baka naman kasi maubos na yung buhok ko bago tumubo ng tuluyan at mamunga yung Gugu. Miss Janine?
Yes, sir. Thank you. Yes, tama po kayo. Talagang nawawala na ang Gugu nowadays. Pero may makikita tayo, most of the products, yung mga beauty products, mga soap, mga shampoos, meron pa rin siyang components of Gugu and hindi natin alam kung saan ba siya nagagaling. So, ERDB has the initiative to conduct a study regarding the tissue culture or micropropagation of Gugu. For now, we do not have seedlings for sale since ang kanya pong population ay talagang nagde-degrade na, and most of our Gugu plants are in the protected area. So hindi pa siya, parang wala na masyadong talagang available in the market. So kaya meron tayong ganitong study para po maibalik Gugu and to promote din yung ating technology regarding tissue culture. So marami siya talagang, as per tissue culture, marami po siyang advantages na we could use since it is an important tool for rapid and mass propagation and as well as conservation of plant species, there could be higher production and more market, with more market and more opportunities, or to create more jobs for the Filipinos.
Thank you very much, Miss Janine. Before I wrap up, siguro habang nagra-wrap up ako, you can answer this question by just, sa mga panel natin, you can just click on your raise hand or clap, no, or thumbs up. Nabibili na ba yung inyong mga produkto sa mga online shopping platforms natin? Yan, thumbs up lang kung yes, habang ako'y nagra-wrap up. So makikita ng ating mga audience, no, kasi pag as soon as you say thumbs up, magso-search na yan sa kanilang paborito. Ayan, no? Nakikita nyo na kung available. Yung hindi pa siguro, feel free to, of course, chat with our panelists today para magkaroon tayo ng opportunity to interact. I think that's what this conference is also all about. So to wrap it up, I would like to, of course, thank our panel of presenters in this afternoon session. I think is very interesting, very productive, and very enlightening, no? Lalo na yung mga nakamiss ng gugo, yung mga naghahanap ng natural ways on how to take care of their plants and of their crops, and also, you know, trying to make all things green and bright and beautiful, no? I think that's at the end of the day, we wanted to be more productive, we wanted it to be more sustainable, and we wanted things to also be bright and beautiful. So with that, I hand over back the floor to our host to our MC this afternoon, Miss Daan. Thank you very much. Take it away.
Thank you so much, Doc Eric. Indeed, that's a beautiful, bright, and very fruitful discussion with our speakers. Maraming salamat po to our plantitos, plantitas, mga aspiring dyan na gusto magtanim, those with a green thumb or those who would like to have green thumbs. This could be the answer to your questions. And we are pleased to know, that we have not just grown these products, these technologies, but we have also grown possible collaborations because of our discussion. And we look forward to have these right at the doorsteps, diba, of our partners, of our participants, and those who are interested. Yun nga yung ating mga plantitos and plantitas. Thank you so much again to our moderator, Dr. Eric, and to our dear speakers. There are still some questions in our Zoom Q&A chat box, so may we request our speakers to please attend to these so that we can accommodate and we would not be leaving any questions unanswered. Please also stand by so that you can be included in our last open forum to join the virtual photo opportunity. Again, maraming salamat po. It has been a very fruitful discussion this afternoon. Now we proceed to the final batch of speakers for today. They will present the R&D initiatives in the areas, this time on ecotourism, semiconductor, textile, and livelihood projects. Let us all watch these videos.
The Philippines, the pearl in the Orient, is one of the richest biodiversity areas in the world and is blessed with rich natural resources, lakes and rivers, beaches and corals, springs and waterfalls, and scenic wonders that have been converted into ecotourism sites that aim to preserve the environment, promote local cultures, and provide jobs and income to the people in the local communities. The Philippine Statistics Authority recently reported that tourism's contribution to the gross domestic product or GDP of our country, grew from 12.3% in 2018 to 12.7% in 2019. The report also noted that 14 out of 100 employed Filipinos were in the tourism-related industries. With the unexpected coming of the COVID-19 pandemic in 2020, unprecedented global travel restrictions and stay-at-home orders caused the most severe disruption in the global economy since World War II. How did our ecotourism industries fare with the onslaught of the COVID-19 pandemic? What were the worst things that this industry suffered from? And were there any positive things that resulted from it? I and my research assistant did research on these questions with a case study of 10 ecotourism sites from Luzon to Visayas to Mindanao in the year 2020. We made use of an impact assessment tool and conducted an online focus group discussion and an online focus group interview with tourism operations officers and ecotourism management officials and staff. We found out that the COVID-19 pandemic and the successive lockdowns resulted to tremendous losses in income and loss of livelihood of those working in the ecotourism industries and tourism-related enterprises. For millions of pesos of earnings, they had zero income during the months of GCQ or ECQ until they reopened in the latter part of the year 2020 to local tourists, but with greatly diminished income. On a positive note, the environment and the bioecology were able to rest from human disturbance. The water quality also improved. Furthermore, Filipino resilience was manifested in that those who lost their livelihood in the ecotourism industries learned and developed new livelihood skills such as entrepreneurship, online selling, agriculture, and squeezed out their creative juices like making of creative pots for sale. What lessons can we draw from this crisis and what are some ways to go for our ecotourism industries? First, alternative livelihood programs should be planned and funded by our national government and the DOT. Secondly, LGUs should promote local tourism and travel bubbles between cities, regions, and provinces can be arranged by LGUs. Thirdly, periodic rest of our ecotourism sites should be observed. And lastly, natural immunity boosters and proven cures for COVID-19 should be disseminated by our government to end the lockdowns. Together, we rise up with our innate resilience, unwavering faith in God, and critical thinking that will see through the lies, propaganda, and disinformation in our times. Bangon tayo, Pilipinas!
Semiconductor can be found in everything: cell phones, cameras, computers, even cars and airplanes. They are like brain in electronic devices. Just like the brain has the skull to protect it, semiconductors have integrated circuits, need semiconductor packaging to protect it from heat, moisture, and force. Today, devices using semiconductors are getting smaller, thinner, and wider. There is a need to design better packaging to make them more compact and more reliable. According to Fortune Business Insights, this year, semiconductor global demand will double by 2028, amounting to about $803 billion. Growing global population and urbanization, together with the rising disposable income, will increase the demand for the consumer electronics products. In the Philippines, electronic products continue to be the country's top export, which accounts for about 54% of the total exports revenue in February 2019, and 56% of the total exports in January 2020. More demand for electronic products equals more design plus manufacturing needed in a short span of time. Here is where finite element analysis, or FEA, come in handy. FEA is a computational approach that allows visualization of results, a powerful stress and strain analysis tool, and a mathematical tool for solving boundary value problems, all rolled into one. So how does FEA work? Take a computational item, like a power supply for a car, and break it down into smaller parts. Smaller parts are easier to manage. To illustrate this, think of a box and cut the box into smaller parts. Let us call these parts elements and limit ourselves to finite numbers of elements. It can be 100, 1,000, or even 1,000,000 number of elements. Next, let's create a description for that piece. Oftentimes, it is a linear description of stress and strain or force and displacement. Then take all the pieces and show how it relates to the other pieces using a compatibility and continuity equations, which will result to a large system of equations. Assemble those equations together to form a matrix. Then we solve the unknown with the matrix manipulation. The TALA DLSU team for the Cradle project under the DOST T-shirt Phase 1 and 2 partnered with IMI, which is short for Integrated Microelectronics Incorporated. IMI is one of the leading global providers of the electronics manufacturing and power semiconductor assembly and test services in the world. One of their offices is found here in Laguna Technopark in the Philippines. Engineer Enrique Sonoy Jr., the head of the Global Technology for New Product Introduction, said working with the DLSU TALA team allowed them to look at their packaging designs from a thermomechanical view, therefore enhancing their capabilities. In addition, IMI was able to improve their packaging design further with the help of thermomechanical simulations on several camera modules to be used in autonomous vehicles. Thermomechanical simulation using FEA for a power module of an autonomous vehicle predicted the possible outcomes like failure mechanisms during the manufacturing process and the product's application on the field. The data gathered from the simulation helps support the package's design viability, therefore giving the companies enough confidence to proceed with high-volume production. The Phase 1 and Phase 2 of the project was affected by the COVID-19 lockdown procedures. But creative thinking plus technology allowed the team to work remotely and access the supercomputers housed in the DLSU Laguna campus via the remote access connection. IMI and TALA team maximize online meeting platforms to continue collaborating despite the quarantine restrictions. This shows that technology is going to be part and parcel of the future. FEA analysis is an important computational tool for the design of semiconductor packages. With the use of finite element analysis, the soundness of the packaging design while maintaining the quality and reliability is ensured even before manufacturing begins. This gives the user valuable data to make informed decisions, saving both money and time in making the prototypes. These technologies in the Philippines are quite new, and the potential to be applied in different industries such as construction, product development, and even in the medical field, to name a few, is very exciting. Simulation can increase the potential of Filipino designers and engineers, but moreover, it can give them a competitive advantage in the field of engineering design globally. This opens up industry collaborations and new frontiers in the specialization of careers. You can be part of the computational simulation industry in the Philippines. Imagine, create, simulate.
Before the project was presented to PFC, the PFC was already in talks with the design communities in our 17 regions all over the country as we were inviting them to be part of our coalition. We were able to identify capable industry practitioners to be heads of their region for any project the PFC will champion. An atmosphere of optimism, hope, and promise took center stage when the project was proposed, and as it was being drafted, we saw the opportunity on how many thousands of displaced fashion industry practitioners might be given the chance to not only practice their chosen craft once again, but also impact the allied industries we all work with to produce a single piece of garment. The PFC has been in talk with various government agencies such as the CSC, DTI, DOST, PTRI, and DBM as we find the best ways to future-proof this project that we also envision as a template for the full implementation of RA 9242, the Tropical Fabric Law. The PFC requests to serve as the technical advisor for this project to ensure that our vision is realized as we help and mobilize all design communities on the ground on a national scale, with the assistance of DTI, DOST, and PTRI in helping us standardize sizing, provide for digital and actual patterns, sewing instructions, quality testing. PFC has created a team that will serve as the national office to ensure the success of this project once rolled out. The PFC will oversee and ensure that the design communities on the ground that are tasked to produce the PAUs produce and deliver the products on time with the assurance of quality. As we are also aware of the government's procurement law, uncertain times call for unprecedented measures, and our wish is to allow the various regions the opportunity to benefit from this project by being given the first priority. The trend we see dominant in this pandemic is for sustainability and self-sufficiency. The ease of business, may be it in the form of domestic preference, subsidies, and incentives, should be a priority to ensure the protection and survival of SMEs. 98% of businesses in the Philippines are SMEs. We would like to be your partner as we future-proof the fashion industry. We believe that the PAW project can be an immediate driver to jumpstart our industry once approved and implemented. The protective outerwear is designed by a Filipino, textiles by Filipino-owned mills, and the garments will be produced by Filipino fashion industry practitioners all over the archipelago to protect our hard-working government employees. Handmade in the Philippines. The strength of the Filipino is creating, and the future is creative. Mabuhay po kayo at maraming salamat.
7.3 million. Yan ang bilang ng mga kababayan natin na nawalan ng trabaho noong April 2020. Isang buwan matapos magdeklara ng nationwide lockdown sa ating bansa. Ang sektor ng paggawa na pinagkukunan ng pangkabuhayan ang pinakamatinding tinamaan ng pandemya. Tumigil ang daloy ng buong mundo dahil sa COVID-19. Huminto rin ang paggalaw ng mga tao. Nawalan ng hanap buhay ang karamihan at naparalisa ang ekonomiya. Sa patuloy nating pagharap sa new normal, hamon sa atin ang patuloy na inobasyon upang makaahon sa mga epekto ng pandemya o maging ng iba pang kalamidad na kagaya nito.
Kaalaman, teknolohiya, kabuhayan. Yan ang sagot ng DOST Picard upang maharap natin ang mga dagok ng panahon. Kasamang iba't ibang institusyon sa buong bansa, layon ng Galing Picard program ang tumulong sa 3 larangan. Sa pagpapalawak ng kaalaman at impormasyon, sa pagbibigay ng mga ayuda ng pagkain sa mga komunidad, at sa pagtaguyod ng mga teknolohiya na makakatulong sa kabuhayan.
Sa ilalim ng Component 3, sinusuportahan ang produksyon ng pagkain at pagtatatag ng mga kabuhayan sa mga sumusunod na proyekto.
Ang gulay ay hinding-hindi mawawala sa ating hapagkainan. Bukod sa ito'y puno ng sustansya, ito'y madaling itanim at anihin. Nais na programang gulayan sa pamayanan na dalhin ang mga benepisyo na pagtatanim ng gulay sa ating sariling bakuran. Namahagi ng mga buto at nagbigay ng training ang DOST Picard sa mga pamayanan sa NCR, Zamboanga, Caraga at Benguet. Sa pamamagitan nito ay nabigyan ng karagdagang supply ng pagkain ang mga pamilya, lalo na noong community quarantine. Kagaya ng gulay, ang tilapia ay isa ring tanyag na kalakal, lalo na sa ating mga mangingisda. Ito ay dahil ang mga tilapia ay mabilis lumaki at madaling alagaan. Sa pag-develop ng mga fish ponds at pagsasanay sa tilapia farming at tilanggit processing, nagbigay ang programa na Backyard Tilapia Farming ng karagdagang pangkabuhayan sa mga pamayanan sa Laguna at Batangas. Isang magandang kasanayan sa pangisdaan ang polyculture o ang sabay na pagpapalaki ng 2 magkaibang uri ng isda o lamang dagat tulad ng alimango sa isang lugar. Ang pagpapakilala ng ganitong sistema ay nagbigay pa ng karagdagang ani at food supply sa mga pamayanan sa baybayin ng Iloilo at Capiz. Nagbigay rin ng mas matibay na kulungan upang mas mapabuti ang sistema ng pagpapataba ng mga alimango. Ang kulungan na ito ay mas magaan, mas madaling mapanatili at mas matagal na magagamit kumpara sa mga gawa sa kawayan. Ang seaweed ay isa ring produkto mula sa mga pamayanan sa baybayin sa ating bansa. Patuloy din ang pagtaas sa demand ng mga seaweed dahil ginagamit ito sa iba't ibang produkto, pagkain at gamot. Gamit ang mga kulturang pinalaki sa laboratorio, ay nagtaguyod ng nurseries para sa seaweed sa mga baybayin sa Palawan. Bukod doon, ay tinuruan din ang mga seaweed farmers sa mga paraan kung paano nila mapagkakakitaan ang kanilang mga ani. Ang proyektong ito ay pinalawig pa sa buong rehiyon ng Mimaropa para mas marami pang matulungan ng mga magsasaka.
Maraming produkto at teknolohiya sa sektor ng agrikultura, pangisdaan at likas na yaman sa Pilipinas. At ang mga ito ang nagbibigay ng kabuhayan lalo na sa mga small at medium scale na negosyante. Upang gabayan ang ating mga agri-based na negosyante sa kanilang mga inobasyon at startups, itinatag ang National Agri-Aqua Technology Business Program o ang ATBI sa iba't ibang rehiyon ng bansa.
Ang mga ATBI ay handang umalalay sa mga agribusiness startups mula sa pagpaplano hanggang sa paglunsad nito sa merkado sa pamamagitan ng pagbibigay ng mga resources, trainings at access sa iba't ibang pasilidad. Ang pagsuporta ng ATBI sa mga maliliit na negosyante ay malaking tulong sa paghimok ng pamumuhunan sa sektor at pagbibigay ng trabaho sa mga rehiyon. Sa kasalukuyan ay mayroong 16 na sangay ang ATBI sa buong bansa. Sa tulong ng kaalaman, teknolohiya at dagdag na kabuhayan ay unti-unti nating malalampasan ang mga hamon na dala ng pandemya. Tumigil man ang ating mundo sa mga dagok ng panahon, ang mga programa ng DOST Card ay magsisilbing simula natin at ng 7.3 million nating mga kababayan sa ating muling pagbangon.
Those are the technologies to complete our lineup for today's NRDC. You have witnessed 32 R&D initiatives that contributed to the country's whole-of-nation approach for kalusugan and kabuhayan. Now, before we have our last open forum and before I turn over again to our moderator, Doc Eric, allow me to quickly do a shout out. Okay, dahil alas 3 na po, mag-shout out lang po tayo saglit to all our participants who are still with us up until this 2:30 na pala. Okay, maraming salamat po for staying with us. We would like to acknowledge the presence of Inter-Country Adoption Board. We also have Masis Lacones, Dapitan City, from Sarangani, from Dingen Milagrosa University Foundation, Negros Oriental State University, University of Nueva Cáceres, also from the Hospital of Hamilarin, Pampanga State Agricultural University. Aba, saktong-sakto po yung mga na-discuss po natin. Meron tayong mga agricultural universities. PDRRMO Misamis Occidental, Mindanao State University, ITRMC La Union, and Rizal Memorial Colleges Incorporated. Also, we are joined by our media, Miss Belle Sorara. Magandang hapon po sa iyo. King's College of Maribel Incorporated, City of Coronadal. Northern Iloilo Polytechnic State College, University of Nueva Cáceres. Okay, nabanggit ko na to kanina. Pampanga State Agricultural University. Okay, I think I've mentioned these. Okay, Dole, 7 from Cebu City. And also, last but not the least, Negros Oriental State University, Bayawan, Santa Catalina Campus. Magandang hapon po sa inyong lahat. Thank you for joining us. And definitely, the initiatives, the projects, the technologies that we have just highlighted a while ago definitely have sparked interest to you. So, again, I will be turning over the virtual floor to our speakers, Dr. Espiritu, Dr. Obando, Mr. Aquino, and Dr. Batalon for this last portion of our Q&A. Please do turn on your videos and unmute yourselves when you are asked. Again, we request the presence of our moderator, Dr. Eric. We had a very fruitful Q&A a while ago, and certainly this will also be the same. The floor is yours, Doc Eric.
Thank you very much again, Diane. Yeah, we're on the last segment, the last session for today's NRDC. I think there's one more day ahead of us for the NRDC. So what you've seen today, there's going to be the same intensity, the same magnitude of accomplishments and achievements to be gleaned, no, from the next set. But meanwhile, let's head on to our four distinguished speakers, resource persons for today's session. Of course, we've heard from Dr. Espiritu earlier about her insights on the tourism industry and how we intend to, of course, reverse the trend. We're seeing, of course, much of this already because of the gradual opening already of some of the tourist facilities. But first, since I do not have we do not have the luxury of getting feedback from our audience this afternoon, I'd like to throw in the first question, which I could have probably asked members of our audience to answer, no. Dr. Spiritu, kung ikaw yung aming tatanungin, no, about what you've seen and heard today, given all the technologies and the R&D, of course, results that you've seen, what do you think are the key takeaways that you would like to share with the audience from this year's NRDC?
Yes, good afternoon, Dr. Paringit, and mayong hapon sa lahat. Magandang hapon sa lahat, lalo na po kay Dr. Sumagaysay of the NRCP Executive Director, Ms. Talingnan, and to all my fellow co-researchers and to all the participants of this conference. And first of all, there are three takeaways that I would like to leave the audiences. The first is that we need everyone, including the ecotourism workers, should have backup plans and must be prepared for any eventuality. We should have backup plans like having backup funds and alternative sources of livelihood, and be prepared for any epidemic, may it involve humans and animals. And secondly, I encourage everyone to go visit and enjoy our local tourism destinations, because we can never exhaust the beauty of our province or of our country. And so LGUs must also promote local tourism. And thirdly, in order to gain more visitors and more profitability for our ecotourism industries, I would like to suggest that we need to listen, or the government must consider alternative suggestions like those of the concerned doctors and citizens of the Philippines, which is to flatten the fear and lift the lockdowns through preventative and early treatment home care protocol using ivermectin and virgin coconut oil. And thus we can all rise up and open more our economy, and also have immune system boosting so that Filipinos will be healthy and can go around as usual as before, like before. Thank you very much. Thank you very much, Dr. Paringit, and thank you to everyone.
Yes. Thank you very much again, Dr. Spiriti, for answering that questions. I think what you have shared with us in the studies that you have conducted on the ecotourism might as well apply to all of the things that we've presented today to other sectors, probably in the industry as well as in commerce. These are all the things that you shared are very much applicable. I'd like to give the floor to Dr. Aristotle Abando by sharing his thoughts on his experience undertaking this project of his. I think this is a recurring question among all the those that are presenting today. How did you cope? How did you manage? How did you succeed in carrying out your research project, even while you are dealing with the challenges brought about by the pandemic, the restrictions, the lockdowns, the quarantines, the ever-changing statuses or statuses of our quarantine. We'd like to know your secret, if you care to divulge it, Dr. Obando, please.
Thank you very much,
Dr. Eric. I hope you can hear me. And thank you, DOST, for this opportunity to present our project to this conference. Yes, indeed, we actually encounter a lot of challenges. Our DOST Cradle project consists of two phases, phase 1 and phase 2. Wherein phase 1 was the hardest part since we have encountered the lockdown during that time. Fortunately, with the support of the university administrator at De La Salle University and coordination with the ITS, we were able to set up the supercomputers at the Laguna campus of the LSU. This enabled us to access through remote access the supercomputers and allowed our researchers to continue the research using finite element analysis. You know, finite element analysis is a computational approach, and this is what we actually do to enhance the designs of the semiconductor product. Through the coordination as well with our partner, Integrated Microelectronics Inc., we were able to set up a weekly meeting, an online meeting, wherein we try to compare and validate the results that we have to the experimental results that they have in the line. So we were able to be very productive using that approach. And we have progressed the same methodology for the phase 2 project. And now we're actually focusing on semiconductor products for automotive industry. So that's the main focus of the phase 2 project. So thank you very much.
Yeah, thank you, Dr. Bando. I think one of the key takeaways from your response was that the institutional support is also a key, right, in making sure that you will be able to fulfill all of the the commitments that we have in line with this project. And we salute you in getting this through. We have faced during this pandemic. Next up, I'd like to address the next question to Dr. Johnny Batalon on Picard's efforts to reach out. I'm sure there are a lot of there's an arsenal of technologies that have been accumulated at Picard for the long while, and I think some of them are really shining out. Are shining out during this time of pandemic. I just like to know what inspired you to making this happen. What and how will all of these technologies bring us all back to our feet and recover, maybe at an accelerated pace. Could you share share? Could you share to care to share your thoughts, Dr. Batalon, please?
Okay, thank you very much, Dr. Paringit, for that very interesting question. Yeah, as you would observe, actually, most of our projects presented have used the technologies that were already developed. And actually, we identified for each of these projects the appropriate beneficiaries who should be involved in these projects. So this made the whole process of project implementation easier for us. So we were able to see and gather immediate outputs and outcomes of these initiatives, despite of the pandemic that we are in for 2 years already, almost 2 years already. So majority of these initiatives actually were able to provide immediate food need of the households and livelihood assistance through our approach is actually a community-based approach. And of course, it was mentioned the provision of various trainings to the various communities. And this have actually made the beneficiaries empowered, they are capacitated, and they become resilient for sustained livelihood undertaking to help them recover from the ongoing pandemic. And this will now be an added weapon of our communities, of our households, to survive the impact of the pandemic to their lives. So I think yun lang, Dr. Paringit, and thank you very much again.
Thank you, Dr. Johnny. Parang there's a Picard technology in every home na ngayon. Ano? Dati, in every farm lang. Pero ngayon, in every home na. No? Very, very interesting. Thank you very much. Next question, let's address this to Mr. Jackie Aquino, who's coming from the Philippine Fashion Coalition. Nakakawaw, no, that we seem to don't have any. We seem to not have any connection with the fashion industry, but here we are talking about, you know, the role of science, technology, and research in the fashion industry. As we all know, of course, you mentioned also earlier that, you know, probably perhaps garments and fashion is not going to be the same on the as we go to the new normal. I just like to get your insights on this view that we might not have to wear the same things that we were wearing before the pandemic. How will the pandemic change the way how we view our fashion and garments industry, Mr. Aquino?
Thank you so much, Dr. Paringit. That's a very interesting question. We in Philippine Fashion Coalition, of course, we decided to approach the whole pandemic on a very practical level. So how can we help our design communities? So upon consultation with CSC through the Davao Fashion and Design Council, who came up with this interesting project on the PAO, on the protective outerwear, we thought the best way to jumpstart our industry, that this was late last year, was to somehow utilize everybody's talent into creating something that will protect our fellow Filipinos. The sad part was fashion was deemed non-essential. That's your mindset. You have to remember, in any culture, in any civilization, there are only three forms of art that are always remembered: architecture, the visual arts, and costumes. The way the Philippine Fashion Coalition sees it moving forward is we have to be sustainable. Meaning, moving forward, for us to survive as a country, dapat natin tangkilikin ang sariling atin. What we can produce here in the Philippines is what we should be wearing, what we should be proud of wearing, and what the world should see us as a Filipino and as a country. That's it.
Thank you very much, Mr. Aquino. Truly, you really set the, you know, hit the right areas there when you said, you know, we will only be remembered for where we live, what we do essentially, and what we wear. Sometimes we are judged actually by what we wear, but in this time of wearing PPEs and masks, it seems that we're all sort of anonymized, no? But somehow there's still that, you know, that inner clamor to, you know, to be identified. You know, there's this sense of identity that's really shouting out, no, in that aspect of our humanity. Thank you. We have this very specific question. This for Dr. Obando. Somebody wanted to ask, coming from Engineer Nenet Grasa in our Q&A. She wants to ask, what are the other important applications of mathematical modeling for systems optimization? I believe you were, trying to use this to optimize the packaging technology for ICs, no? And but maybe she wants something. Maybe she's trying to explore other possibilities in this area of research. So, can you share your thoughts on this, Dr. Obando? Thank you.
Yes, sir. Thank you very much, Dr. Eric. Hi, Ma'am Nenet. How are you? I hope you're fine. And thank you for the question. Actually, the computational approach, marami kasi yan. We can actually do optimization. I have research on applications of computational approach specific with optimization on energy. But specific for this project, in-apply natin ang computational approach, yung finite element analysis for the design of semiconductor packages. And we all know
semiconductor packages, it has actually a very strict standard, and the standards are quite accepted globally. Kailangan mag-adhere yung design ng isang semiconductor sa abroad. Of course, this would be used by big brands, and of course, the reliability has to be there. And we have to ensure that the products are reliable and would actually perform well, even if we apply high thermal loads or even in low thermal loads. So that's why in this project, we, together with Integrated Microelectronics Inc., we try to reassess those semiconductor packages using finite element analysis. The good thing about this DOST Cradle project, we have encouraged our graduate students to engage with the industry. And on a weekly basis, we are meeting with IMI, and together with the engineers, we try to set the model initially, develop the model, and agree on the model, of course, with the validation in their line, so that we would be able to have an enhanced or improved design once we try to simulate it. And with this, we also would like to thank DOST P-Shirt and DOST in general for allowing us to conduct this project, allowing our student and the semiconductor industry to engage and strengthen the collaboration between academia and the industry. So again, thank you.
Thank you, Dr. Obando, for the information of everyone attending this conference. If you do not know, the project that Dr. Obando was mentioning is through of course, our Cradle program, no, where we try to partner researchers with their industry counterparts to solve actually the problems or issues being encountered by the latter. It could be a good model actually for industry, academe, or RDI collaboration. Siguro mga short questions na lang, no, because I think we're wrapping up our session this afternoon. Siguro babalikan ko kay Dr. Johnny about again yung ating arsenal of the Picard technologies. Malamang dito pagkatapos nito dadagsain ka ng mga tanong about where do you find this, no? Do we get this from the Picard website? Is there an app that we can access? Are there reading materials that we can download off the internet? Sir Johnny, bigyan mo naman kami ng idea where to find all of these things that you presented earlier, because I think everybody's going to want to grab a copy. Thank you.
Thank you very much again, Dr. Paringit. Actually, those technologies, so kung kailangan nyo naman yung information materials, you can get it, actually access it in our e-library. They are available in that facility namin. And then we also have the website wherein you can also be provided with how to access those materials using our website. So, buksan nyo lang yon, and then ida-direct kayo actually kung saan pwede i-access ang mga information, even yung mga hindi kasama doon sa mga technologies that we have just presented. So marami, it's a lot of materials that you can access to that facility. Thank you. From that facility, I mean. Thank you.
Yeah, thank you, Sir Johnny. Maybe one last question for Sir Jackie. Curious lang ako kasi parang of course you discussed about the protective outwear for government workers or government employees. Is there something in the offing also for the private sector?
Well, we are now partnering with a lot of people from both private and public sectors. PFC is a new organization. It's the first attempt, and finally, once and for all, to unify the entire fashion ecosystem over the country. So we have many projects that we are lining up, and we encourage everyone to reach out to us so we can be your partners in moving forward. You have to remember, for the Philippines to survive, we have to be self-reliant. We have to ensure that everything we make can be used and by everyday people. So that's very important. We have to change that mindset. We cannot forever be reliant on importing everything. But what is more important is what we can use here in the Philippines. We have a very rich country. Our dream for the coalition is to once again make textile industry a viable solution for the future in 10 years, hopefully. So that's the private sector that we are asking to be a partner with, because we know government will always be with us. As long as we hold hands, we'll get there. That's very important.
Thank you very much, Sir Jackie, for sharing those thoughts on sustainability, on adaptability, and of course, also ensuring that we also serve the best interests of our workers, be it coming from the private or the public sector. I think we do have this need, no, to somehow adapt, no. Dati kasi parang concept natin lahat dapat tayo naka-bunny suit, no. But that's not, I think, that's not our climate, no? Hindi siya, we didn't think of that when the beginning, but slowly but surely, I think as we're getting along with this new normal, we have to really adapt. So by way of maybe just wrapping up, siguro I just like to get your thoughts kasi why are you kaya together, no? You're so diverse. Somebody's coming from the agri, somebody's coming from the fashion industry, somebody's doing some sort of optimization in the electronics industry. But I see some integration. I see some connection in you. Ano kaya yung mga yun? Can you share your thoughts? Can you look at the other screens, that your neighboring screens, and share ano kaya yung inyong yung connectedness, no? How will you connect? Is there an area for collaboration amongst you now? Tingin nyo? As a way to wrap this.
For sure. We're all related. Our ecosystems have to work with one another for all of us to survive. We will depend on what science gives us. We will depend on what technology gives us, what our culture gives us, and what our tools. Like for Dr. Belinda Espiritu, to be able to protect our natural resources, our friendly ecosystem, we have to protect our culture. And we have to give it time to breathe and somehow also grow on its own and let it cure and rest during the time.
And maybe this needs also some kind of simulation in order to achieve optimization, di ba, Dr. Obando, no? It's one field. Probably somebody asked, where could you apply this technology on mathematical modeling? That's where also Dr. Obando's group can come in. So I do hope to see all of you also collaborating and working with each other in the future. But for now, let's wrap up. Thank you very much again to our dear speakers for this afternoon's the second part of this afternoon session. I think you made all our time worthwhile. Thank you very much for all of your presentations and your engagement in this short Q&A session. So let me go back to Diane for the wrapping up of today's events. Thank you and good afternoon.
Thank you so much, Doc Eric, for another meaningful discussion with our speakers. Maraming salamat din po sa ating mga speakers. Congratulations on your projects, on your R&D initiatives and projects. And we are optimistic, that these R&D initiatives will bring our local industries on a higher level of productivity and sustainability with integration. Sabi nga ni Doc Eric kanina, with integration and collaboration and simulation. So that concludes our final open forum for the day. And may I request all of our speakers this afternoon, the first batch and the second batch, to please stay with us with your video cameras on, together, of course, with our dear moderator, Dr. Eric, to please join us for a virtual photo opportunity. Okay, I'm seeing everybody now on screen. Thank you so much. Okay, and we are also requesting the presence of our DOST officials to please join us in this last photo opportunity, this first day of our 2021 NRDC. Okay, are we fit in one frame? Okay, we are fit in one frame. Okay. All right. So I think we are all complete. And again, as we do it, on my cue, we will count to 3 and we will all say NRDC. Okay. All right. And 1, 2, 3, NRDC. NRDC. Okay, one last. 1, 2, 3, NRDC. Okay, can we all give a virtual applause to all of our researchers, all our participants this afternoon, this whole day of our NRDC. Maraming salamat po to our moderators, Dr. Montoya, Dr. Peringit, Secretary de la Peña, Undersecretary Guevara, and to all the DOST officials who joined us in today's event, and of course, our participants here in Zoom and also those joining us in Facebook Live and in YouTube. As we conclude today's conference, all of the R&D projects, programs, technologies, and initiatives were a testament of how we have strived not only to survive during these challenging times, but also of how we have thrived. In keeping today's momentum, I would like to invite everyone again on the 17th of November, 2021 for the second part of our 6th National R&D Conference. And I am sure that you will all find next week's event as engaging, as informative, as fruitful and meaningful as it is today. So please block off your calendars on November 17 and we will be seeing you again. This has been your host, Daan, leaving you with the idea that through R&D, the road to recovery is now ready. Magandang hapon, magandang agham po sa ating lahat.
Thank you, everyone.
Thank you po.
Thank you, ma'am. Thank you. Indo.
Thank you, Tindo.
Congratulations.
Textile industry.
Congrats.
Thank you po.
Congratulations, Yusek and everyone to the OSTC. Thank you, bye po.
Thank you. Bye-bye.
Our mission
Thank you, Yusek Gab and
science,
UST.
technology, and
Congratulations.
innovation as it plays a vital role in the inclusive growth and development of Philippine textiles and its allied industries. We focus on applied R&D in transforming our Philippine natural textile fibers for various applications, as we also continue to look for other potential textile fiber sources with the goal of creating 100% Philippine-made textiles. PTRI aims to set world-class Philippine textiles. With expertise in the production of innovative yarns in blends of cotton with abaca, banana, and pineapple leaf among others. The Institute has expanded the yarn production capacity to the countryside through its Inclusive Innovation DELA program. PTRI's physical and chemical testing facilities offer a wide range of assistance to the textile industry through timely and internationally recognized standards of tests for raw materials and finished products for performance and property testing. The PTRI also has the only geotextile testing laboratory in the country, catering to the needs of the geotextile sector. The development of technical competence in textile production in the handloom weaving sector in particular, and quality assurance in general, is evident in the on-ground technology transfer projects conducted in several regions of the country. Handloom weaving has always been part of the advocacy of the Institute to weave arts and culture together with science and technology. PTRI equipped various communities with skills, know-how, and implements suited to their needs to increase their productivity, spur innovations, and promote their economic growth. As the lead agency focused on natural dyes R&D, PTRI continuously endeavors to fill the supply chain gap of the natural dyes industry by establishing production hubs and facilities. PTRI TBI is a core facility capable of scaled-up natural dyeing and color innovation for startup companies looking to commercialize natural dyes. We develop eco-friendly finishing technologies for the creation of functional textiles and products such as mosquito repellency and antimicrobial treatment technologies. We aim to maximize the use of local, tropical fibers and fabrics for government uniforms and mainstream use. The technologies we develop for this purpose employ methodologies and use materials that promote circularity and ecological balance. The PTRI Perfect Fit Textile Product Development Center aims to provide an integrated product development system that is, from measurement taking to designing to prototyping, to assist the creative industry and micro, small, and medium enterprises in their product development process in a quick and cost-efficient manner. We, at the PTRI, have always been conscious of the role we play in support of the textile industry. PTRI aims to see our local textile industry achieve global scale and prominence through homegrown technology and ingenuity. Tela Pilipinas, Gawang Pilipinas, Galing Pilipinas.